doing right now. 24% disapprove. So since May, and that's when David Coletto says his approval peaked, was in May. Since then, it's down 8 percentage point, and disapproval is up 9 points. Still wildly popular among PC voters, 83% approval. 40% of Liberal voters would approve, and NDP voters, he says, are the least likely to approve, 28% most likely to disapprove. School reopening, he says, David Coletto says, is the only item Abacus tested where more people disapproved than approved, the situation with the schools. But what do you make of these numbers, Andrew?
Yeah, I'm sure the Premier's team is looking at these closely, wondering if they missed their window to trigger an early election. I do agree with Neil in that I think the numbers are still quite healthy for Ford, healthier than most prior to COVID, when they were embroiled in other issues to do with schools. But you talked earlier before the break about Ford Nation, and you talked about the importance of the 83% of PC voters who are supporting the Premier. And I think it's important to remember that when we look at Ford Nation, the Premier's coalition that brought him to this victory, that obviously encompassed a huge share of that PC brand. So I'm actually most surprised to see in this Abacus poll that the Premier still enjoys the support of 83% of PC voters. Because what I found in the conversations I'm having with Conservatives, yes, they're worried about the health impacts of the pandemic, but they really take a much more pragmatic and holistic approach in terms of being worried about the direct impacts of what we're feeling right here and now. Neil talked about them in terms of these ever-changing regulations, businesses that just catch up with them just to have them shut down. Yeah. And, in the Conservative Party, you can be a populist Premier who fights for businesses, or you can be a conservative, but you can't be neither. And the group of people who are insisting on shutting everything down almost completely is comprised of those who have not, who have not had to worry about a stable paycheck and haven't had to worry about losing their job.
Part of the whole Ford Nation brand, Andrew, is open for business, right?
That's right. That's right. And as I was saying, the people who are making these decisions, our politicians, are no different, right? They haven't had to worry about receiving a paycheck. They haven't had to worry about their job. So until we get to a point where, an election is omnipresent, then I don't think we're going to see a huge policy shift on that side.
Okay. All right, let's move on to one more. We're going to play another clip here of the Prime Minister yesterday. It's all Harper's fault. Cuts to public health, all Harper's fault.
That under the previous conservative government, there were massive cuts to science. There was marginalization of scientific voices. There was a putting aside of experts in an attempt to cut the budget, cut the deficit at all costs on the backs of Canadians. We made historic investments in science. We've worked to restore many of the cuts made to our institutions over 10 long years. We will continue to work with our scientists and our experts every step of the way. I'm pleased to be working with the Public Health Agency of Canada every single day to ensure we're doing everything necessary to keep Canadians safe during this pandemic, and we will continue to focus on doing what is necessary to support Canadians.
Okay, it's all Harper's fault. Well, at least he didn't, Neil, at least he didn't blame Mike Harris. That's usually what Liberals do. It's all Mike Harris's fault. But is there a statute of limitations on blaming the previous government? What do you think, Neil?
Yes, 100%, and it's called a majority government.
Okay.
I was fortunate enough to work in the Harper government for the full 10 years that he was in power, that he had government, and from 2006 until 2011, we were mildly justified by pointing at the Liberals' record because we were in a minority situation and there was no easy way to change big things in government. The one that jumps out to me most is the long gun registry. For 5 years in a minority parliament, we were unable to make changes to the long gun registry. As soon as the Conservatives won the federal election in 2011 with a majority, one of the first items on the notice paper was to reverse the long gun registry and abolish it. Mr. Trudeau came to government in 2015 with an overwhelming majority. He could, that first day in 2015, could have reversed everything that the Harper government had done in 10 years. But he chose not to. He studied, he contemplated, he had panels. What stands out for me for the first 4 years of his majority government is he brought in 25,000 Syrian refugees, which was fantastic. And he legalized marijuana, which is, who cares? So to stand here now, 6 years later and say it's all Harper's fault when he had, 4+ years to reverse everything is ridiculous. He came to power. He came into government saying he would run small, modest deficits. He ran larger deficits, and through that deficit spending, he could have reversed all of the Harper cuts, as he likes to call them.
Certainly could have invested in emergency stockpiles, in public health intelligence.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
For 25 years, you've been helping to make our roads safer by doing the right thing. You've been the designated driver, you've stayed over, called home, you've called a cab or a friend, and planned ahead. Let's keep doing the right thing. Support sober driving by getting yourself and your friends home safely.
Do the right thing.
Visit ArriveAlive.org to find out more. Arrive Alive. Drive sober.
Play 4 games of bingo from the comfort of your own home each Monday at 7 p.m. for your chance to win money from our $2,000 regular bingo or $5,000 super bingo night. Kiwanis TV Bingo, Mondays at 7 p.m. on Rogers TV.
This is Rogers TV, Ottawa.
Few reminders for today's meeting, which is being held using Zoom. Members of council and staff, please stay on mute at all times unless called upon to speak. Members of council, if you wish to speak to an item, please use the raised hand feature located at the bottom of the participants list in Zoom, and *9 for members calling in from the phone. The meeting will be broadcast on Rogers TV. Members and staff are asked to position their cameras so that their faces are centered and as close to the top of the frame as possible. And phone-in participants, please do not put the phone on hold. Well, it's a real pleasure to welcome a new member of City Council to the Council chambers for her very first City Council meeting as the representative for Cumberland Ward. I would ask Rick O'Connor to come forward to swear in Catherine Kitts, who was elected with a decisive victory just a little over a week ago in the riding of Cumberland, replacing our colleague Stephen Blais. Congratulations, Catherine, for running a great campaign, and a real pleasure to welcome you. And Mr. Clerk, if you would proceed with the swearing in and the signing of the documents, please.
Please repeat after me. I, Catherine Kitts, having been elected to the office of councillor in the municipality of Ottawa, do solemnly promise and declare that
I, Catherine Kitts, having been elected to the office of councillor in the municipality of Ottawa, do solemnly promise and declare that
que je m'acquitterai fidèlement
I will truly, faithfully, and impartially exercise this office to the best of my knowledge and ability.
de mes fonctions au mieux de mes connaissances et de mes compétences.
I have not received and will not receive any payment or reward or promise thereof for the exercise of this office in a biased, corrupt, or in any other improper manner.
I have not received and will not receive any payment or reward.
I will disclose any pecuniary interest, direct or indirect, in accordance with the Municipal Conflict of Interest Act.
Pécuniaire, direct ou indirect, conformément à la loi sur les conflits d'intérêts municipaux.
I will be faithful and bear true allegiance to Her Majesty Queen Elizabeth II, and I make this solemn promise and declaration conscientiously believing it to be true and knowing that it is of the same force and effect as if made under oath.
I will be faithful and bear true allegiance to Her Majesty Queen Elizabeth II, and I make this solemn promise and declaration conscientiously, believing it to be true, and knowing that it is of the same force and effect as if made under oath.
Thank you, Councillor. Can you kindly sign the document, please?
Thank you, Mr. Clerk. We'll ask Councillor Kitts to say a few words. Councillor.
Thank you very much, Mr. Mayor and Mr. Clerk. I'm very excited, proud, and honored to be here. A very big thank you to everyone in my ward of Cumberland Ward. I'm very excited to represent you here at City Hall, and I thank you to all my colleagues at City Hall for giving me a very warm welcome in this last week here. Thank you.
Thank you very much. Merci beaucoup. Just have a seat. I have just one moment. Okay. We'll have one other presentation. We're going to take a 5-minute recess to get the room set up for the council meeting. So those of you on Zoom, if you could just put us on pause for 5 minutes. On va retourner dans 5 minutes. Merci. Thank you. colleagues and members of the public and members of the media, we have another ceremonial event that I'd like to talk about for a moment. I have the pleasure of making a very special presentation to one of our colleagues. The Province of Ontario, through the Ministry of Municipal Affairs and Housing, has a long-standing service award that recognizes elected officials who have at least 25 years of elected office. Today I have the honor of presenting this award to Councillor Diane Deans virtually, as she has officially reached her 25 years of service as an elected official just last year. Councillor Deans, I know I speak for many people when I extend my congratulations to you on this milestone. This is one bit of good news that's come out of 2020. First elected in November of 1994 as a city councillor, Councillor Deans has continued to represent Gloucester's Southgate ward for almost 26 years. Councillor Deans has held many leadership positions during her time with the City of Ottawa, including being Chair of the Transit Commission and Chair of Community and Protective Services Committee. She has also served on numerous committees and boards during her 25 years of service, including Ottawa Community Housing, the Ottawa Public Library Board, and two of the more fun boards that no longer exist for us, the Canada Central Exhibition and the Pineview Municipal Golf Course. She currently serves as Chair of Crime Prevention Ottawa and Chair of Ottawa Police Services Board. Councillor Deans was also strongly in favour of putting a greater focus on women and gender at City Hall, and with her advocacy we are proud that we were able to create the city's first ever council liaison for women and gender equity, held by Councillor Teresa Kavanagh. We also created a permanent staff position within the City of Ottawa for a women and gender equity specialist to ensure that this work continues. Councillor Deans continues her work on this as a member of the Council Sponsors Group. As Chair of the Ottawa Police Services Board, she worked hard to hire our new Chief of Police, who celebrates his one-year anniversary later this month, Chief Peter Slowly. Diane, you've been serving your ward for almost 26 years, and I know you always have their interests at heart. You're a passionate councillor, and it's my pleasure to recognize your work with this presentation of the award on behalf of the Honourable Stephen Clark, Minister of Municipal Affairs and Housing. I'll hold it up here. It's very hard to see, but it's a very beautiful gold pin from the Ministry of Municipal Affairs and Housing. And we'll make sure that we get this to your office, and sorry we had to do this virtually, but I'd now like to ask you to say a few words on this very happy occasion of your silver anniversary as an elected representative in the City of Ottawa. Councillor Deans.
Well, thank you very much, Mr. Mayor. And, you know, if this was the Academy Awards, someone would suddenly just appear here and present it to me, but I guess we're not just quite that sophisticated. But I remember my colleague, Councillor Marianne Wilkinson, the day you presented the award to her, and she said that it was worth sticking around for 25 years to get that pin, so I'm glad I managed to meet that milestone. I wanted to take this opportunity to thank my family and my friends and my colleagues who have supported me on this journey over the last 25 years. It's not a journey that you take alone, and certainly your family, all of you around the council table know that your family is very impacted when you put your name on that ballot and stand for public office. And so I'm very grateful to all of them. My daughter was 5 years old when I got elected to council, and looking at her today, the smart and accomplished and grown woman that she is a constant reminder to me of the years that I have served the city. You know, the local government, to me, in my mind, is the government that is closest to the people. I don't think it's a cliche. I think it's a reality, and I think the reality is it's where you can make the greatest difference. And I really feel, I never felt that I was on council to take up a seat. I always felt that I was on this council to make a difference, and I strive to do that every single day. I wanted to just give you a couple of my own personal highlights of things that I feel working very much with the community I was able to accomplish. And one of them was way back at the very beginning in the 1990s, pre-amalgamation, when I first took a seat at the council table. Do you know that there was not a single woman on the fire service in the City of Ottawa? And it was Councillor Elizabeth Arnold and I together that teamed up to smash that glass ceiling. And I've always been proud of that. When I see women serving on the fire service today, I know that had to happen to break that ceiling. I'm very proud of that accomplishment. I've also been on the council that has presided over the signing of 3 LRT contracts. And I say 3 maybe the first one was, in my mind, the best one, because it was 29 kilometers of track from Barrhaven to Ottawa U, and it was under $1 billion, but that was the big fish that got away. But nonetheless, we have moved on with LRT, and hopefully we'll see more LRT success into the future. I'm also really proud of the work I did on lifting up low-income communities. I think BBRN has been a success, but I think we need to do even more. And I think this whole COVID thing has shown us that the foundational pieces of poverty, of homelessness, of mental health and addictions issues really need to be addressed in order to have a community that we can be proud of. And I've known that for a long time, representing low-income neighborhoods, and I think we've all seen that now, and hopefully this council will renew their efforts. There's also been some bricks and mortar I've been proud of, certainly the expansion of Greenboro Community Centre and the Hetherington Rec Centre, and especially the Greenboro Library was a project that was 12 years in the making for me, and I think City Council just got tired of listening to me and finally decided to build the library. But however it gets done, it got done, and I was very proud of that, and I remain proud of that. And when I see all the young families from all over the world that have come and settled in Ottawa and used that library as a lifeline, I take a great deal of pride in that. I want to just take this opportunity to thank the people of Gloucester Southgate Ward for having put their faith and their trust in me for 25 years, and I hope they will continue to do so. I thank my colleagues. It is with a grateful heart and a steely determination to make the city a better place that I come to work every day. And of course, we all know this: the work is never done, but it's not the journey, it's not the destination, it's the journey that's important. And I'm happy to be able to continue this journey. So, thanks, Mr. Mayor, for this honor today. I'm very appreciative.
Great, thank you very much, Councillor, and congratulations again. Madam Deputy Clerk, roll call, please.
Councillor Luloff.
Present.
Councillor Dudas.
Ici.
Councillor Harder.
Here.
Councillor Suds.
Here.
Councillor El Shantiri.
Present.
Councillor Gower.
Présent.
Councillor Kavanagh.
Here.
Councillor Shirelli.
Here.
Councillor Egloy.
Here.
Councillor Deans.
Here.
Councillor Tierney.
Présent.
Conseiller Fleury.
Bonjour.
Councillor King.
Here.
Councillor McKenney.
Present.
Councillor Leap.
Ici.
Councillor Brockington.
I'm here.
Councillor Menard.
Here.
Conseiller Cloutier.
Présent.
Councillor Kitts.
Ici.
Councillor DeRuse.
Here.
Councillor Moffat.
Congratulations, Councillor Deans and Councillor Kitts. Je suis présent.
Councillor Meehan.
Here.
Councillor Hubley.
Here.
Mayor Watson.
You see?
You have a quorum, Mr. Mayor.
Thank you. Confirmation of minutes, adoption de procès verbaux pour la réunion le 23 septembre 2020. Carried. Declaration of interests, including those originally arising from prior meetings. Déclaration de conflit d'intérêt. Are there any? No. Communications as presented. Regrets, no regrets filed to date. Motion to introduce reports. Motion portant présentation de rapport. Councillor Egloy, please. Seconded by Councillor Deans.
Mr. Mayor, the Agriculture and Rural Affairs Committee Report number 16, Audit Committee Report 7, Finance and Economic Development Committee Report 17, Planning Committee Reports 30 and 31, Transportation Committee Report 11, and the report from the City Clerk entitled Summary of Oral and Written Public Submissions for Items Subject to the Planning Act, Explanation of Requirements at the City Council meeting of September 23rd, 2020, be received and considered.
On the motion. Carried?
Carried.
Adopté. Well, good morning, everyone. Bonjour tout le monde. And again, congratulations to Councillor Kitts and Councillor Deans for your achievements today at City Council. I want to thank everyone for joining us, including those members of the public and media who are watching on the City website or on YouTube. I hope everyone had a nice Thanksgiving and had the chance to get outside and take in some of the beautiful fall colors throughout our city. I want to take this opportunity this morning to thank residents for adhering to the provincial orders on gathering limits over the holiday weekend. I know it's hard, and we really want to see our family and friends, particularly on special occasions like Thanksgiving. Our staff from Bylaw and Regulatory Services were hard at work over the weekend, and I'm happy to say that most people were following the provincial orders and the guidelines issued by public health officials, both province-wide and locally. Bylaw conducted more than 200 proactive patrols of businesses and restaurants across the city over the weekend, and most were found to be in compliance with provincial orders. A total of 6 charges were issued under the Reopening Ontario Act. 4 for employees failing to wear masks, an $880 fine, 1 for an open fitness center, and 1 for a restaurant permitting in-house dining. There were no charges for gatherings of more than 10 people inside a private residence. I also want to remind everyone that as of yesterday, OC Transpo began issuing tickets to those not following the municipal bylaw on wearing a mask while on OC Transpo property or riding a bus or train. Yesterday, we had 6 customers denied access, 1 was fined, and 51 were told to adjust their masks as they were not properly covering their face. The message is simple. Please wear your mask when using public transit. Veuillez porter votre masque lorsque vous utilisez les transports en commun. Of course, yesterday presented another unique challenge for OC Transpo due to the bomb threat. I'd like to take this opportunity to thank staff, our special constables and first responders for quickly acting and keeping our transit users safe, as well as those living and working around the station. And particular thanks to our OC Transpo Chair, Alan Hubley, and Vice Chair Jean Cloutier, and our staff led by General Manager John Manconi. I know today, for instance, I tweeted about this when I was on the bus and the train this morning coming into work. Everyone on the bus and everyone on the train was wearing their mask, so it's great to see that level of compliance, but also a reminder that these tickets are over $250, and it's not just about hitting people from a financial punitive point of view, it's about protecting other people's health on the trains and the buses. I know these have been extremely challenging 7 months for everyone in our city. Je sais que les 7 derniers mois ont été extrêmement difficiles pour tout le monde dans la ville. And with the numbers of COVID-19 cases rising in our community, we're certainly not out of the woods. Friday's announcement regarding tougher restrictions for our city, along with Toronto and Peel region, from the province demonstrates the severity of the situation we currently face. I have no doubt that Friday's decision by the province is likely one of the most difficult decisions the Premier and his cabinet have ever had to make. Je ne doute pas que la décision prise par la province est probablement l'une des décisions les plus difficiles que le Premier ministre et son cabinet aient jamais eu à prendre. But we must remember that the health and safety of our residents is our top priority. I realize that this is another significant hit to our local businesses and economy. I've been speaking with Premier Ford and Minister Phillips about the supports the province will be introducing to help the businesses and employees affected by this latest decision. The 28-day temporary closure will most certainly have a significant impact on our local economy, particularly our small businesses on main streets in all parts of the City of Ottawa. Over the past few days, I've heard from business owners and representatives, and I can assure you that I understand your concerns. I want to thank Councillors El Shantiri and Harder for bringing forward a motion that seeks to provide greater clarity on the decision to move Ottawa back to Stage 2. I know that there are many people in our community who want to help. Je sais qu'il y a beaucoup de gens dans notre communauté qui veulent aider. If you have the means, I encourage you to do your essential shopping at small businesses and consider ordering takeout or buying gift certificates from your favorite restaurants. I also want to thank Premier Ford, who informed me that businesses affected by the closure order will be eligible for a refund on their property taxes, hydro, natural gas, as well as other overhead costs. I'm committed to working closely with my council colleagues during the development of our 2021 budget to see what can be done to provide more support to our local businesses struggling through this pandemic. Ultimately, this decision by the province should give us pause and reflect on our actions as we go forward. If we want to see these closures to only last 28 days, it means we need to follow the advice of our Dr. Etches and our local public health professionals. Local businesses and Ottawa residents have shown resiliency throughout this pandemic, and I have no doubt that we'll be able to weather this latest setback. Assisting our most vulnerable residents has continued to be a top priority. Today, we're announcing that with the closure of the McNabb Arena as a respite center, the city is opening the upper level of the Tom Brown Arena as a respite center by early November. The Tom Brown Arena Respite Center will offer numerous services to our most vulnerable residents, including a place to rest during the day, shower, and use restroom facilities. The center will also provide clients with essentials like towels, toiletries, food, clothing, and referrals to social programs and crisis intervention. To prevent any projected service gaps with the McNabb Arena Respite Center closing, the city is providing additional funding to 4 different day programs, community health and resource centers, including Centre 454, Centre 507, The Well, and the Somerset West Community Health Centre. This will allow community service providers to resume services safely, as well as expanding much-needed services, including showers and washroom facilities, to people experiencing homelessness. Clients who have been using the McNabb Respite Center have been informed of the site's closure, and they have started using the community services at day programs and community health and resource centers. The Tom Brown Respite Center will be open until the end of the winter, at which time we will assess the need as well as the current COVID-19 situation. My thanks to Donna Gray, General Manager of the City's Community and Social Service Department, and Jenna Suds, Chair of Community and Protective Services, as well as the ward councillors, including Councillors Fleury, Councillor Jeff Leeper, and Councillor Catherine McKenney, as well as the team of the Human Needs Task Force for the great work that you have done with the McNabb Center, as well as the work you are doing to set up the Tom Brown Respite Center as we work to help support the city's most vulnerable during this pandemic. On the testing front, we anticipate the East End testing site at the Ray Friel Center to open by the end of next week. My thanks to our colleagues from the East End who have worked tirelessly to make sure that residents in the East End have a more efficient area to stop and get tested. I'm sure most of you have heard me encourage residents to download the COVID Alert app. I'm pleased to announce that the City of Ottawa's IT services will be installing the COVID Alert app on all city-managed mobile devices. My thanks to Jeff Leeper, the chair of the IT subcommittee, who brought forward this idea, as well as Valerie Turner, General Manager of the City's Innovative Client Services Department, and her team in IT, who are working on this initiative. Enfin, j'aimerais partager quelques histoires encore.
Finally, I'd like to share a couple of good news stories with you.
Some of the innovation coming from our local business community. Earlier this month, I had the opportunity to visit a local business in Vars called Innova Tools, which has gone from producing home construction equipment to personal protective equipment when COVID-19 arrived in our community. During my visit, I met with CEO Alexandre Cloutier and his team, who have been hard at work developing a washable, reusable, and transparent face mask. I've actually got a copy of it right here, and it's just missing the plastic ear connectors. But this is what they're producing, 100% in the beautiful village of Vars in Cumberland Ward, Councillor Kitts' new ward. A couple of months ago, the federal government announced that the RCMP will be testing these masks over the next few months as part of the Innovative Solutions Canada program. Félicitations à Alex et à Innova Tools pour votre innovation et succès. I also want to highlight today that Hydro Ottawa has recently received an ISO certification for best practices in asset management from the International Organization for Standardization. Hydro Ottawa is only one of 3 other North American electric utilities that has received this distinction. This certification also aligns with the city's sustainability and environmental priorities. My congratulations to Chair Jim Durrell and CEO and President Bryce Conrad and his team on being awarded this impressive distinctive. I also want to make reference to a very positive announcement that was made by Ministers McKenna and Joly and Fideli in Councillor Eglai's ward, a $7 million contribution to our autonomous vehicle smart farm precision agriculture center located just across the street from the Sportsplex. As many of you know, Councillor Harder has been dogged in her determination to work with other levels of government and the private sector and farming groups and individual farmers to create this smart farm concept that will help agriculture not just in our city but from coast to coast. Councillor Harder has been the champion of the Precision Agriculture Smart Farm initiative for many, many years, along with, of course, the work that's being done by people like Jenna Suds in the West End, Laura Dudas in the East End when it comes to the autonomous vehicle file, which is very important to the future of our high-tech sector. So that was a really great virtual announcement, and I thank our friends Michelle Tremblay and Kelly and Susan and Sonia and so many others at Invest Ottawa for pulling this all together and receiving this very, very good news. I want to close by reiterating the messages to everyone, the message to everyone that the importance of all of us working together to limit the spread of COVID-19 in our community. We all have a role to play. In addition to following provincial orders and doing things like downloading the COVID Alert app, all of us can help stop the spread of the virus by limiting our close contacts as best you can to keep those just within your household, those people who live within your home, keeping trips outside of your home to the essentials, and being COVID-wise. This is one more important thing to add to the list, and of course, that's to get a flu shot. You can visit OPH's website for a list of participating pharmacies, or you can make an appointment at one of the 6 OPH flu shot clinics that will be opening at the end of October. I now ask our colleague Keith Eglai, who's been working very hard as chair of Ottawa Public Health, to offer comments and then hand it over to Dr. Etches, who has a presentation, and then we'll open it up to members of council for questions. Councillor Eglai, please.
Thank you, Mr. Mayor. Good morning, colleagues, including our newest colleague, Councillor Kitts. Welcome. And good morning to everyone who might be tuning in to watch this meeting from home. I'd like to begin by thanking everyone who kept their gatherings small this past weekend. I heard certainly anecdotally from many residents in my ward that they are going to be eating turkey for a very long time because, the turkeys are so the same size they are, but they really did keep their gatherings to just immediate family that was living in the homes with them. So I want to thank people for doing that. I know that was difficult to do. Thanksgiving is traditionally a time when you bring extended family together. At OPH, we recognize that as we grapple with the COVID-19 pandemic, holidays and celebrations are different from what we're used to. We know this is difficult, and we thank you for doing your part. With Halloween around the corner and Christmas on the not-too-distant horizon, I'd like to remind everyone that our actions today determine the pandemic's trajectory 2 weeks from now. We have all been paying attention to the daily COVID-19 data, both locally and across the province. So we all know that more people are testing positive, hospitalizations and outbreaks are also increasing. Dr. Etches will talk about that more in her presentation and provide context around what that means for our city, but certainly these trends are very concerning. In response to these trends, this past Friday, the province announced a rollback to a modified Stage 2 restrictions for Toronto, Ottawa, and Peel region. We know this decision was not taken lightly and that it presents additional challenges for our business community. This is a proactive measure to help us regain control of COVID transmission in our community. Having said that, I'm happy to support the motion brought forward by Councillor Harder and El Shantiri, asking for some clarification from the province in regard to how decisions were made. Throughout this pandemic, Ottawa's businesses and business leaders have been responsive, receptive, and supportive of public health issues. Ottawa Public Health appreciates that and values its relationship with our local business community. In turn, we hope to support them in any way we can through the next month and beyond as they deal with the impact of these new restrictions. We recognize the importance of having a strong economy and a healthy workforce. I encourage everyone to find ways to support local businesses, order takeout from your favorite restaurant, and enjoy a meal or a drink and snack on their patio while you still can, while the weather's still cooperating. Post about it on social media and be sure to tag the business so that others will know where to find them or how to reach them. Buy a gift card or share a link to their website and encourage others to do the same. I also urge everyone to get their flu shot this fall. Last week, OPH published the locations for this fall's flu clinics and a list of pharmacies providing flu shots this year. As members of council know, OPH-run flu clinics will start on Monday, October the 29th, and will be by appointment. Details on how to book an appointment will be released shortly. Staff will also be taking additional precautions to ensure pre-screening and physical distancing at the clinics. Lastly, mobile flu clinics will be announced in the coming weeks. Given the different options available, don't put yourself at risk for the flu and COVID. Please get your flu shot. Colleagues will be aware that the Ottawa COVID-19 Task Force is now coordinating COVID-19 testing efforts across the city based on guidance provided by Ontario Health. I was pleased to see this new development take shape and look forward to continuing improvements to access to COVID-19 testing in our region. In closing, I would like to thank my council colleagues for their continued support. I know that OPH staff have been working hard and facing lots of pressure. Processes continue to be ironed out, and the organization is adapting to ensure continuous improvement as we all learn to live with COVID-19. I will now turn it over to Dr. Etches to provide her update.
Thank you. Bonjour. Hui. I do have a presentation, so I know that will be projected. And my intention is to give you latest information. I'm just trying to move my screen. Sorry. Thank you. And I'm going to start with overall what we're trying to achieve, not just Ottawa Public Health, but our city, our province. So the goals of the pandemic response. On the next slide, please. We are trying to minimize hospitalizations and deaths. That is, clear. I think people speak about that. We're concerned when we see hospitalizations go up and when we see people are dying from COVID. We're also trying to minimize societal disruption. We know that, for example, it's important to keep schools open for child development. We know that people need schools open to be able to work, and we're concerned, for sure about when businesses need to change their practice or close, that it has a significant impact on income and health and mental health. So we are approaching the pandemic to try to do both, tackle COVID, tackle the other challenges around health that COVID presents due to the measures that are being taken. We're also concerned we see some communities and some sectors are more affected than others. And so it is important to continue to have policies that address those with the highest risk and the greatest impact. Here in Ottawa, we have been measuring what's been happening, not just with the infection, but on the people's incomes and their mental health. We've been doing this through surveys in March, again, repeated in June. This information is on our website, and we're currently collecting that information right now through a survey. So we'll be able to report more on that in the future. When it comes to working with communities at higher risk, this is also ongoing work. It includes community leaders, working with leaders of places of worship, and a neighborhood ambassador program that is a partnership across many organizations, the city's integrated neighborhood service team, Crime Prevention Ottawa, the Boys and Girls Club. We have supported youth to work directly on the ground with engaging others in their communities and sharing information using multiple languages, distributing that to people who may not otherwise have them. So the current status is what I'll start with next in terms of then where are we? How are we doing on controlling COVID? And, it's not gotten better since the last time I spoke to you. Things have deteriorated, in fact, quite a bit over the last 2 weeks. We are now in the red status. The tipping point was seen the number of new outbreaks last week double compared to the number of new outbreaks the week before. And again, hospitalizations now increasing. I'll speak a bit more about that in a moment. But on this slide, I also want to really make it clear that this is an Ottawa challenge. That Ottawa has actually the highest rate of COVID, people testing positive for COVID in the province. So just over the last week, Ottawa had 70 people per 100,000 that tested positive, and you compare that to Toronto, had 57. And if you look at the trend, Ottawa's rate per 100,000 grew faster than the rate in Toronto, which actually stayed relatively stable over the last week comparison. So we do know that COVID is showing up across our city, across all geography. We continue to update the maps on our website that are by neighborhood. So the maps are now showing data up till the end of September. That's been updated. Our testing volumes do remain high. They have fallen a bit over the last little while. Last few days around probably some of the measures related to children not needing to be tested if they have only one symptom. Moving to online booking, we've heard that that's had some challenges with people being able to access them. So we're working, the testing partners they've made phone numbers available to book, and they're looking at other ways to make sure that people do access testing. And on our public health front, we do continue to add to our team to be able to do the case and contact management. We are starting, of course, with those in highest risk settings and prioritizing. For example, people who are linked to more vulnerable populations, whether it's long-term care congregate setting, in an outbreak situation, or schools, healthcare workers, etc. We're also using technology. We've implemented this in the schools, especially to reach contacts of someone in a classroom more quickly. And I think I'll just go then to the next slide to speak a bit more about hospitalizations. We are seeing, again, the number rose again, that of people in hospital increase. This number is manageable in terms of just COVID patients that are needing intensive care and ventilation. There is capacity in the intensive care system, but the bed capacity itself is already over 100%. And so people are waiting in emergency rooms. Every day there's a challenge to admit people to hospital. And I've discussed this with Cameron Love, and other hospital CEOs. We know that a big pressure for them right now, straining the system, is the number of people who require an ultimate level of care. And so they are in active conversations with the ministry. They have a plan to be able to increase bed capacity, and they will be able to increase the number of placements, possibilities for long-term care, again, through some added bed capacity that will be coming, before the end of the year. We know that currently, though, the hospitals are having to try to catch up with the surgery and the backlogs of health services that people need for important health problems. There are people waiting. They're having to prioritize their wait list. And even as beds are added, there's still a challenge around the nursing staff capacity to be able to support all of the work that needs to happen in hospitals. Another important thing I want to highlight that people may not always appreciate as we look at who is being hospitalized, it is not only people in long-term care. In fact, 25% of people are under age 65. And we are seeing of those over 65, a significant proportion now are coming from the community. So this reflects the community spread of COVID in our community. I did mention the outbreaks have really grown in number. Again, we see this this is COVID's out there and it's being introduced into different settings. Long-term care, the encouraging thing I am seeing in long-term care is that people are keeping the number of infections lower. When an outbreak is declared, the majority now have less than 5 people testing positive, and it's mostly staff. And so this is encouraging, but there are situations where that it has been worse. So we see the outbreaks are in schools. They're in, I think we have 10 active outbreaks now. I guess I'll speak about schools in a moment. And so this is where we are. This is our current situation. I want to go to the next slide, which is also to provide information about where we could go. And we did this in the earlier days of the pandemic. We saw that models helped us understand what's the trajectory. And some people may now think that, oh, this isn't really going to come to pass, because in March we flattened the curve. We actually did that effectively. We were successful through people changing their behavior and keeping 2 meters from others. And this trajectory, though, shows us if we don't decrease the close contacts we have and the opportunity for transmission in our community, we can get into over 200 people testing positive by the end of October, 300 mid-October, 400 by early December. And I actually want to pause here because I think there's an important piece of data that just came into my inbox that I would like to share with you. I'm going to share my screen. Hopefully I can do this. Maybe I don't have permission to share my screen. It's the sewage wastewater data. Oh, host is disabled. Okay, I'm not able, unless that can be changed, I'm not able to share my screen with you. But I will recommend then for your viewing, I don't think that I can do it, the wastewater data, which is very useful to us to get a sense of what is happening with the virus in our community, because it's not related to anyone taking decisions about whether they will go get tested. It doesn't have the lag time for how long it takes to get a test result. This is measured. Oh, maybe I can. Okay, share my screen. There's something changing here. Oh, yes, great. Okay, thank you. Super. Okay, I just need to, there we go. I think we've got it. So I want to show you, this does tell us right yesterday what was measured in the water. And there's a 5-day average, which will smooth things out in the blue line. And it shows how it's correlated with the number of people who are testing positive. The more yellow line there. We see actually there's a little bit of a stabilization in terms of the number of people testing positive, it looks like, but that's in opposition to what is being measured over the last few days. And so we saw the testing numbers go down, the number of people showing up at testing sites. And so we just may not be detecting everything that is out there. We know that. And I want to show you, this looks very exponential, right? So this is the curve that we're on, that COVID does grow. It doesn't take long. We have the stories. We've shown how one person testing positive can quickly become 40 or 50 within a matter of just over a week. And so this second graph now being projected is the daily average viral count. And so you can see even over the last few days, it's going up most steeply. So thank you. That is what I wanted to share. And I can go back to the presentation. I know that there is interest in what is the data, what is the evidence behind some of the settings that have been targeted with provincial regulatory changes. And so that's on the next slide. So, bars and restaurants closures is extremely difficult for people who have perhaps already spent their life savings, who have already become unemployed. There's no question that there's going to be hardship and that any government support to businesses affected is very important. I think that we also know that there is a risk of transmission in these settings, bars and restaurants, and indoor sports. So what I can speak to is here in Ottawa, the data we have comes from the investigations we do, looking at people who have tested positive and then into their contacts. And so what we found is that there are people who have tested positive who are identifying bars and restaurants as places they've been in the 14 days, where they could have been exposed and then picked up the virus, as well as people visiting those kinds of settings where they're infectious, before they realized it. And so we have seen a transmission occur in restaurants and bars, especially between employees. And we've seen it also between groups that are socializing together at restaurants and bars, whether it's a wedding or a smaller group. And this, is hard to quantify. Always, what proportion of all of the COVID is due to these settings, because people list multiple different settings that they've been to that could have been a risk. But we do see where there have been more outbreaks in Toronto and around the world, that this is a higher risk setting because people are in close contact and they're not wearing masks. And so, in Toronto, it's been 44% of all of their community outbreaks that they've seen this. We know that by the time we wait to see evidence of an outbreak, that, again, is the time it takes for somebody to develop symptoms, to go for a test, to wait for the test. And that, is slow in terms of COVID time and the amount of time that, it takes for this virus to grow. So the faster restrictions are applied, the greater the impact that they have. When it comes to indoor sports, we are seeing now clusters of people who have tested positive in, for example, hockey teams, both adult and child hockey teams. And we are seeing the outbreaks happen in places like Hamilton, where, in closed environments where people are breathing heavily and they're in close contact and there's no mask use. Again, one person testing positive in that environment can lead to many others becoming infected very quickly. So I will close or carry on to talk about schools and influenza before closing. The school settings have been, demonstrating, again, that COVID is across our community because we've had 127 schools out of 300 where so far somebody has tested positive for COVID. Again, we know not everybody presents for testing, but that is showing up. And then in 21 of those situations, there's been transmission that looks like it's related to the school, either within a cohort, and that's been contained, or in a few cases, we've had to look at closing schools because we couldn't rule out a risk of ongoing transmission. So we know that this has been stressful for the community and that parents are frustrated with some of the aspects of how quickly they can get information. We are continuously modifying our responses. There is some time it takes to determine whether somebody did enter the school while they were infectious, and then getting the class list and all of those things. We're looking at many different ways of improving, automating some of the transfer of information, these kinds of things. it is hard for families to have their child self-isolate for the duration of the incubation period. And we understand that overall people are appreciating that schools are open, and that is our goal, is to keep them that way. So on the next slide, the influenza strategy was mentioned. I appreciate that, Mayor and Chair, that we do see value in aiming for a higher percentage of our population to be immunized this year. And we have added different types of options for people to access the influenza vaccine. And so a new type of thing is the joint clinics, for example, with primary care, where we will be inviting primary care physicians to the same fixed sites that Ottawa Public Health will be using to support the population to be immunized. We do see pharmacies are doing their part already, and we have received vaccine, and we've distributed it back out to hospitals, long-term care homes, retirement homes, and primary care physicians. And so, all of the orders we've received from primary care physicians, we've been able to fill so far, and we'll continue to get shipments of vaccine from the province. I appreciate, councillors, that you are providing some input into other areas of the city that may need some support with a mobile option. We have one RV and bus set up, which will be COVID, friendly in terms of being able to follow the new infection prevention and control protocols we need as we move around the city. I want to conclude with saying that this is a difficult. I know it's hard to see our community suffer, and that we can make a difference. We can turn this around like we did previously. It is possible, and certainly the underlying piece is we need to stay 2 meters away from others, and where we can't, indoors, we need to be wearing a mask. And it's basic, but it does change our lives significantly, and we do know that social supports are important. We need to pay attention to our mental health and support each other through this. And so, we're trying to encourage people to create new ways of connecting and establishing traditions. This does mean Halloween. We have messaging about Halloween needs to be different this year. The message is the same. We need to stick to our households and members of our household, or if we're single, to the one or two other essential supports that we need. And so I do trust people to act on this information. I think people are informed. They can see the risk. They can see the way COVID is entering into more and more settings. And that if we change our behavior and maintain this physical distancing, we can avoid further closures and that economic harm. So thank you. Merci beaucoup. Miigwech.
Great. Thank you very much, Dr. Etches, for that very thorough report. We have a number of members of council who would like to ask questions, beginning with our colleague, Councillor Hubley, please.
Thank you very much, Mr. Mayor, and thank you, Dr. Etches, for all the work that you and your team are doing to keep our community safe. It's very much appreciated. I have a couple of questions for you. I'd like to know if we have any proof from the contact tracing where any of the cases have originated or are close to a couple of points.
You're on mute, Dr. Etches. That's our T-shirt slogan.
We are all, so with every investigation, when we reach out to someone who tests positive, we ask them about their activities in the previous 14 days. We know that people have a lot of different activities these days in different places they've been, and it's not always possible to pinpoint one place that is the source of their infection. We know sometimes people have trouble remembering where they've been in those 14 days or, reluctance to report on that. We are missing 15% of the time or so we're missing this kind of data on exposures. And the easiest one to identify is people's households. So we know that within a house, when one person tests positive and then the other people test positive, that's very clear. Right? And so we see a large proportion where we can say the household was the source. But of course, households picked it up somewhere, right? That first person. And so then we have, different examples that we've been trying to share with the public. For example, telling the stories of how it could be a wedding, it could be a cottage, it could be, trying to think of other examples we've shared where an outdoor picnic, an outdoor barbecue, and we can demonstrate. It is the risk of gathering in close contact with others. And so wherever that close contact happens, that is a risk, wherever you're gathering with people outside of the household. So I'm not sure if that answers your question, but that is the way we're able to approach it and gather some data, and it's not always definitive data. And so the absence, of data also doesn't mean that transmission isn't happening in certain settings.
Okay, I'm trying to get at how we're making decisions to close down businesses. So can you tell me, is there any backlog in the contact tracing right now?
We probably have some people who are lower risk, where it's taking us longer to get to them, that we are following up with everybody who tests positive, immediately, to let them know that they need to stay home and self-isolate. And then we're going into the more in-depth investigation with those that are at higher risk or proposing more of a risk to others first. And then we're getting to people who are lower risk.
Where I'm going with that is I believe we transferred a number of city staff over to help with public health do the contact tracing. I'm trying to get a picture of, do you have enough resources to do this in a timely manner, to go through and get the contacts before it spreads too wide? I'm trying to get an answer on that part of it. Like, do you have the resources to handle the workload on contact tracing?
Not yet. We are trying to grow our team. We have certainly made requests to the city. We've also made requests to the province, and the province is providing people who, are arriving in groups. We've onboarded, some 20 people. My understanding is some more, 27 others are joining before the end of the month. We're also automating, to make sure that contacts are reached in a timely way. We continue to strive for the goal of reaching all people who test positive within 24 hours and all contacts within 24 hours. And I believe we are reaching contacts. We are reaching our goal of, 90% of contacts being reached in the high-risk category within 24 hours.
So we know, for example, Dr. Atchis, that the federal public service is being told to just stay home until at least the new year. Are we looking at reaching out to the federal government here in Ottawa to see if some of their employees can help with the contact tracing as our case numbers increase so that we can stay ahead of it?
That's correct. The province, I said the province is providing support. It's actually through an agreement also with the federal government, where my understanding is these are federal employees that are, there's an arrangement with the province where the province provides some training and support, and then they're allocated to us. I can tell you our team is constantly adapting and improving. We're looking at process improvements, all of these things that we can do to continuously grow our capacity, even with the same number of people, although we're also adding people. And there's been progress made recently for sure. I want to point out that testing and tracing will not stop the growth of the pandemic because not everybody's tested. You can look at the sewage, wastewater treatment numbers. You see the virus growing when the people testing are not necessarily, people aren't coming forward in higher numbers for testing. So we're limited by who presents, and then there's the time lag as well. In terms of the time it takes to present, get tested, get your results, and get contacted. And it really needs to be about prevention of transmission, breaking the chains of transmission through our actions by staying further away from people, especially indoors.
I believe it was the last council meeting or the one before, there was an announcement that the federal government was going to help or provide a lot of testing capacity for us. Has anything come about with that? Have they offered up their labs or their doctors to do the testing?
I believe there is still work underway for the federal government. This is conversations with the province. I'm not directly involved, where they are looking to grow the federal contribution to testing. That's a conversation that is continuing. I want to say that our testing sites are not full right now. We actually have openings in the appointment system right now. So there's no more wait time at the existing sites. So I encourage people to, if they have symptoms, present for testing. It's useful to know if it's COVID, to be able to follow up with people who may be more vulnerable contacts and try to stop transmission.
That's good to hear. One last question for you, or one last angle I want to look at this. We know that restaurants have been asked to keep books or lists and have people either sign in when they go there or provide their name and phone number so that you can follow it up in the contact tracing should someone say they were at that location during their 14 days. Do you know if any of these lists have ever been asked for from a restaurant?
I guess I can't answer that definitively because I'm not involved in that work, but I can follow up with you. The usual way we collect information is through the person who tests positive, and then we know, they usually know who they were in close contact with, and if they mentioned that they were in a restaurant or a bar, then we would reach out to that business to be able to look at how things were set up and who else might have been exposed within that business in terms of the employees or others. If tables are 2 meters apart, then that is usually considered a protective measure.
Dr. Atchis, I've been in a number of restaurants, nowhere near the number I used to like to visit, but I still try to get out once in a while to support a local business. And from every restaurant operator I talked to, that was a common theme, that they're doing this extra work that we've asked them to do, and they're saying they were never asked. Now, maybe I'm just picking the right locations to go to and that they've been COVID-free. That would be great. Maybe I'll keep that as my list of go-to places. But I'm just curious, so if you could get back to us, on a citywide basis, I know you can't name the restaurants. I wouldn't ask you to do that. Well, I just want to know what we're asking them to do, if in fact that information is being used and how often. So if you could just let us know how many times we've actually asked a restaurant or a gym or any of the businesses that we are closing for their attendance logs. I'd like to have that indication, please. And thank you for your time.
Thank you very much.
Thank you, Mr. Mayor.
Thanks, Councillor Hubley. Councillor Tierney, please.
Great. Thank you very much, Mr. Mayor, and thank you, Doctor. You're doing a terrific job. And I've noticed a bit of a pivot here. I mean, up till now, we've always said it's always been house parties and weddings. And it seems like we're starting to go down the road of, based on your presentation today, also based on what I heard this morning on CTV Morning Live from Dr. Paul Ramota, saying, yes, there is examples within restaurants and bars. And he actually said this morning it's going to take a couple of days and they'll expose or give more information, the data to support that. Do you have any information on that? Because is that you have to sit back and wait for the province to release that, like you said, or is this something that we can talk about, like how many bars, for example, within this area we've seen?
I can certainly tell you for us what I'm happy to share. You know, I'm trying to share today what we know in terms of we have these examples where there's been transmission within employee groups and there's been transmission within social groups using those kinds of settings. We do not have an outbreak where we can prove that there was transmission between an employee and a customer, but there are probably, there are, and you know, you see definitely in Toronto, and this may be the data that the province has. I believe Dr. Rooney-Lotus he may be speaking to something that he knows from being on a provincial table, that I don't have access to that information.
And I think that's a really good distinction because you know, when I heard that this morning, I feel I learned more from the morning news when I hear the provincial government coming out and saying things. I know, are we keeping two different sets of books? And the reason I'm asking is the province came out, you know, at 10:15 every day. Christine Elliott tweets out the numbers, and I usually retweet it. And then I find out, for example, today they said it's 39 in their dashboard, but I find out it's 45 through our dashboard. Which number should we be believing and following?
Well, there's one database that we use, and that dashboard information for Ottawa Public Health is taken directly from our database. And so if you want information about Ottawa, you know, I do recommend you use the Ottawa Public Health website. There's a difference in terms of perhaps when the data is pulled. Right, so that can lead to these smaller variations. But I also would encourage people to look at the trend lines. So, you know, a change in a few cases here and there from their day to day isn't as informative as looking at what's happening over time. You know, what is the 7-day average, the 5-day average, and you know, we do see this is where things are all in the wrong direction right now.
Mm-hmm. Oh, for sure. The referred to as the poop report. Do you find a lot of benefit in that? Obviously, I think we do. And is this something that is directly linkable off our dashboard? Is it a part of our dashboard?
Yes, sorry. For everyone, you can access the wastewater viral load information through a link off of our website. I believe it is on the dashboard website about public health information, and that it's a partnership, right, of researchers, you know, based out of CHEO and the Ottawa COVID 613 COVID site. The website is what hosts it, and so that link is there to find a graph. And as I say, it is. It's research data. It's not, you know, it hasn't been validated as much as it will be in the future, but it has been very, very well correlated with what is happening in the community, and it is something that tells us in almost real time the level of virus in our community. It doesn't have these other drawbacks, you know, that some of our data sources do.
Oh, for sure. Absolutely. When the province comes out with things like what happened on Friday, there's always confusion. We always have to do interpretation and figure things out. I know the dance community and the ballet community have been emailing many of us counselors, and Friday was kind of a gray area. And then come Monday, bylaws very clear now, no, you can't have those activities. And there's always this weird, you must call the province to figure out what's going on. And now with, it looks like within hockey and team sports, there seems to be some transmission or activity. A lot of rumor out there right now about what's happening, especially on the hockey front. Rumors that it will get reduced to 10 and all these kind of things. How much of a heads up do you get of that information, or do you have to just essentially wait for the province to say, yep, that's a new rule and we have to roll with it?
Well, we do try to inform the province about what we are seeing locally. You know, for example, if we're seeing transmission in sports teams, we let them know. But what they decide the regulation changes will be, we don't get any advance notice. We we hear the same time as the media and the public. However, there's usually a delay further, right, until we actually see the written regulations, and then we can interpret those with our bylaw colleagues. I do think the questions around hockey and how many people on the ice and all that, this is something that, again, we have to look to the provincial regulations to understand what the requirements are. And I believe that the idea of 10 on the ice is coming from the provincial regulations requiring limits on gathering where people are doing physical activity indoors. I think the principle is basic, but it is true sometimes when it gets translated into regulations, there can be inconsistencies or things that don't look as clear. For me, my advice to the public is if you want to avoid COVID transmission, then you should avoid situations where you're within 2 meters of others and there's no mask. And so that certainly does mean some of the physical activity indoors is higher risk and should be avoided if people are concerned about what will happen. They're affected, or if they have loved ones at home that are more vulnerable.
Okay. And just super brief, I just need a quick yes or no answer. The Ottawa neighborhood study, love it, which was more frequent, but I get it. Is it still on track again to be published at the end of the month, just like the previous one?
That's correct. It's published monthly. That's because the small numbers really can change the rates very quickly, especially in the more rural areas where 1 or 2 cases could, show a doubling or a tripling of the rate. It just wouldn't make sense to be depicted that way. So using a month at a time provides more stable data.
Excellent. I just want to thank you, your whole team. You do a tremendous job. They're even messaging me right now with links and everything. They're spectacular. So thank you, Doctor.
Great. Thank you, Councillor. Conseiller Cloutier, s'il vous plaît.
Merci beaucoup, Monsieur le Maire. Thank you very much, and thank you, Dr. Etches, again for your extraordinary work and for our community. Councillor Hoovey asked a lot of the questions that I wanted to ask with respect to the impact on businesses. Let me go to how is OPH and bylaw following up with landlords of multi-unit residential properties? We did a blitz. We were present in the community last week, and some properties did not have the signage. Is OPH or bylaw following up with those multi-unit residences to make sure that they have the information, the education, and the resources necessary for the signage and the information that needs to go to their residents?
I'll speak first and then maybe invite our colleague, Mr. DeMonte, to comment. But what we are doing is making extra efforts in communities where we see there may be a higher risk of COVID transmission to try to go out to multi-unit dwellings that are in those neighborhoods. But across the board, just leave it to you, Tony.
Thank you, Dr. Etches. Thank you, Councillor. Chair, we're doing proactive visits of all those multi-residential and condos to ensure there is compliance. And we've had a significant approach with regards to that, including a team of 8 officers now that are dedicated to that. So twofold, we do proactive and we're obviously complaint-based. So it's something that's extremely important to support the work Dr. Etches and our public health team are doing.
Thank you, Mr. DeMonte, for that answer. I appreciate it. I'll follow up with you offline, with respect to that and how we can, with some areas of concern. Just shifting a little bit, our shelter, the Human Needs Task Force has done an outstanding job, and I appreciate their updates and their work very much. And with respect to the shelter system and the temporary shelters, one of which is in my ward. Can you, Dr. Etches, or another member of management, tell me the current capacity of the shelter system and how many beds are full?
Yes, Mr. Mayor. So currently our shelter system is at capacity. When we look at the public health recommendations, that we keep our shelter, reduce our shelter capacity in order to allow for physical distancing. So right now we're looking at, when we look at the number of people who are sleeping on the streets in the city of Ottawa, we would normally in any given time have roughly about 90 individuals. And right now we're looking at upwards over 120 individuals who are choosing not to be in the shelter system. So as part of our resurgence plan, we are looking at that increased capacity that we need to have in being able to shelter individuals in the winter that allows us to continue to have our physical distancing requirements and not create overcrowding in our current shelter system.
Okay, thank you. Is there any concerns about the moratorium on evictions that is being lifted and how that might impact the upcoming winter season, given that you said that the shelter system is full? How can we respond with respect to that situation?
Currently our social service workers who administer Ontario Works are monitoring that situation, as we're monitoring as well with our social housing providers. And we do have access to emergency benefits to be able to support people in terms of, supporting them in their potential evictions and housing loss. So we would be working through our social services workers to be able to be advising people as options that they also have in terms of housing. So, while that, we definitely are anticipating that there may be an impact, we do believe that we will be able to mitigate that through our ability to administer emergency funds.
Thank you. Let me shift a little bit, just a couple more questions. Dr. Tam yesterday said that people can get creative with handing out candy from a distance. Dr. Etches, will OPH be providing some information, some guidance for the residents of the city of Ottawa with respect to trick-or-treating this year, even if there's a distance? Candy wrappers, can that carry the virus and be transmitted no matter how far?
We do have information now on Halloween on our website. So it's under, the section on being social-wise and holidays. We are recommending that people stick to their households. That's the common message that we need people to pick up and carry out. And so it doesn't seem consistent to say then people should be moving around their neighborhoods in groups. So it means we want to be creative. We want to dress up. We want to share pictures. We want to have hunts for candy within our house or, outdoors within the properties where people live. It really is probably more of like a Easter egg hunt kind of concept that would be recommended at this time.
Okay. Thank you very much. I appreciate that. I appreciate the work you've done and that information is on the website. We've published it in our newsletter. I'm just concerned about a little bit of the messaging that we received yesterday with respect to October 31st with respect to Halloween. Thank you very much.
Sorry, Councillor. If you're talking about Dr. Theresa Tam's advice, that she's in a difficult position having to speak to the whole country. And, I just shared information with you today that Ottawa has the highest rate of COVID in Ontario. We have to do things differently here. And so it does mean celebrating in new ways.
Noted. Merci beaucoup, Dr. Etches. Thank you very much. Thank you, Mr. Mayor.
Thank you. Councillor Egline.
Thank you, Mr. Mayor, and thank you, Dr. Etches, for that clarification about Dr. Tam's comments. That was the first question on my list, so thank you, and thank Councillor Cloutier. On another point of clarity, and I don't remember which councillor had indicated it, but one or two councillors had referenced when we shut down businesses. And for clarity, I just want to make it clear that the decision on Friday to go back effectively to stage 2 for restaurants and bars and gyms was a provincial decision, correct?
Yes, and I would like to emphasize that I share the same goal as the province, or goals, right, for the pandemic. We want to minimize hospitalizations and deaths, and we want to minimize societal disruption. So I fully respect that this was the decision of provincial elected officials. That was a very hard one to balance different harms. I think that elected officials are in the best position to take a look at the needs across more than just health sectors, looking at economy. And I really respect their decision. It is something where they have the best regulatory framework to be able to then have the appropriate levers for enforcement if enforcement is needed, and to take a look at what's needed across different regions as well. It is the provincial role.
Thank you for that clarification. I want to touch on something that you didn't touch on in your presentation, but you've spoken about before, so I just wanted to get an update on it. Much of OPH's staff and resources are being diverted to respond to COVID. And as a result of that, there are certain core services that either we're providing at a diminished level or we can't provide at this point in time. So can you give us a sense of what percentage today public health staff are being diverted from their regular jobs to respond to COVID?
Well, it's over 80%, but I think even it's almost easier to give you a picture of what's left, right? We have 6 nurses that are doing healthy growth and development work, working with new mothers who have schizophrenia, new mothers who are referred by police or Children's Aid Society. Right? 6 people is not enough for a city of 1 million, 10,000 births a year. And so we're seeing a wait list for people who have very high needs. We have a sexual health clinic and supervised consumption services that are open. The sexual health clinic, which with much reduced service hours, just to focus on populations, again, with highest risk, may be involved in the sex industry. That's almost it. We have 1 dental clinic open to be able to provide emergency dental services, but we know there are people with dental pain that we're having to work with the Dental Society and other partners to try to find other places for them to get support when they have low income. And then we have some work, not to say we're abandoning all public health work. We have some work that continues, of course, around other communicable diseases, other outbreaks, other health hazards. But we have tried to protect a bit of capacity for mental health, particularly with communities who have asked us to address barriers and support for mental health, like the African Caribbean Black community. So it's minimal.
So do you foresee this situation going into 2021 without further provincial funding, in the sense that your existing funding for all public health work is now mostly being diverted to COVID, and the core services are sort of, as you say, not being, those concerns are not being met nearly as well as we would like to meet them. So without a bump up in terms of provincial funding, do you foresee this situation continuing into 2021?
I would want to recognize that the province has said they will provide funding to cover the COVID response. We're expecting them to help us with the overspending that's currently happening to respond to COVID. And I have sought provincial direction around how much we should be also keeping some of these core services going rather than diverting that funding to the COVID response. If we reinstate more services, then that means the overspending on COVID will be higher. And so this is something, we do need to continue to engage as a province on.
So you said you have reached out for direction on the core services in light of the COVID spending. Have you received a definitive response on that from the province as of yet?
Not yet.
Okay. So thank you for that. It paints a picture of what public health is trying to do, both in dealing with COVID and dealing with what we would deal with in normal times, if I can use that term. And that's a discussion we'll have to have further as we get into the budget process. I want to shift gears a little bit here. Is Mr. DeMonte still on the line?
I am, Mayor.
Thank you, Mr. Monty. I'm wondering if you could speak. You spoke a little bit to enforcement, and as did the mayor in his opening remarks. And I see bylaw on the forefront of this response to COVID in the city. Can you maybe, and I appreciate you're not a member of OPS, can you maybe, Mr. DeMonte, tell us what the role of OPS or what partnership or you have going with OPS to support the work that we're asking bylaw to do on a daily basis?
So, Mayor, both bylaw officers and police officers have the same authorities under the provincial regulations to enforce the regulations. Obviously, bylaw has been at the forefront, has been leading this. OPS has been in a support role, and our colleagues in the police service, anytime that we've had incidents where we've had a more difficult circumstance to enforce things, the police intervene rapidly. Yesterday, the chief came out publicly. I haven't had a chance, unfortunately, to catch up with him, but he came out publicly saying that he was also asking his officers now to participate a little bit more in the enforcement of these regulations. And I know as we've talked to you as chair of your public health board, enforcement is a key component. I mean, each and every one of us have a responsibility to follow the public health guidance, but those who don't, we have to proceed with enforcement. And so bylaw has been at the forefront of that, and now we understand police will start also participating in the enforcement side of that.
And as a quick follow-up, Mr. Monty, could you speak? We know bylaw primarily as a responsive service.
Yeah.
But I think there's been a shift in your approach in the last week or so, sort of like almost like a SWAT team. Approach. Can you tell us a little bit more about that?
Yeah, thank you for that. So, Mayor, yes, because of the importance of this to our community and what we've seen now as we've proceeded to a second wave, we continue to be fundamentally a response kind of when we get complaints, we respond to complaints. But we've put together a team of 8 officers, namely for 2 reasons. One, as these orders are changing on a continual basis, it's important for us to be up to date, to understand the regulations, to work with our legal team for the interpretation, because it's changing regularly, and I know that's been a bit of a challenge for the public as well to know what's appropriate, what's not. So this team of 8 are also doing proactive patrols. For instance, over the long weekend, on one day, we did 274 proactive patrols in businesses to ensure they were compliant with all the rules, and pleased to report that the vast majority were. We did issue 6 charges, however. So, yes, we've got both a response on the complaint basis, but now we have a proactive team to be a little more, I think aggressive is the wrong word when we talk about an enforcement agency, but proactive is probably the appropriate word, because this is important for our community, and enforcement is a tool to achieve our goal as well, too, as a public health objective we have.
So thank you for sharing that new approach, Mr. DeMonte, and please share my thanks with the bylaw team. I know they're out there each and every day, and I hadn't heard that piece from Chief Slowey. So if Chief listening in, thank you, Chief Slowey, as well, for stepping up and making it clear that your officers are going to be part of the enforcement process and taking on a more active role. I think it's important at this juncture, as Dr. Etches has pointed out, we're at a fairly critical point. So thank you very much to both services, and thank you, Mr. Mayor.
Okay, thank you very much. Councillor Kavanaugh, please.
Thank you very much. Thank you, Dr. Etches, for your report. And thank you to the Chair of Ottawa Public Health for pointing out how many functions of Ottawa Public Health are being compromised, well, more than compromised, are being neglected as we deal with this pandemic. I think it's really, really important to point that out because they do so much. That's why I'm a proud member of the board of the Ottawa Public Health because there is so many things we do. It's about preventative, and if we can't do preventative, then that's problematic. One of my concerns is about the vulnerable population. I really appreciate. I'll join my colleague, Councillor Tierney, in terms of the neighborhood maps are great, and it pinpoints areas of concern. One of the things that I've been hearing about is children who are in schools that where a greater number of the population are from vulnerable communities, and when they have runny noses or whatever, and they're sent home, they don't get tested because their parents don't have any capacity to get to clinics, and it's very problematic because these kids are not on the radar. They're being left at home for the 2 weeks, and their parents just can't get to those testing centers. I'm wondering if we're raising that. I know the Ottawa Public Health nurses have been in the schools, and I just want to know how that's being dealt with because it may not come up in statistics.
We are certainly interested in supporting people who have barriers to staying home to access those supports, whether it's financial or food, and the Human Needs Task Force has been playing a key role, as well as access to testing. And so there are some other pathways that have been established for people, and I know it's not perfect yet. This is an ongoing work in progress, but there are pathways now being established by the Ottawa Health Team, which is with the leadership of the community health centers, where we are able to link people who would otherwise have barriers to being tested to access that. We're planning to grow that, keep growing that with the partners. This is part of the work of the neighborhood approach, to understand what are the barriers, working directly with community leaders, making sure we're using multiple languages for communication, I think is also very important, and the youth themselves, so that young people in the community know where some of the needs are and what some of the challenges are. So they are ambassadors in terms of two-way communication about what the needs are, but also what services and supports exist, and to be able to link people. And so that, again, is a program that we're expanding to another neighborhood soon, I believe.
Thank you. Yeah, I think that's just an extra burden with parents that just can't get their kids to clinics. It means taking days off. It means leaving work or whatever. So thank you. Long-term care facilities are still there as a problem, and the fact that the Red Cross had to give them a go-ahead to go back into them. I worry about this in terms of the effect on Ottawa Public Health, the burden. Can you comment on the situation here in Ottawa with long-term care facilities?
So we know that what happens in the community with the amount of virus then spills over into long-term care homes. So when you see a rise in the community, you then see a rise in outbreaks. And they're being picked up earlier. The situation is better than in wave one. There's no question. There's surveillance of staff members every couple of weeks, and that is picking up people who test positive and may not realize they don't have symptoms, and that is helping to limit the transmission. So our team take the more intensive on-site approach where the needs are greater. We still use the rating system of, red, yellow, and green homes, and most of the homes are green. And so they're requiring less support on site. There are situations where it is still hard to find staff. I would say that is an underlying challenge across multiple kinds of health organizations, whether it's public health, hospitals, or long-term care. Finding qualified health professionals is sometimes still a challenge. The situations where things have become more devastating, I think that's where we intervene to make sure that there are greater supports, such as from hospitals. And the Red Cross support is something the province is sorting out, that those conversations are still underway in terms of how that may be added in, and to which homes, where is the support needed.
Thank you. I want to thank again Ottawa Public Health for their leadership on compliance on multi-residential buildings on the MAP, and the fact that bylaw is enforcing it. That's really good news. I've heard a lot about that, making people feel better when they're particularly seniors who've been very vulnerable. So appreciate that. My last question is about outdoor activities. We're hearing about the gyms, et cetera, but can we encourage through Ottawa Public Health more people getting outside, just getting fresh air? It's going to be a long winter. We've got these wonderful winter trails that we're putting together across the city, which don't necessarily have to be for skiing. It can just be for walking, et cetera. Can we encourage people to get outside? I think one of the things that I keep hearing about is the problem of being indoors with others, but can we make an effort to encourage people to get some fresh air?
Yes, thank you. I'll pass that on to the team.
Okay, thank you. Anything else, Councillor?
Okay.
Councillor Brockington, please.
Thank you, Mayor, and it's still morning. Good morning to everyone. Dr. Etches, you answered a question from Councillor Hubley about whether you have enough resources for contract tracing. You said you've approached the city manager. Can you just give us an indication, will the city be yielding more resources to Ottawa Public Health for contact tracing?
It's Vera here. I mean, I want to say that the city has been very, very helpful around enabling us to hire more people. So it's one thing to seek people to be redeployed, but it's also another to be able to bring in the people who have the right skill set. And so we've had the support of the Human Resource Department to hire. We also have been hiring from city staff who are on leave, right? That's a faster process when you have, for example, employees who worked in parks and recreational services, for instance, and so they're already employees. It's about being able to bring them back more quickly. So that is also happening.
What do you need? How many bodies?
It depends on what the population does, right? If people start to limit their close contacts with others even further, then I think we'll get to a place where we can manage with the additional provincial resources and the hiring and the automation. But if things grow exponentially, we'd need 200 more people. And then we need 400 more people. And then we need 800. Like, that's the exponential curve, right?
Doctor, that's where I think. Okay, I'm thinking about the winter where people are going to be indoors, where we've been saying the same key messaging and COVID-wise for 8 months. We're seeing the second spike. My next question to you is, do you support the closure of in-restaurant dining? Like, the provincial government made a controversial decision. We're going to debate elements of that later, but was that the right call? Do we have a problem in our gyms, in our bars, in our restaurants in Ottawa? Do you support that closure for 28 days?
Yes, so 2 weeks ago, I wrote to the province requesting immediate action to attack the areas where there is social interaction with people outside of the household. So 2 weeks ago, I pointed to different areas where we could limit the number of people that were gathering with people outside their households. At that point in time, I did not see that it was necessary to necessarily close bars and restaurants if people limited their contact in the restaurant to their household. So that was something that I was advocating for 2 weeks ago because of the harm potentially to businesses and recognizing that that also matters for health. And so that was something I raised with our Chief Medical Officer of Health. The situation hasn't got any better over those 2 weeks. It's gotten worse, and it's getting worse faster. And I absolutely support the provincial decision to close bars and restaurants and gyms where there's close contact without masks indoors with people outside of your household. That's what we have to avoid right now. And, you know, it's hard. I don't feel good about it. I want, I really want everyone to do their part so we don't have to get into more of this kind of activity. That would be the absolute preference. And it's workable. It's doable. You know, we've done it before, so just really emphasize that for people. I do think the province has the same goals and is struggling with the same thing, and I respect their decision.
So just to clarify, you don't have an issue per se with the cleaning regime, the reduced capacity in these establishments, because I think, as Councillor Hubley says, I've been to many. I'm impressed. I'm impressed to the length that business owners have gone to keep their patrons safe. Your issue is non-same household people mixing.
That's correct. And you know, this was partly why 2 weeks ago I was cautious around suggesting the closures, because we know that the establishments are doing all they can. They've really changed their practices, and we don't know what happens in people's private homes. Right, and so it is a challenge where there's an unknown there about if bars and restaurants are closed, what happens to other types of gatherings. Now, the province also addressed that by saying you need to stick to members of your household, and so we need to monitor the impact of that. You know, this next few weeks, we want to see what has happened with this direction.
My last comment is just to piggyback on Councillor Kavanagh. I think that, again, I've talked about mental health with you a number of times. With winter coming and more social isolation, people staying indoors, we have such a fantastic opportunity in Ottawa with cross-country ski trails, toboggan hills, the canal for skating. Can we look at, in addition to community skating rinks, can we create outdoor curling rinks? We've got the land. It's, you know, on the same degree as putting ice down. I really think the city and Ottawa Public Health can work together on promoting outdoor activities that are free, that are COVID-wise, to get people out to combat mental health challenges. I think it's going to be compounded this year, and we have time to create that public campaign to underscore all these great assets that we have locally. So again, I just want to replant that seed that Councillor Kavanagh stated, and thank you again for your attention.
Thanks, Councillor. Councillor Sudds, please.
Thank you, Mr. Mayor, and thank you, Dr. Etches, for your presentation this morning. Just a couple questions. My colleagues have answered most of them already. So the first one, I don't feel like we have a clear answer on trick-or-treating. So my question to you is, what is your advice with respect to trick-or-treating this year? Should we or should we not be doing it?
I don't recommend trick-or-treating. I recommend that people stay with the members of their household, that you look at ways to have candy for kids in your household, you know, that in a different way. Dress up, share costumes, with pictures, like do these things more virtually. There's a lot of fun to be had. I think people need to have fun right now, and dressing up is one of those great things. I love that, and there's such cute and such scary and gross costumes. We need that, and so I really encourage people to go wild with members of your household.
Excellent. I can't wait to see your costume, Dr. Etches. So can I just dig a little deeper on this, because I think it's important that we have this discussion. So the recommendation is not to go trick-or-treating, to do other activities safely with our family. Can you tell us why we should not be trick-or-treating? What is the risk?
It's the same as usual, that there's more risk when people come into close contact with others. And if people are moving around the neighborhood, that there's children in groups, it would be easy for more mixing to occur. And we know that, there is the possibility if multiple people are touching different things that can also lead to transmission. So it's a close contact and the possibility that someone is ill, also spreading their virus. I can't remember what else I was going to say about that. Sorry.
Sorry.
But the idea, is really the same. If people are keeping distance and they're wearing masks, that is less likely to cause risk. So there's kind of levels of risk that you can decrease your risk with distance. So, there are activities you could do within, your neighborhood, like carving pumpkins outside, as long as you're distanced from other people who are carving the pumpkins. But we don't want gatherings to exceed the provincial limits. And we know that it is harder with young children to ensure that they stay apart. Mm-hmm. And we know children are in schools in larger groups, and so we need to do all we can outside of school to keep children from mixing.
Sure. I appreciate that greatly, and I think our residents need that clarity around trick-or-treating. One last question with respect to trick-or-treating, again, just for complete clarity for residents. Is the passing of candy out a high-risk activity?
It does depend how it's done. So we know this virus is very tricky. People are are infectious before they have symptoms, and some people are asymptomatic. And so you could have somebody who has the COVID virus who is infectious, even when they don't realize it. And then they're passing out candy and they're touching things that other people are touching things. When you're out trick-or-treating, it's very hard to wash your hands, right? The hand washing is always a good thing, or keeping your hands clean with hand sanitizer. But it's harder. And when you're passing things out, you might be in closer contact, or children may gather and be in closer contact. So it's just, again, this isn't something that's essential activity. Right now, the government is asking us to stay to members of our household and to limit our trips to what is essential. And so it just doesn't fit right now at this point in the pandemic.
Yeah, fair. No, I appreciate that, and I wanted us to have that conversation today for our residents' benefit, so we have clarity around Halloween. Just a couple other questions for you. One, I noticed in your presentation, specifically in slide 6, that you mentioned that we are now seeing clusters of cases in organized sports, and specifically mentioning hockey teams. This is a growing concern, I think, across the city, but for myself here in my community as well. So my question for you is what are your recommendations in that setting when we talk about organized sports, whether it be a hockey team, a soccer team, etc.? And would it make sense for masks to be worn on these team sport activities?
Thank you. I can't help but feel a little bit of grief, actually, again, about all the things that the pandemic is causing us to lose. Because, again, I mean, hockey, other sports are really essential to us enjoying life and being active and being well. And so, what we're looking at is the provincial regulations around limiting activities to training. So that you're not having scrimmages and games where people are more likely to be in contact with each other. So, and then limiting the numbers of people so that people can be more spread out. So those are the principles. Yes, if people can wear a mask for physical activity, it can provide more protection. It's just that when people need to breathe more rapidly, breathe hard, it's not possible to continue to wear a mask. So again, moving things outdoors, moving things into bigger spaces, all of those can help. It's the same principle.
I'll leave it at that. Thank you very much, Dr. Etches, for your work and that of your team. It's greatly appreciated.
Great. Thank you, Councillor Suds. Councillor Leeper, please.
Thank you, Mayor, and again, thank you, Dr. Etches, for your presentation this morning. As always, comprehensive and a lot of really useful information. Thank you as well for the clarity on trick-or-treating. I've noticed that a number of councillors have already taken to social media to pass on your advice, and we're going to need to find some other ways to make the evening spooky. A couple of questions. You put it as almost a politician would earlier when you said, with respect to transmission in bars, restaurants, other venues, the absence of data doesn't indicate that transmission isn't occurring. It's probably as definitive as you can get. I'm just wondering, is Toronto, where we have seen, I think, more data and hard numbers, are they flying any less blind than we are? I note that in Ottawa, we have a very high level of cases where we don't know where the transmission is. Do they have more information to make a decision about bars and restaurants in Toronto than we do?
We use the same approaches of investigating whenever a person tests positive, where the exposures have been, and then following up with contacts. And they do have a similar proportion where there's unknown exposure data. It's not very dissimilar. What they've had is more clear outbreaks. And so they've been able to identify those links between employees and customers more than we have. We've had clear transmission within social groups that have used restaurants, and we've had clear transmission among employees within restaurants. But just that link between them we haven't picked up, based on the investigations that we do to look at the timing and the possible sources. There hasn't been like that definitive link, but there's the possibility for sure.
Okay, and I guess I'm wondering, Council is likely to pass a motion in a little while that asks Queen's Park to give us a deeper dive into the numbers with respect to why the emergency orders were issued on Friday. And I'm wondering, it is always appropriate to ask for more data. We want to know that the measures that Queen's Park are taking are based on the best available evidence. Quantifiable is excellent. What are we likely to get back from Queen's Park with respect to their understanding of Ottawa's situation?
Oh, that's a hard one. I can't speak for the province, but I can tell you we actually probably are monitoring similar things. So because we built our dashboard on the reopening metrics for the provincial framework for reopening. I just have it in front of me here. I'm looking at the dimensions they look at are measures of virus containment and spread. So they're looking at what's happening with the rate of COVID in the community, They are looking at what do we know about the source of the infection, and that also speaks to if they have information on the source, it'll be similar. They'll try to say for individual people what percentage might have had that source in bars and restaurants. The challenge being usually people have multiple different things they've listed, so it can't be definitive that is the source. When it comes to virus spread, it's also about the outbreaks and the hospitalizations. So they're looking at the same thing. Healthcare system capacity was another measure they're monitoring. So the beds, the ICUs, the ventilators. They're looking at our public health capacity to follow up within the 24 hours for people who test positive and their contacts. And then they're looking at the laboratory system also. So what's happening with the lab testing, the ability to test people, the ability to turn those tests around. So those probably are similar metrics that they're using for decision making. I would be surprised if they weren't. We know that you can't measure everything that's important. And so that's why we've gone ahead and tried to collect other information about the impact on people's mental health and their income and their economy through surveys. So I believe the government would also have economists that are providing them with data about the impact on different sectors like hospitality, for example. And so they'd be weighing these things. The outbreak data, again, they can tell where outbreaks exist. So we can say we have so many in long-term care, we have so many in retirement homes or congregate settings or workplaces. They can also specify that.
Was it a given when all these different metrics that the various different public health officials are monitoring, when they hit certain thresholds, was it a given that the response would be to close bars, restaurants, gyms, and similar venues, or is that response customized to what the government is seeing out there on the ground?
No, there was no specific plan for a specific threshold and then closure of particular businesses. The idea is to target, where the risk of transmission is higher, and the thresholds do potentially change. Right, it's hard to have a specific level, although they've taken that approach in Quebec. Because it does depend, for example, your numbers of infections in the community are more worrisome if they're among older people who are more likely to be hospitalized than among younger people. So looking at just the number isn't enough. So it really is the collective. It's the same with our rating of red, yellow, orange, or green. I'm just waiting for green. One day we will get there. It's a bit of a qualitative assessment in the end of can our systems handle this? How fast are things changing? The speed of the growth matters. So I think that you can see it's a bit complex.
Yeah, and it's, the motion that we pass, presumably in a little while, some people are going to support it because they don't believe that bars and restaurants are necessarily a key transmission area given all the precautions that they've taken. I think for some of us, we're able to support that motion simply because asking for more data is always a good idea, and not necessarily because we mistrust the motivations of the government with respect to those particular closures. We saw a very high level of positive cases who are racialized. Is that still the case?
Yes, that trend is continuing. Of course, our team is working again with communities to try to address that, to change the trajectory. But some of the drivers are very hard to change, like housing status. We are working to set up an isolation center so that people have more options to get away from their family if they've tested positive, protect their family. So that is underway. We know, again, the types of work that people engage in can put them at higher risk when it's lower paid work with more exposure to others. So these are, again, when we see something like personal support workers being at higher risk, or now, we're seeing potentially some challenge to others who have low income and who have more precarious work. We raise that to the province as well to make sure that those stories are heard and can influence policy. And we did see the government respond with higher wages for personal support workers. So we'll continue that approach.
I very much appreciate your continuing to follow up on that. I have a last question for Anthony or Mr. DeMonte with respect to bylaw enforcement. And it's very similar to what Dr. Etches has described with respect to Ottawa Public Health. What does the COVID response mean for bylaw enforcement across all those other things that cross our desks every day with respect to requests for help from bylaw? It strikes me that the capacity isn't there to deal with some of those systemic noise issues or dogs in park issues and things like that. We're asking residents to be patient, but I'm wondering if you can give us some color with respect to what the COVID response means for our bylaw officers.
You're on mute, Tony. Tony DeMonte.
My apologies, Mayor. My apologies, Mayor. If the councillor could repeat the question, I was involved in something else.
How busy are you? What does the COVID response with respect to for bylaw? What does that mean for all those other things that I know I and other councillors are bugging you about every day that aren't COVID related?
Thank you, Mayor. Like I guess my public health colleague, like Vera says, as every other department, we've been focused on COVID response. So the vast majority of our work has been put on the back burner. Normal bylaw complaints, as you say, don't bother us, but some of the challenges your community has that flows through you that you send to us are put on the back burner so we can focus all our energy on helping this community recover and ensure that the regulations and the public health measures are respected. So, yeah, we're juggling and we're moving staff around for this priority as our first priority, and other things are put aside till we have opportunities to address them.
It's useful to have that made clear because I think, we have to continue to ask residents to exercise patience with dogs in parks and noise and all of those other issues as well. So
the only thing, if I could add, Mayor, because you mentioned dogs in parks, so things that are high risk or public safety issues like a dog bite or that type of, obviously those priorities are answered to, but anything that can be deferred that are lower priorities are deferred so our team can focus on our COVID response.
I continue to appreciate the work you're doing. Thank you, Mayor.
Great, thank you. Just a reminder, we have 6 more speakers and we still have to get to the main council meeting. So if we could ask that questions and answers be succinct. Councillor Luloff, please.
Thank you very much, Mr. Mayor. Dr. Etches, how do we frame this current concerning situation with keeping schools open? Keeping schools and daycares open is very important, but is contributing maybe to a sense of why bother among some residents. High schools have been holding graduations, and I've seen pictures with no masks indoors. I know our teachers are doing their best, and they're stuck between a rock and a hard place, but this elicited quite a bit of feedback that I've had to pass on to our trustees. In March, when we successfully flattened the curve, we changed our behaviors and everything was closed. And I think that that's what helped people grasp the urgency of the situation much more. And to be clear, I'm not advocating for more closures. I'm just wondering if you could clear up some of the cognitive dissonance required to accept our current situation.
Well, we asked people in March and April and June and, what was affecting their health and what were their concerns. They were concerned schools were closed, and parents reported the highest levels of distress, and they reported that their children had mental health challenges that they were concerned about. That was clear input. Then it was like, we can't do this. We can't be parents and teachers at home and work. And so schools open is for the children. It's for the parents to be able to work. It was clearly, part of minimizing societal disruption. And it's possible. Other countries have done it. It's getting harder with the spread in the community. But still, we have the vast majority of schools have not had an outbreak. And we do need to keep up good practices as much as we can, for sure, get through to high school students that they matter, that their contribution matters around wearing masks and keeping distance. It all adds up. As much as we can each do, provides the protection so that others can have the benefit of schools being open.
No, I really appreciate that. And Mayor, this is my final question, I promise you. If I'm allowed, as it does pertain somewhat to the presentation by Dr. Etches and certainly touches on your opening remarks, can the Treasurer or the City Manager tell us if all businesses affected by COVID-19 will be eligible for the property tax rebate announced by the province, or only those affected by the recent step backwards? So I've got travel agencies in my ward that have been decimated by this pandemic, and at least 2 of them are about to have to close after 30 years of being in business because they can't afford to pay their taxes this year through no fault of their own. The Treasurer or the City Manager, or anybody who's familiar with the announcement on Friday?
Maybe I can just offer a comment while we wait for the Treasurer. When I spoke with the Premier, it was indicated, and the Finance Minister, would be for just those businesses affected, in essence, that were closed as a result of the provincial order on Friday, and only for the 28-day period that they would be reimbursed for their property taxes, their natural gas bills, the hydroelectric bill, and any overhead costs. We didn't get a definition of what the overhead costs would be, so it would just be for those businesses.
Okay, thank you, Mr. Mayor. I really appreciate it. I'll pass on to the next councillor.
Okay, thank you, Councillor. Councillor King, please.
Thank you, Your Worship, and thank you, Dr. Etches, for the work that you're undertaking. As we know from race-based data collected and released by Ottawa Public Health, more than 6 out of every 10 people who tested positive for COVID-19 in the city are from racialized communities. And I'd really like to thank Councillor Weaver for asking about how the coronavirus is affecting communities of color at a disproportionate rate. I was curious with the contributions of the Ottawa Local Immigration Partnership, or OLIP, and the Ottawa Health Team. My understanding is that Ottawa Public Health is working to create a targeted protection plan for residents of neighborhoods with high COVID outbreak clusters. One of these neighborhoods is Overbrook MacArthur, which is located in Rito Rockcliffe Ward. I was just curious, how are these neighborhoods faring compared to the rest of Ottawa?
Sorry, in some ways I don't feel it's my place to speak for a neighborhood about what's happening in their neighborhood. That is part of what we're hearing from the community, is that they want to use their voices to be able to describe what's going on and what's needed. We do share our information, the data, the numbers, and then we work together to understand from the community's perspective what that means and what's needed. So I think, from a numbers point of view that we have, for sure, it looks like there are communities where there's more risk of exposure to COVID, not necessarily within that community, because it's where people live. That's how the data gets mapped out, but the exposures could be happening anywhere where people are working or in other situations with higher risk. I think that what we're aiming for is to reduce that picture of inequity. So that our goal is to stop COVID transmissions in communities at higher risk, so that we don't have this picture of differences between neighborhoods to the same degree. It's probably naive to think we can get rid of it entirely, but that's our goal, is to change the picture, change the map. And I do, again, the actions are effective. If people are supported to stay home when they're sick, if they are supported to keep distance from others when they're ill, and they have access to masks, we can turn this around. So I am hopeful. I see the commitment of community leaders, and this is a top priority for Ottawa Public Health.
And just briefly, can you update us about some of the specific actions that OPH is taking to mitigate the health and well-being risks that are faced by immigrants and racialized populations?
So again, working with communities and leaders like the Ottawa Local Immigration Partnership, we're using our data to help people understand the situation and investigate what the barriers are. For example, barriers to care, barriers to testing. We have the Neighborhood Ambassador Program, again, in partnership with Boys and Girls Club, Crime Prevention Ottawa, the Integrated Neighborhood Service Team, and we are on the ground employing youth. And training youth to be talking about COVID and distributing information about support. We are looking to open an isolation center for people to access that support. We are trying to make people aware that there is financial and access to food available if they have to self-isolate through the Human Needs Task Force. And then we are continuously trying to learn about what is needed as well and take our direction from communities.
Excellent. And my final question, and I have to recognize Councillor Turney for the good work that he had pursued around neighborhood mapping. I'm just wondering if we are mapping out the schools with COVID outbreaks that are in these neighborhoods, because obviously there are specific challenges in these neighborhoods with the rates of infections, and that could impact schools. So I'm wondering if we are also looking at that data.
Yes, we are. We're certainly, I can check with the Ottawa Neighborhood Study about whether they can put the schools on the map. Not just the schools in outbreak, but the schools, so people can see the connection to neighborhoods. But that is one of the variables we look at, whether schools in outbreak are linked to communities that have clusters of infection. It's not 100% of a link and a correlation. We see outbreaks in communities without some of the risk factors like lower income. But there is, we do see some connection.
Well, we want to thank you for all the hard work that you're doing and the fact that there is mobilization for neighborhoods that are in high priority areas that are affected by these challenges. That's much appreciated, especially noting the challenges that are faced by these neighborhoods. So thank you so much.
Great. Thank you, Councillor. Councillor McKenney, please.
Thank you, Mayor. Thanks, Dr. Etches, for back in front of us today and all of the work that you're doing. I'm sure this is a question that you think about all the time. I'm sure that if you had the answer, you'd give it to us, but I have to ask. We have a city that is 1/15 of the population of Ontario, and yet we have 1/5 of the cases. We aren't, we're a government city, a lot of people that are able to work at home. We're a pretty privileged city, obviously lots of, when we think about racialized low-income communities, but I don't think that we are that different from other comparable cities in the province. Why are our cases so high? I can't understand any rationale for. I can't realize any rationale for that.
Well, I think there are some things that are probably contributing. You're right. I have asked myself this question, asked our team. So we like others across the province saw improvements. I'm sorry, I'm trying to move you around so I can look at you properly. We saw improvements in the summer. And we really have reduced the COVID in our community in July into August. But then we saw the announcement of stage 3, and we were ahead of Toronto, Peel, anyone in the GTA. We were the largest city to have the announcement about stage 3 first. And just with the announcement, we saw people relax and say, oh, we're good. I'm going to get together with friends. There's just a little more connection between people, or maybe a lot more connection between people, a lot more use of services, and that started the increase. And it kept going. And this virus grows quickly if given the chance. And so we started before the GTA growing. We also, when we look at our neighbors in Quebec, we know that Quebec has struggled a lot with higher rates, probably because they had their March break first, right? Mm-hmm. Quebec had a March break before Ontario, and people came back from their March break, and schools were still open. In Ontario, you have to remember, there was March break, and the schools never reopened. And so there's a big difference in terms of the early on how much COVID was introduced into Quebec and spread around in Quebec, not through any fault of the province at all, but they had a different dynamic early on when it wasn't detected, when people didn't know to be screening for people coming from Italy or Iran, or, So, I think we started probably with higher levels of virus there, and we have a population that's not really separated by the river. We're one population, and so we're even bigger. We're 1 million, second largest city in Ontario, but we're 1.3 million when you consider, Gatineau and the Outaouais area. And so it's a lot of opportunity for transmission. But again, all is not lost. We know what works. It is possible, to turn this around like we did before. We got the rates back down, and so it just is a situation where it'll go faster if we don't take precautions.
Thank you for that. And my follow-up question then is around contact tracing. If you think back to the summer, early on when we started to do contact tracing, if you got COVID, you probably had 10 contacts because you weren't moving around. Today, you probably have 100 because we are moving around. We know that. We know that from our numbers. So as a city, people are seeing too many people who are not in their bubble. There's no other way that we're going to get this type of community transmission if that's not the case. So we're not able to do that contact tracing that's really required. We could give you 200 more contact tracers, but it is about prevention. But can I ask you then, is that why Toronto has the stats around community outbreaks? They have, when you say that 44% of community outbreaks in Toronto are in bars and restaurants, but we don't know that. Maybe the province knows that. We're going to ask them. British Columbia knows that the outbreaks are in nightclubs and banquet halls and not in restaurants and bars. So is it because our numbers are rising so quickly that we can't keep up on our contact tracing, that we don't have that statistic, that we don't know, that we don't have that data?
No, that's not the case. Toronto's prioritizing contact tracing the same way we are right now, or more so. I think they've made some decisions there about not yet. But what we would need is we need to know that there was positive COVID, someone testing positive in employees at a point in time. And then we would need to also identify it in a social group that had visited the same venue, and we would have to have a link between the two. So they would have to be served by that person who was an employee who was positive. And there's just not always the opportunity to make that link for different reasons. People who test positive, who've been to a bar or restaurant, they may not identify that as the place that they were exposed, right? They might not say they went to a bar or restaurant, or they might forget, or they might listed among multiple things, and so it's not clear that that is the source. They probably have a more likely source if there's a closer connection. So it's not a simple thing to make those connections unless it's very clear. So my understanding, I've talked to the Toronto Medical Officer of Health about this. How are they picking up outbreaks? They've had different situations where it's more clearly a population where people have been positive in one setting and then it's linked to the second setting. We're looking for that. We're looking for that all the time. Our team is doing analysis about exposures in new ways. We're trying to pull out information. So we know the risk is there just because of the nature of the gathering. And we know that in other places around the world, this has been a risk, right? So, there's plenty of evidence about the risk existing.
Thank you. I appreciate that. Thank you.
Thank you, Councillor. Councillor El-Shantiri, please.
Thank you, Mr. Mayor, and thank you very much, Dr. Assis, for all these great information. And I know a lot of my colleagues have been asking questions. I'm a little bit interested in, first when we talk about Toronto, they have the number 44% in your presentation back to restaurant, bar, gyms, and others. And the decision was made, and maybe we have the same, or maybe we don't, I'm not sure. But why Ottawa was not provided with the same information Toronto has?
I'm not quite sure I understand the question. So Toronto, it looks like they've said of their community outbreaks, so that's not in a long-term care home, not in a healthcare institution, the ones that are in the community, the number of outbreaks they've had, I think, I don't want to quote their actual number of outbreaks, but they said 44% were related to bars and restaurants. We've actually had very, very few outbreaks outside of healthcare, outside of congregate care settings like a group home or that kind of thing. So we've had very few workplaces. The workplaces where we've seen outbreaks tended to be where people were very close side by side, so like a call center, that kind of situation. So the numbers to begin with are small in terms of outbreaks, and then for the restaurants, it's been more within a cluster of employees. And so I suppose you could say that might be an outbreak related to the restaurant if it's spread within a group of employees, but those employees socialize together. And so we're not labeling it an outbreak due to the restaurant because it's actually social gathering, right? It's not the practices of the restaurant. So that's a different way we're looking at it in Ottawa. The other people may consider that a workplace outbreak, but where we have found those situations, it tends to be that the employees gather outside of work as well. So it's hard to make that call.
We find people gather in many places, and a lot of it is not with the physical distance. When you see unlimited people in those larger franchise stores, Costco, Walmart, the list goes on, why didn't they promise for a restriction on those as well? I mean, I know that wasn't your decision, but I mean, surely to God, we deserve more explanation and more evidence-based information so we can defend your decision. When you feed us the information, we don't challenge your expertise, and we won't challenge their expertise if we have the information. Anyway, I'm interested also, you mentioned with the spike in the sewage treatment, and I'm not sure if any of our staff on the call, with my knowledge of the sewage treatment, we receive sewage from outside the city of Ottawa limits. So we receive sewage from the neighboring municipality to process it because for the septic bed and others. So I'll be interested to know the percentage coming to us from the neighboring municipality, the small municipality, to the sewage plant treatment. Because that might change quite a bit, the number, but I don't have, and I don't know if Alain Gonsier or somebody can tell us what percentage of the process of Robert Picard for the sewage treatment comes from outside the city limit. Do you have anybody on the call, Mr. Mayor?
Yeah, is there anyone from Environmental Services? My understanding was that we have water agreements with Russell, but I wasn't aware of a sewage agreement of neighboring municipalities pumping into our sewage system. Can someone from staff reply to Councillor El-Shantiri's inquiry on that issue?
Mr. Mayor, it's Kevin Wiley.
Go ahead.
We would I don't have the number at my fingertips either. I can get it for the councillor, but we do receive loads from private haulers. I would think it's a very extremely small number, probably not even significant statistically, but I'll get back to the councillor on that.
Okay, thank you. Well, it's not just for me, but I think we can all benefit from that information, Mr. Weil, if you can provide it to all of us. And I thank you for this. And Dr. Atchis, I'm also, when you talk about the number percentage, and you know, percentage number is really a tricky way sometimes when we talk about percentage. Because if you have one case in one area and tomorrow you have extra, so that doubles the number. But in a case like City of Ottawa, when we say we have 70 cases per 100,000, do we count or we take into consideration that the neighboring municipalities surrounded us who really have no place to shop or to go to hospital or go to other than come to Ottawa, or some of them work for the government in the city of Ottawa? Have we count the number of visitor, or I shouldn't say visitor, but the people who come to Ottawa for one way or another?
Thank you. The numbers of people testing positive by certain jurisdictions are based on where people live. And so for our neighbors to the west, Renfrew, they have much lower rates of COVID. To the south, also, significantly lower. To the east, and bordering Quebec, out eastern Ontario direction, the rates are a little higher. Not higher than us. We're the highest. I mean, they're higher than our other neighbors. But of course, all around us, it is lower than the city of Ottawa specifically.
Okay. Well, thank you very much, Doctor, for all your effort, and really appreciate all your answers. Thank you.
Thanks, Councillor El-Shantiri. Councillor Harder, please. Your mic on.
Thank you, Mr. Mayor. Yep. Thank you, Mr. Mayor. And thank you, Dr. Etches. I'm hoping that someday that this will be over and your life can return to what a traditional public health medical officer of health would be doing. I'm asking, and I'm not asking for you to support the provincial actions and to answer with that in mind. We've listened to your good advice for months now, and at no time have you specifically said that you have specifically said many things, but they've been consistent, washing hands, keeping distance, staying in small groups. That number has changed from time to time, and we've done our best to work with you on that. But at no point have you said that a family that goes and parks at Costco in Barrhaven, okay, and goes into that store with thousands of people, then comes out and wants to have supper at Lone Star, that they're at risk because they want to go to Kelsey's, or they want to go to Eastside Mario's, or any of the ones they don't even have to move their car for, in places where the distancing far exceeds what they have just experienced at the Costco, the Walmart, etc. I mean, this is common in our very large geographic city. that these opportunities are around, but at no point have you ever. So I'm asking if you have any evidence that points to restaurants as points of the contagion. You know, for example, I think we've had 5 staff people in our facilities that have been proven to have COVID, but not one of them came from the facility. They came from connections that they had outside. And those connections, as you said, people are traveling around more. They've had their aha moment where the numbers went down, and I think, you know, going back to school, universities, and all of that stuff has contributed. So I'm not asking you if you support the provincial actions. I'm asking you if there's any data that demonstrates that restaurants are contributing to the COVID surge because they're restaurants, because they're bars, because they have been proven to be where contagion is spreading. Because you haven't said that before. So
yeah, what we know is that people who have tested positive for the virus have been in restaurants and bars while they've been infectious.
Have they been in Costco? Have they been at school? Have they been at hockey? You see, this is, and so, you know, this is why Councillor El-Shantari and I have a motion to support our businesses in this city that have played by every rule, that have invested so much of their own money into, whether it's plexiglass, whether it's, you know, a different type of table, whether it's better coverage for patios, whether it's heaters for patios. We're going to be asking them, Councillor Tierney was telling me we may be asking them if they would be paying for extra snow plowing. I mean, I know for a fact that I have certainly not heard of one experience where anybody has gone into a situation and hasn't been very positive about, wow, I can't believe what such and such a restaurant did. I really felt comfortable with my family. And I know that your recommendation was reduce the number at the tables to 6. But the province made a decision, and I really don't think that you would know this. You would not have proof of this. But how do we know that those real facts that they've experienced, that they have from Toronto, haven't weighed heavily in the decision, and we've been painted with the same brush, not for the science and the facts, but because that's what would be fair to do in our province, because we're one of the 3 large centers of COVID contagion. We don't know that, do we? That's what I'm asking. We do not know that for sure.
No, I don't know all of those variables that went into the decision making. I do want to pick up on something you alluded to, Councillor, around the risks also in other kinds of businesses, right? So larger stores where there may be many people in the stores. You know, I think we need to go back to the basics here, and then I am looking at how to remind other businesses, larger stores and others, that it is about wearing masks and keeping distance in those stores. So if the stores are letting in too many people that it becomes hard to be distanced, that's a risk. It is. And if people aren't wearing masks indoors, that's a risk. I think the challenge with restaurants and bars is we know people take off their masks to eat and drink. And so there's more of a risk there potentially, you know, again, based on what we see in other jurisdictions.
So just one thing to wrap it up from my perspective, and I don't think it's been said by anyone previously today. How will we know what success looks like? So as you know, at the beginning, back in March, where, you know, the forecast, et cetera, were, you know, predictable in the fact that you were right most of the time, or very, very close to it. How will we know that the decision that has been forced upon these businesses that have been working hard to comply, how do we know that that decision will be successful? How can we know that when we don't have the facts that say that they were absolutely the cause in the first place? And wouldn't it be true that during the 28 days, it's likely, because we're going to hammer away at everybody like we did, and we're going to say, make it smaller, et cetera, we're closing whole high schools. Councillor Meehan and I have 2 high schools totally closed in Barrhaven and Riverside South. That's going to have a bigger influence than not letting somebody go to
30 seconds.
So my question is, will we be able to know that that was the right decision? And is that fair to the businesses that we've enforced that upon?
Thank you. Again, I can't speak for the province in terms of what they're looking to measure for success, but I think we have similar goals locally and provincially to decrease the hospitalizations and deaths. And so we would be looking for a shift in the number of people testing positive downwards, the number of hospitalizations slowing, stabilizing. I'm not sure hospitalizations will decrease that quickly because it takes time to get hospitalized and people stay in hospital for a while, but we'd want it to stabilize. And I do think overall, this is a democratic conversation about how do we want to live with the virus. And so the measures of success do need to be defined by the public, by elected officials who are trying to balance COVID with societal disruption. And so I think that how much disruption, what disruption can we tolerate as a society is a good question that we don't know the answer to right now. It's changing and evolving situation, but where many schools are closed, where many long-term care homes are affected, I'm pretty sure there's less tolerance for those kinds of measures. So I would expect those kinds of measures would also be important in gauging success.
Thank you.
All right, thank you. Conseil Fleury, s'il vous plaît.
Yes, Monsieur le Maire.
Thank you very much. You're answering very well to our questions. I would like to go back to one breaking news. It was a few weeks ago. So I would like to have your opinions. We know that there are many workers, many families are either living in Gatineau, crossing the bridge to work in Ottawa. They do this regularly. So do you have any discussion with public health in Gatineau or in Quebec about what's going on in the Ottawa region? Because some establishments in Gatineau are treating Ottawa as a hot spot. So how can we know if Ottawa is a worse hot spot than Gatineau? So do you have any discussions with public health in the Quebec side? Yes. We are discussing regularly with our colleagues across the border, and they have a similar situation than us. We talked to the media about 2 weeks ago, and our situations are very similar. We're our 2 hotspot. We have 2 red status. They also have a raise in the number of hospitalization. And the population that's the most affected is age 40 years old and less, or younger than 40 years of age. So we're following about the same epidemiology curve. So we're not at a higher risk, neither they are. Because together, we have more transmission opportunity if we consider the 2 cities. We discussed this earlier today, and you were very clear, and thank you very much for that. You talked about Halloween. it's different than what was announced at the national level. So we're in a red zone because we're the highest number of positive cases in Ontario. So what kind of message is sent to the parents and to the schools? Because it's different than what was published at the national level.
On our website, but I can see that we need to do more proactive communication to be very clear. So thank you, Councillor Zansbury, for highlighting the specific question about trick-or-treating that needs to be answered clearly, and we will push that out on different channels.
Okay. And my final question, I want to make sure I'm coherent on two motions that are coming in front of us. I think one was presented, and I lean to agree with Jeff on the matter, which is data is always a positive thing. So asking for the province to clarify what data source they chose in making decisions last Friday, that's great. You know, we can, no one will debate that. But I want to make sure I'm also coherent on the second one. So we have a motion in front of us as it relates to winter patios. And what I've heard so far is seems to say that there's less risk of transmission on exterior patios, but I want to make sure that that is the latest data and that council votes knowing that ahead of time.
Yes, outdoor activities are safer than indoors. You know, it's hard to predict through the winter. I'm really hoping we can turn this around and enjoy the holidays more, but especially, you know, the advice would remain right now that people gather just with their household members.
Even at exterior restaurants?
Yes.
Would additional measures of wearing masks at outdoor patios be another element?
Yeah, the gathering with people outside your household is possible with physical distance. You know, doing that, keeping 2 meters away from others, that can be harder on a patio, but that is possible. Yeah, and wearing masks when you can't physically distance, wearing the mask also reduces the risk, yes.
So you're, as our medical officer of health, you're comfortable with the motion, or do you have concerns with the idea of continuing the expansion of patios through the winter, or through the fall at the very least?
That's I actually haven't presented with this before. I think the importance is that people think about where are they connecting with people outside their household and reduce those opportunities. So that's a different question from whether patios can stay open or not. And I appreciate the desire to help businesses have opportunities to be able to have some more business. I think that is important as well.
Okay. Not as clear as that.
Anything else, Councillor? Councillor Fleury? Oh, okay. Councillor Deans, please.
Thank you, Mr. Mayor. I know this has gone on a while, so I'll try and be brief. I wanted to start by saying thank you to you, Dr. Etches, for your very steady hand in helping lead us through all of these trying times. I know that it's got to be a difficult job for you and your team at Public Health, and I know my constituents appreciate the work that you're doing, so thank you very much. There's two areas that I'm concerned about, and I agree with a lot of my colleagues today. Like, first off, let me just say I get that the health of the public trumps everything. That is the number one concern that we need to have our minds on. The health of our business community is also a consideration, and so I think what you're hearing today about evidence-based decision-making and having some sort of measure of what success would look like is important to us, because if we want people to follow the lead, there has to be some grounding in that, some science to back up that. And so I agree with the motion today that we support the BIAs in looking for that evidence. I think that's really important. My question is, what would happen 28 days from now if we're still in the red zone, if we haven't seen a substantial improvement? Because I know that there are a lot of businesses that feel that they are at the tipping point, and I know some help has come, but these are people's livelihoods. It's the health of our community. And I guess there's a lot of concern right now about what's going to happen if this continues too long to the businesses in the city. So if you were to be asked by the province 28 days from now for your advice, what will your advice be?
Obviously, I can't really say exactly what my advice will be in 28 days because it will depend on the context. But I can tell you your concern that the scenario you put forward was, what if things haven't improved? I can tell you what we'll have by 28 days from now is more information about where is that transmission occurring. If restaurants and bars will be closed, so we'll see, well, if there's ongoing cases of people testing positive, where is it coming from? And so we'll be able to provide that feedback to the province to say, here are the sources of transmission that are keeping the level high, and we'll be able to potentially propose more targeted measures at, what is driving the numbers. To the best of our ability. You can see there's challenges in getting perfect information given people have many exposures, but this one, restaurants and bars will be taken out of the equation.
Thank you for that answer. I appreciate it. The other area that I'm just a little bit concerned about, and I know we've talked about it a lot this morning, is around Halloween. Because when the top public health doctor in Canada says that Halloween can be safe as long as people maintain physical distancing while trick-or-treating outside, stick to prepackaged treats, and have hand sanitizers available, it's okay. And I heard what you said, Dr. Etches, that we are, in the red zone and we have to be particularly careful. But, as a parent, I am sure there's a lot of people out there sort of head-scratching, saying, our local medical officer of health says we need to stick to our own households and do things differently, but Canada's medical officer of health says it's fine as long as we follow the rules, wear a mask, use hand sanitizers, all of those things. And so it's very confusing, I think, to the public. And I guess my question is, so this is your guideline, but it's not an edict? Like, you're not saying don't do it? Because I don't even know whether to buy candy. I don't know if the kids on my street are coming to the door or not this year. And I'm sure that there's a lot of confusion, especially because we have two well-respected medical officers of health that seem to be giving us conflicting advice. So how would you square that circle?
Well, Dr. Tam said to follow the direction of your local medical officer of health. So she is not contradicting my advice. She's pointing to me and saying, follow her, advice, because your local medical officer of health knows best what the situation is in your city. I think we're just at the beginning of maybe sending more clear messaging about do not trick or treat. And so we will have to, clarify what we mean by doing things differently, in terms of keeping to your household. But it is consistent. My desire in saying don't go out door to door is to be consistent with our other advice locally, which is, and the province of Ontario said, limit your trips outside the household to essential activities. And so, it's consistent for me to say the trick-or-treating in that way is not essential. But of course, it's a fun celebration. There's ways kids want the candy. I've got two little boys in my house. They started every day. I get asked, "How many days till Halloween now, Mommy? How many days till Halloween?" Every day for a week. So it is important to find new ways. And I hope we can clarify that and provide more understanding of the rationale given where we're at right now.
Okay, thank you. Those are all my questions. And thanks again for a job well done.
Excuse me. Thank you, Councillor Deans. Councillor Menard, I believe, is our last speaker.
Very much, Mayor, and thank you, Dr. Etches, for your leadership and your clarity today. My son is also excited about Halloween and asking me regularly because he's excited about dressing up, and he'll still dress up this year no matter what. My question is really around flu vaccines and the vaccinations that we have in Ottawa ongoing. Some some of the stores have run out of flu vaccine. And there's a concern. I've been getting a few emails just in the last couple of days that some folks have run out. And so I'm just wondering if you can give council an update on vaccinations and if there's any reason for concern in terms of some of the pharmacies having run out and when they might be restocked in Ottawa.
I actually can't speak to pharmacies' supply of vaccine because that's outside of the public health system. Pharmacies get their vaccine directly from the provincial government. And so I don't know what their supply situation is like. I know the provincial government has purchased more vaccine than usual. And so I think what could be happening is the supply to the province comes in batches, and then the province passes it on. So it may be that we're in between batches at the moment. That's more hypothetical. What I can tell you about is our supply that we get from the province. We have had enough to distribute to all the hospitals, all the long-term care, retirement homes, and also to the primary care providers who are asking for their supply. And we have been able to meet the demand with what we've got to date.
Okay, fantastic. I'm looking forward to those 6 different locations opening at the end of October for the clinics that OPH runs. So thank you for that. Thanks, Mayor.
Great, thank you. Thank you, Dr. Etches. Just one question. I get asked this all the time since the issue occurred. These two, what I politely refer to as idiots that got tested for COVID and then they bar hopped on Elgin Street and ended up shutting down 4 or 5 businesses, putting hundreds of people out of work for that period of time. Maybe you can explain, because I think some people are frustrated or curious as to why those individuals were not charged with anything under acts of parliament or local guidelines. Can you explain why those individuals were not charged? Because they ended up becoming potentially super spreaders as they went from bar to bar, not thinking of the consequences of the health of the other individuals and the staff of those facilities. Thank you.
Yes, it seems like it's a terrible outcome, and I really feel for those businesses and others whose employment was affected. The provincial regulations do not specifically, there's no law that people have to stay home when they've been tested for COVID, and so bylaw officers or police would not have the ability to specifically charge someone for that. There may be other behaviors under provincial regulation where the police or bylaw could take action, if there were things specifically not done. But I think it would be challenging. When you look at the Health Protection and Promotion Act, which I use to issue an order for people to stay self-isolated until they get their results back from their test, that legislation has a different purpose. It's not a policing legislation. It is about being able to get control of infectious diseases and get the information that we need to control infectious diseases. So it's not a public health function to go out and use that act to police. And in fact, it would be counterproductive to our overall goal of being able to have people come forward and share information with us. When we think about what's happening in our community, now we have, an average of 100 people per day who are testing positive for COVID. In each of those cases, something went wrong, right? In each of those cases, people were not distanced or, didn't wear a mask or gathered with somebody, and we can't be blaming people and punishing people when we need people to share information with us. And so that is our focus. We also can't be, preparing evidence and going to court, to try to spend our time that way. So, I think I'm very sorry for the businesses and what happened, and I hope that it sends a message that that's completely unacceptable. And if people want to see policing on that kind of thing, then that could be something that was considered for provincial regulations as well.
Okay, thank you very much. Okay, so thank you, Doctor. We'll see you at the media availability following council. And again, as you heard from all of my colleagues, that people are around the table and around the city are very appreciative of the long hours you and your team are putting in as we deal with COVID-19. So thank you again for your good work. So we'll get back to the regular agenda. So the postponement, since it's a replacement motion, we'll deal with during motions, and we'll go through the consent agenda now. Agriculture and Rural Affairs Committee Report 16, rapport numéro 16 du Comité de l'Agriculture et des Affaires Rurales, briefing on planning and development charges aspects of Bill 197 COVID-19 Economic Recovery Act. That the committee received this? Received? Item number 4, City of Ottawa zoning bylaw 2008-250 omnibus amendments Q3 2020. Carried?
Carried.
Audit committee, we have 2 motions that will come back and deal with that. FEDCO report number 17, we have a motion by Councillors Menard and McKinney on the budget process. We'll come back to that. Update on the 2019-2020 City Strategic Plan received. Item 8, surrender of right of first offer 2475 Regina Street. Carried. Item 9, acquisition of the Stonebridge Golf Course through the introduction of a special levy. Carried.
Carried.
Planning Committee report number 30. Item 10, zoning changes to regulate residential development in urban area inside the green belt. Carried.
Carried.
Next item is item 11, zoning bylaw 1131 and 1151 Terron Road, modification au règlement de zonage 1131 et 1151 chemin Terron. Carried.
Carried.
Item number 12, zoning bylaw, part of 3640 Greenbank Road. Carried.
Carried.
Item 13, corrections and bylaw clarifications, residential infill report, and R4 zoning review, phase 2 report. Carried.
Carried.
Transportation Committee report number 11, rapport numéro 11 du Comité des Transports, compte rendu sur le contrat de Precis Parklink. Carried.
Carried.
Item 15, Parking Services 2019 Annual Report. Received?
Received.
Item 16, Cycling Safety Review of High Volume Intersections. Received?
Mr. Mayor, it's Councillor King, and I have a direction.
Okay, we'll come back to that then. Item 17, River Road speed reductions to 60 kilometers an hour. Carried.
Carried.
Bulk consent agenda. Does anyone wish to remove anything from the bulk consent agenda? No? On the bulk consent agenda? Carried. Okay, the first held item is from the Audit Committee, report number 7, Office of the Auditor General, report on audit follow-ups. And we have a referral motion from Councillor Cloutier and Councillor Hubley on the item. So Councillor Cloutier, if you want to introduce and read the motion, please.
Looking for my unmute. Mr. Mayor, I understand that Councillor Meehan and Councillor Deans have a motion, and my motion refers that one. Should Councillor Meehan introduce her motion?
Yeah, I think we can both introduce them both.
Could you just confirm the agenda, Mr. Mayor? My understanding is the deferral from last meeting comes first. Is that not the case?
Well, no, because it's you've replaced the motion. It goes back to motion, so it'll be dealt with in about 4 items.
Okay, thanks.
So, Councillor Meehan, if you want to introduce your motion as well, and then we'll go back to Councillor Cloutier's motion, which is a referral motion. So, Councillor Meehan, do you have your motion there?
I'm looking for it right now. Okay, well, will you follow along with me then? I'm just trying to find it in my papers here.
Yeah, it's on the screen.
Okay, so it's fairly simple. Thank you very much, everyone. Whereas city management is committed to ensuring the timely implementation of audit recommendations, and whereas follow-up is a key component of an effective audit process in that it informs council as to whether recommendations have been implemented. Therefore, be it resolved that City Council direct the Office of the City Manager to submit quarterly a status report of the implementation of outstanding audit recommendations to members of the Audit Committee and Council for information, and, if required, serve notice to relevant staff to appear to respond to questions from members of Audit Committee and Council at a subsequent meeting of the Audit Committee. That is the motion, short and sweet, very simple.
Okay, thank you. And Councillor Cloutier, if Councillor Cloutier can introduce his motion, please.
Thank you, Mr. Mayor. I have a motion. Whereas the Audit Committee's terms of reference provide that the committee in part is responsible to council for receiving and resolving any audit recommendations where management does not agree, as directed by council, with receiving reports and additional background information on changed or disputed audit recommendations, and direct staff on next steps to make recommendations to council on potential resolutions, and receiving regular status reports on the city's implementation of accepted audit recommendations. And whereas there is a desire to establish a regular reporting schedule receiving status reports in addition to annual reports on follow-ups on the city's implementation of accepted audit recommendations, and whereas the city clerk's office is currently undertaking the midterm governance review, and such matters are often addressed as part of the governance review process. Therefore, be it resolved that City Council refer the issue of establishing a regular reporting schedule for the Audit Committee to receive status reports on the city's implementation of accepted audit recommendations to the midterm governance review process, and it further resolved that the Meehan Dean's motion be referred for consideration as part of this process.
Okay, so we have a referral motion for both motions to go into the mid-term governance report. So speaking on referral, please, Councillor El-Shantiri.
Thank you, Mr. Mayor. I wasn't going to speak on the referral. I was just, I put my hand up to ask Mr. O'Connor. Mr. Mayor, before we go to referral, we do have a policy we established to the Audit Committee way back, and that was on a recommendation of the auditor at that time to give time to management, and then he will come back and every once in a while we receive a full report from the auditor to tell us what's been accomplished and what's not. So I'm not sure. I don't mind if we're going to defer to the midterm government, but I think we have a policy. I'd like to hear from the city clerk what happened to that policy, and in a motion like this, has staff agreed to this motion? Does the clerk's office have any information he can provide us?
Mr. Mayor, I'll answer that. It's the clerk. I don't have immediately in front of me the policy that the member is speaking of. Having said that, I was working with, quite frankly, both the members over the last few weeks trying to wrestle this issue to the ground. And I am supportive of it going to midterm governance. As the member is aware, we've spoken to, I think yesterday we did our new member of council, so we've spoken to all members of council, and I'll be working with the Auditor General should this motion pass for referral to see what the best practices are out there and what council can deal with it in the future.
And if I can follow up, Mr. Mayor, with the city clerk, Mr. Clerk, on page 35 of the original Auditor General's work plan or condition, how the reporting mechanism and all this. So it is there. I would like to know, when you revisit this in the midterm, would you revisit that policy and tell us what are you recommended to change from what to what? Because I'd be interested, because we all know auditing, it costs a lot of time, a lot of staff time, and a lot of effort, and I want to make sure we don't be chasing ourselves with our staff just to fill up that. I'd like to know what is the old policy, because the old policy, I believe it worked for us for many years.
The answer is yes, Mr. Mayor. We will be looking at that and following through.
Thank you, Mr. Mayor, and I will support Mr. Mayor just to be for a mid-government review. Thank you.
Thank you very much. On referral, Councillor Deans.
Thank you very much, Mr. Mayor. Councillor Meehan asked me to second this motion. I was happy to do so. I think that it's absolutely imperative that once we receive audits and receive recommendations on how we need to be doing things differently, that there is follow-up on so doing to make sure that there's accountability in the system. And
Councillor Deans, just we're only on referral right now, not on the substance of the motion.
I'm getting there, Mr. Mayor. I am getting there. So to me, it seems like a very simple thing. She's recommending a quarterly report. Seems absolutely reasonable. So in that regard, I don't see the need for a referral to midterm governance. And I know there are a lot of issues to be dealt with at midterm governance. This seems like a simple reporting mechanism that would be built into our reports that could be accomplished without going to midterm governance. So for that reason, I don't see the need to support a referral to midterm governance. I think the accountability is clear in this motion, and we should just accept it. Thank you.
Great, thank you. On referral, please, Councillor Brockington.
Thank you, Mayor. Just to the clerk, can the clerk describe when the mid-year governance report in aggregate will be presented to council?
Yes, Mr. Mayor. At this point in time, we are now beginning our drafting phase, and we're looking towards the end of November to try to table it. So I would like to get it there at the end of November at the last council meeting, because I am very aware of the fact that there is a December 9th budget meeting, but it would be at the very latest on December 9th, but I'm trying for the second meeting in November.
And I don't know, Mayor, if this is in order, but I wanted to ask the chair of audit, because I did not participate in those meetings, is the reporting frequency by senior management back to the committee the one glaring issue that they're trying to address, or is there anything else we need to be aware of to send to mid-year governance?
Yeah, I'll ask the chair of the committee to answer that during his wrap-up, because we really should stick to referral, Councillor Brockington. So I think he heard your question, and hopefully he'll address it when he does his wrap-up comments as the mover of the motion. So do you have anything else on referral?
No, I will be supporting both referrals.
Okay, thank you. Councillor Meehan, please. On referral.
On referral, okay. I would like to say that we have hired and we pay Auditor General staff for a very simple reason: to audit city departments and services with the intent of finding efficiencies and to save us money. And we pay a good amount of our budget towards that. And I firmly believe in the audit process. But in the 2 years that I've been sitting on audit committee, it's become abundantly clear that for some reason, the audit recommendations that comes down from the AG are not being implemented. They're not being implemented as...
Councillor, sorry, we have to stick to referral according to the procedure bylaw, so you have to speak on whether you support or don't support referral.
Okay, I'll just say very simply then that I don't support referral at this time, Mr. Mayor, because the intent of my motion is to just implement a review mechanism, a reporting mechanism that will do the job of helping staff do their job of implementing recommendations. Referring it at this point, I don't see the point of it. I'm not increasing anyone's workload. We already have, the city manager already has a mechanism where he keeps track of these audit recommendations, but by reporting to us quarterly, it keeps those recommendations top of mind and managers are reminded of work that has to be done. Why we would refer this right now to midterm governance is really quite baffling for me. I would like to see my council colleagues support a very simple motion that I think will go a long way to getting these recommendations, more of them, implemented.
Great. Thank you for dealing with referral. Anyone else wish to speak on referral? Conseiller Fleury.
I'm furious. Could the city clerk tell me when we'll see recommendations for the mid-governance report? I thought it would be before the end of the year. That might be something that could be simple if we have a comprehensive plan at the mid-mandate. I think the clerk said that he will be tabling the report at the end of November or the first meeting in December 9th. Any other questions?
Wrap up on the referral motion is Councillor Meehan, you've spoken already. I see your hand up there, but we're going back to the motion of referral, which is Councillor Cloutier. Councillor Cloutier, to wrap up on referral only, please.
On referral only, thank you very much, and thank you to my colleagues who've commented, Councillor El-Shantieri and Deans, and Councillor Meehan, who spoke about this simple process. But I will point out on referral, the reasons for referral is that Councillor Meehan has come up with 6 versions of the motion that we are seeing from her and Councillor Deans today, and some of them were not compliant with special meeting provisions and rules of procedure. So it is not that simple. My motion provides us 5 weeks or so until midterm governance, provides us with the time to get this right. The audit process is very important. I am a big fan as an accountant. I want better, I want more timely implementation of the recommendations, and on referral, Mr. Mayor, I want a robust and clear message to ensure that staff are on the right path and that the implementation of recommendations is timely. And as chair of the audit committee, I want to make that happen. And it's through giving us just a little bit more time to get that reporting right, the right frequency, the right reports for the audit committee to deal with, that we will be transparent and we will be rigorous. And
so on referral?
So on referral, I would ask for the support of my colleague for the referral motion.
Okay, thank you. So I'll just offer some comments. I'm going to support the motion to refer. I think there are, we've got 3 members of the audit committee that have roughly the same objective to ensure that we have a proper follow-up to audits that are done each and every year. And I think there's a necessity to allow all members of council to speak on this issue, and that's why referring it to the midterm governance that is conducted by the clerk makes the most sense. It gives members of council a chance to see a little more detail in terms of the 2 motions, and we would come back literally within the next several weeks with a recommendation from the clerk in the midterm governance report. So I would encourage members to vote for referral, and we'll have yeas and nays on referral. Madam Deputy Clerk.
Councillor Harder.
Yes.
Conseiller Cloutier.
Oui.
Councillor Luloff.
Yes.
Councillor Eglai.
Yes.
Councillor Leeper.
Yes.
Councillor Hubley.
Yes.
Councillor DeRoos.
Yes.
Councillor Moffat.
Yes.
Councillor King?
Yes.
Councillor Tierney?
Yes.
Councillor Dudas?
Yes.
Councillor Suds?
Yes.
Conseil Fleury?
Oui.
Councillor Gower?
Yes.
Councillor El Shantiri?
Yes.
Councillor McKenney?
No.
Councillor Meehan?
Did you say anything in an email? Just like for sharing this with us?
Yeah, thank you. I'm looking for whatever. And then
Sorry, George, your mic's on.
Councillor Meehan?
Do I get I don't get any chance to explain my motion then?
We're voting now, Councillor. So yes or no?
Councillor Meehan? No? Thank you. Councillor Menard?
No.
Councillor Kavanagh?
No.
Councillor Shirelli?
No.
Councillor Kitts?
Councillor Kitts, your mic.
Councillor Kitts?
Yes.
Thank you. Thank you. Councillor Brockington?
Yes.
Councillor Deans?
No.
Mayor Watson?
Yes.
18 yeas, 6 nays.
Okay. Our next item is item number. So we have to, on the report as amended, carried. Item 6, proposed 2021 budget directions, timeline, and consultation process. I believe Councillor Menard has a motion. Councillor Menard, if you'd like to introduce your motion, please.
Yes, thanks very much, Mr. Mayor. This is an amendment to the budget directions that we saw previously. Whereas the City of Ottawa is grappling with a global pandemic that is seeing significant strain on the capacity of Ottawa Public Health and other public services, and whereas it remains unclear how long our city will be operating under these conditions, but these conditions could last for the length of the forthcoming fiscal year and beyond, and whereas the public has expressed a clear desire to see changes in the way policing is conducted, and whereas the service calls for policing have declined during COVID-19, and whereas public health and affordable housing investments can act as prevention measures for further harm and are required to a greater degree now than before the pandemic, and whereas the 2020 base budget for Ottawa Police Service is $291 million, with a 3% tax increase estimated to be $8.8 million, and the estimated 1.5 assessment increase estimated to be another $4.3 million, for a combined potential total of up to $13.1 million of additional budget expenditures. And whereas the 2020 base budget for the municipal tax base for Ottawa Public Health is only $22.59 million, with a 2.5% tax increase estimated to be only $580,000, and the estimated 1.5% assessment increase estimated to be only $340,000, for a combined potential total of up to $920,000 of additional budget expenditures. And whereas the Ottawa Police budget has been one of the fastest growing line items in the city, outpacing inflation, population growth, and municipal tax increases since 2001, and whereas City Council should not be financially prioritizing policing over public health during a global pandemic, therefore be it resolved that the recommendation 2A2 of the proposed 2021 budget directions, timeline, and consultation process be amended as follows. The Ottawa Police Services levy be increased by no more than 1.5%, and that Council requests that Police Services Board develop their draft budget based on this tax increase. Be it further resolved that the corresponding savings be directed to Ottawa Public Health over and above the 2.5% cap.
Okay, you can speak to it, Councillor.
Thanks very much, Mayor. This motion is being brought forward, not proposing we're not proposing cuts to the police budget with this motion. What we are proposing is that their budget increase be more modest this year, $8.7 million instead of $13.1 million. So it's a $4 million transfer we're talking about during the global pandemic, and that we direct resources towards OPH, which is a priority at this time. We heard the medical officer of health today speaking about this, and the services that are in incredible need right now that we're not able to fulfill. And OPS will still receive a significant increase in budget if this motion passes. At the end of the day, I don't believe the OPS budget should see an increase that is 10 times greater than the municipal tax base than OPH during a pandemic. Despite the fact that OPS service requests are down and serious crime is down, while a second wave of pandemic is underway, if Ottawans knew fully that we were talking about increasing the police budget this much in comparison to OPH, I don't think they'd support it. And so we know that public health could do with more funds. There could be enhanced testing and contract tracing efforts. We've heard already about dental clinics that have had to close. We are talking about, the type of work that public health normally conducts, not able to be done, that usually saves us money. And so, this is the type of thing that our partners have asked for in terms of an increase in what public health expenditures are on, because the need for other services has been shifted as a result of COVID. And so this is a very minor change that we'd be requesting and would help us set on a course that finds money that doesn't increase taxes, but that, better points to our current situation that we're experiencing now. I'll have more on wrap up, Mr. Mayor. Back to you.
Okay, thank you. We have a number of people who wish to speak or question. We'll do that combined as always. Councillor Luloff, please.
Thank you very much, Mr. Mayor. And I put my hand up before I saw that Councillor Deans was going to put her hand up. I'm really interested to hear what she has to say on this. I believe she's up next. I'm not a big fan of robbing from Peter to pay Paul at this council table and setting these sorts of directions before we've had a chance to discuss this budget with our constituents. But with that, I will leave it to the chair of the Ottawa Police Board to provide her comments on this motion. Thank you.
Great, thank you, Councillor Luloff. Councillor Deans, please.
Well, thank you, Mr. Mayor, and thank you, Councillor Luloff, for your faith in me. I am the chair of the Police Services Board, and I do want to offer some comments on this motion. And let me agree with Councillor Luloff first that my feeling on public health spending is that it should stand on its own merits, and if council determines in their wisdom that public health should receive more money because of the COVID-19 virus, then we should make that decision independent of whether or not we cut the police services budget. But on police services, it's an interesting time for policing. Policing absolutely relies on the public trust and confidence of the community. And we have seen just far too many times, not just locally, but across North America and around the world, the erosion of confidence in our police services. There have just been too many tragic incidents that have ultimately led to calls for defunding police. Of course, the solution is not a simple budget solution. It's a very complex solution, and it takes time, and it takes the desire and the willingness to change. I can tell you we have a chief and Chief Slowly that is committed to change. We have a board that is absolutely committed to change, and we have a police service that recognizes that change is coming and change is needed. With all of that said, we haven't waited on a budget cycle to start that change. There has been a lot of change happening. I can tell you the mayor and I are introducing a motion at today's council meeting, one similar to the one that just passed at the Police Services Board, asking the province to give us the right to suspend without pay or terminate members of the police service for egregious acts of misconduct or criminal acts. We've done that. We've taken great strides forward in workplace sexual violence and harassment. We just hired Janice Rubin of Rubin Tomlinson in Toronto to do intake and to do a whole cultural review inside Ottawa Police. That, by the way, costs a lot of money. We have an EDI action plan that we're rolling out, and you will soon be hearing about our new mental health strategy. So there is a lot of change happening inside police. Without preempting myself on our budget highlights, let me just tell you that you'll be hearing about new neighborhood resource teams. You'll hear the mental health strategy. You'll hear new investments for violence against women services.
Sorry, Councillor. Councillor, sorry, someone's phone is ringing and it's very distracting for Councillor Deans. Can someone turn that phone off? Oh, okay, we got it. I think. Just hold on just for a second. Okay, go ahead. No, it's still ringing. Sorry.
We can't hear it here, sir.
Okay. Well, all right. I'm not hearing things. I know that. There is a phone ringing somewhere in here. But anyways, carry on. If you're not hearing it, go ahead, Diane.
Okay, thanks, Mr. Mayor. You'll be hearing about new investments in violence against women's services, including more sexual assault investigators with a specific focus on supporting Indigenous women. And we'll continue our ongoing efforts on equity, diversity, and inclusion, both within OPS and in our service to the community. I can tell you that this 3-year approach that we're embarking on is going to make a significant change. The budget is being developed based on targets previously recommended by this council. Cutting our budget or reducing the budget that we get this year will result in service reductions and will erode our ability to achieve and realize the change that I think we all are seeking. I think our goal is the same. I recognize that City Council has been somewhat frustrated in not being able to participate as much as they would like in the police setting of priorities in the police services budget. And that's why we're changing our process this year to give the opportunity to members of council to come to the budget deliberations, the committee meeting, and to engage with the board members. And I think that, we all have a role to play in making sure that we support this community and we bring about the change in the police service that the public is crying out for. I recognize the goal of this motion is well-intentioned. I disagree with the tool. The board wants change. The board needs to invest in change, and that costs money. And so this is not the time, in my estimation, to be cutting the budget. A simple budget reduction is not going to take us where we all want to go. And that's why, to my mind, if you want to do something to make a change, then make some suggestions to the board. Come and participate in a board meeting. Make suggestions to the board. Come and tell us you want us to engage more with the community. You want us to do community roundtables. Come and tell us what you think it will take to get us where we all need to go, which is to build that public trust and confidence in the police service. But just reducing our budget at a time when we need those budgets to make the change, to me, is not the answer. So I certainly couldn't support this motion. Thank you.
Thank you, Councillor. Councillor McKenney, please, the seconder of the motion.
Yes, thank you, Mr. Mayor. I just want to start by saying, if without the budget, the change in the budget directions for Ottawa Public Health, we're not going to see an increase beyond 2.5%. So we know that that's what we're going to see, 2.5%. And as far as taking from Peter to pay for Paul, those are the rules that have already been set up for us. They were set up for us many, many years ago, and it's what we're always under pressure to do. So here we are doing it. We have budget directions in front of us that only allow for 2.5% increase for public health, and we're in the middle of a pandemic. And I can tell you that in Somerset Ward, Somerset West Community Health Centre had to reduce its outreach to people in this community living in rooming houses because they had a shortage of public health nurses. They had a nursing shortage. They actually had to cut the hours of their supervised consumption service. So people were left in an opioid crisis, in a pandemic, in a housing emergency with less nurses. We know that we need mobile clinics going into targeted neighborhoods, and we can't get that. Dr. Etches just told us We need to grow the team for contact tracing. We're going to be looking at a motion that's going to ask us to go to Doug Ford to ask him for data. And we are not able to do the contact tracing that we need to do in this city because public health doesn't have the funding that it needs. Our health system is in crisis because we have cut it back at each level for decades. And what we're asking is, you know what? Instead of giving this much more to police, whose budget has been increasing at a higher rate than anyone else's, give a bit less and give it over during a pandemic to Ottawa Public Health so that they can do the work that we need them to do, to keep restaurants and bars open. How do you think we're going to get the information? How do you think we're going to get mobile clinics into targeted neighborhoods, low-income and racialized communities without more funding? It's not going to happen. So it's, I'm going to preempt the mayor because I know he's going to mention it in his closing remarks and I never get a chance to respond back. So I'm going to preempt him. I'm going to say to you, same councillor, me, said it before publicly, also is coming and asking for more police resources in their community. And he's not wrong. We are getting a neighborhood response team. So we're getting better policing than what we've had, NRT, but I have said it time and time again, publicly, here, publicly, in the media, to my community, to the chief. I would take 5 mental health workers in this ward over an NRT any day. I'm not saying we don't need policing. I'm saying I need mental health workers. We have to stop criminalizing poverty. I have a man sleeping on Anderson with a little lean-to up against an old abandoned home. And you know what my only option is? Calling police. We criminalize poverty. We criminalize homelessness. We criminalize addiction. And we're going to continue to until we have the resources to do something different. And all we're asking for here is let's look at doing something different. Maybe it'll meet all of our objectives. Maybe we will be able to open up bars and restaurants because we'll have the information that we need. We'll be able to go into targeted neighborhoods and stop the spread of COVID in low-income and racialized communities. We'll be able to respond to our opioid crisis, to our homelessness emergency. That's all we're asking for. I don't see this totally radical here, but I'm going to leave it at that. I would please reconsider, think about what we're asking, more money in public health during a pandemic. Thank you.
Thank you, Councillor. Conseiller Fleury, s'il vous plaît.
Thank you very much, Mr. Mayor.
So I just want to clarify the process. So we approved the strategic plan, and then the budget directions are my understanding, is a sort of a coordinated effort between the city manager and the mayor's office. Is that fair to say?
Yeah, it's similar to what we've done, Councillor, for the last several years, where Council gives direction to the city manager and myself to come back with a budget within the parameters of, in this case, 3%. And then we present the budget, table the budget in November, and deal with it in December after public consultation. So you're correct.
I did participate at FEDCO, and I wonder our assumptions. I wonder our assumptions now that we're in phase 2 as it relates to some of the transit revenues and specifically revenue in social services and Parks and Rec more particularly. So I wonder if, I don't know if our CFO is on the line, if Wendy could comment on.
Yeah, Mr. Mayor, Wendy's on the line, so she can answer that.
Wendy?
Yeah, thank you, Mr. Mayor. And good afternoon, Councillor. In terms of the budget directions and the report that we went forward with at FEDCO, when we talked about the assumptions, you're correct in terms of that tax target. But the other underlying assumption that we've made in our budget directions for 2021 is that the other levels of government will fill those voids. So where we need help next year, they're going to step in and help us. And behind that, if we don't get that assistance, then we've built in our mitigations that will get us through the year. So if there's additional monies that are needed, whether it be for transit, parks and rec, public health, those are built into our assumptions in terms of the budget directions.
Can you give us what is our OC transport assumption, for example? What's that shortfall in revenue that you're predicting in 2021?
So you'll see that when we table the budget. I think we're talking about, I think it's a 40% ridership gap, which could be to the tune of $50 to $60 million next year.
Yeah, so I guess my question then is to the mayor. Mr. Mayor, I struggle with the budget direction this year more than others because of the period. I recognize everyone's work to get the backfill of some of our revenue losses from provincial and federal government. Can you give us an insight of what you and the city manager have in mind? Because it's really a status quo budget in many respects. It doesn't appear to recognize the period we're in and the major shortfalls. And we don't know when we're going to come out of this and regrow to our expected revenue levels. So I'm concerned about that.
Yeah, I think, Councillor, you hit the nail on the head. That's exactly the dilemma we're all facing with respect to putting this budget together. It's going to be a challenging budget because there are so many unknowns for the year 2021. As you know, we've received, I believe last week, Wendy, $75 million, which is the transit portion of the $124.5 million that we needed to fill the gap of $192 million. So we're still short some $60 million. But when I had discussions with ministers at the provincial level, they assured me that there was an application process, which we're in the process of submitting and sending back to the province to make up the shortfall of that $60+ million that we need to keep the city whole and deficit free by the end of the year. Part of the financial planning for the transit money is to go into January, February, and March, so we do have a little bit of flexibility with transit dollars in those 3 months, but we will definitely, as every other municipality has attested to, we'll definitely need to go back to the provincial and federal governments for similar support, if not as much as the 192, because we hope by mid next year, the summer months, the COVID crisis has subsided, but we don't know. So we have, obviously the mechanisms with our reserves and so on that we don't want to dip into. We believe that there is a role for the federal and provincial government to provide us funding as they've done so far this year. And we anticipate every mayor I've talked to in Ontario is going to need that support for their budget in 2021 because, of course, we're not magically going to see an increase in our ridership on January 1st of 2021. It's going to take some time to build that back, and the same with our recreation programs where we're losing significant dollars in registration fees. So I hope that helps.
I'm happy that we're on the same page as the risk areas. I guess I think this budget will be challenging for our council because there'll be a number of different mindsets, some who will agree to keep the status quo, those who have seen emerging issues through COVID and will want to see a meaningful pivot out of the pandemic. And I guess that's where I sit. I think we've seen emerging number of risks as it relates to housing, as it relates to our responsibility. Like I think the patio is a good example of that, right? We've had additional costs to respond to supporting our businesses reopening. So I will support the motion from Councillor Manal, not on the basis of police versus police, because I think that's the wrong mindset. But I do think residents of Ottawa are expecting us to come out of the pandemic with a pivot. So, I will support the motion. I won't support the budget direction because I think it's too much of a steady quo. I think there's so much risk, yet I understand we have to come up with a budget and have the debate at the committee. So I'll signify that at this point.
Thank you very much. Next is Councillor Hubley.
Thank you, Mr. Mayor. I just want to clarify something. Do we have a budget ask for this money from OPH, or is this just the councillor wants to add more money into their budget?
Sorry.
Mr. Mayor, do you want?
Sorry, Councillor Hubley, your question is to who? Keith?
Do we have, I guess I could go to the treasurer, do we have a budget ask for this money, or is it just the councillor wanting to take money from the police budget and put it somewhere?
Yeah, Councillor Eglai, you might want to answer that as the Chair of Ottawa Public Health. Have you put in a request above and beyond what's in the budget document at this stage, or has the board dealt with that?
The board has not tabled its budget yet. That is certainly in discussion. Dr. Etches is not wrong in what she said this morning, that COVID has taken a big bite out of our core services. So the question becomes, who funds that? I'm going to speak to that later in my turn. But to answer Councillor Hubley, we have not tabled our budget yet, Councillor Hubley. That is very much under discussion. I had meetings with our finance people earlier this week, and Dr. Etches, and we're looking at the numbers very seriously now as to what the sources might be, what the options might be for when we table our budget with the board.
Okay, thank you. Back to Councillor Hubley.
Yeah, thank you, Mr. Mayor. And maybe if I could do one follow-up question to that as well. We heard one of the councillors mention that if we transfer $900,000, we may be able to reopen restaurants and bars with that money. Is there a dollar figure involved here that's causing us to close the restaurants and bars? Or I'm just trying to get where that number came from and that claim.
I'm not sure if that's directed towards me. I didn't make that claim, so I can't speak to how that number was arrived at, Councillor Hubley. I think that was I can't remember. Okay, yeah, it could have been Councillor McKenney that put that on the table.
Yeah, I'm not sure who it was, Mr. Mayor. I just heard it.
Yeah, it was me. I'm happy to respond to that. I was referring to Dr. Etches when she said that to do the contact tracing that we need to do, we need to grow the team. We know that we don't have the data we need because we've not been able to do the contact tracing. So it would seem reasonable to assume that if we could do the contact tracing, if we could do the work we need to do, we'd have the data that we're looking for from the provincial government within our own city to show us where the serious increase in COVID is coming from. So that was the assumption that I based that on. Thank you.
Okay, back to Councillor Hubley.
Okay. Thank you, Mr. Mayor. I think we're going to have to discuss this at budget time because if some of these restrictions have a dollar value to them like that, then we may want to look at special levies and so on, or work with the businesses impacted to gather the money so that they can get open again. Back to this motion, though, I'm really concerned with, I think it's a legitimate discussion to talk about money for public health during the pandemic. I certainly understand that. What I don't understand is why would we go and take it away from the police budget? The message that sends to the frontline men and women of the Ottawa Police Force that are out there every day keeping our communities safe through the pandemic and even when we didn't have a pandemic. As Councillor Deans mentioned, there's a lot of work underway within the police department that I think most of us would support what they're trying to do. So I'm not going to support taking any money away from that police budget. Thank you, Mr. Mayor.
Okay, thank you. Just a question to Mr. Kanellakis, because we've had a number of councillors raise the issue of this money going into the health budget. But in fact, every decision we take with respect to supporting an organization like the Ottawa Public Health does not necessarily mean a cash transfusion. My understanding is that we have lent several hundred people to OPH to help them with a number of tasks. Can you tell us how many people have gone from the city over to OPH to help them during this very challenging time, Mr. Kanellakis?
Thank you, Mr. Mayor. Yeah, in the early months when we had the stage 1 and then stage 2, we redeployed approximately 150 staff from city departments to OPH. As we moved into stage 3, most of those employees came back to their substantive positions, but HR has been working diligently for the last 5 months, hiring every month, and we've hired 853 people, which is a combination of full-time and casual pool that OPH can draw on to do contact tracing and a number of the other jobs that they need to be done. So OPH's regular FTE count is about 511 people. So that gives you kind of the sense of, how many people have been moved over to OPH to support them. As Dr. Etches said, there's still more that are required because they've got other responsibilities to do. And many of these physicians are not specialists like public health nurse and epidemiologists and data people. They're people that can man the phones, staff the phones, and do other things in some of the clinics, etc. So, but the city has been very helpful in doing that, and we've added those costs where we've had to hire onto the COVID column. As you'll see when we present the budget, there's the regular budget and there's a COVID column, which we're capturing all the costs, which are part of the accounting, which we're going to be sending to the province for the additional funding in the stage 2 of funding, Mr. Mayor.
Okay, thank you. Councillor Leeper, please.
Thank you very much, Mayor. A quick question first to the clerk. With respect to the Ottawa Public Health budget, does it work like the police budget in that, it is subject to the board, or do we have line item responsibility for OPH's budget?
No, Mr. Mayor, and I'll stand to be corrected by the city solicitor. However, no, it is only the police budget that has that formal restriction.
Okay, so there could be considerable, if this motion passed, there would be a significant transfer of money before they've passed their budget at Ottawa Public Health that would then as well be subject to further council discussion around the table when the final budget is passed.
That would be my assumption, Mr. Mayor.
Yeah. So I do want to just revisit quickly Councillor McKenney's extremely important point, which is that the entire budget process, as it has been set up for years now, is one in which we rob Peter to pay Paul. The mayor challenges us every year to adhere to a tax target. Councillors will slip sometimes and talk about it as a tax cap, in which we are challenged if we want to pay for something to find that money elsewhere in the budget. It forces us to make hard choices about what our priorities are with respect to the resources that the city taxpayer gives us. And I can't imagine a more opportune time to have that discussion than in this budget and to talk about what our priorities are. And I don't think it's too simplistic to talk about the opportunity we have right now to change our priorities from policing to health with respect to the most important issues that face communities. The most important issue, the most dangerous situations in my neighborhood are not issues that police are really able to deal with. Homelessness and poverty and addiction are the key issues that result in upsurges of needles in parks. That's not a police issue. We see an increase in the number of petty thefts from cars and such. That's not an issue that's going to go away by policing it away. You need to address the underlying causes there. We see issues associated with, people sleeping where the residents are uncomfortable seeing them sleeping. That's not a police issue. All of these issues come fundamentally down to poverty and health. And we've got the opportunity in this budget to say we're going to prioritize solving the health issues in our community that are having such a devastating impact on the quality of life for all residents of our city, not just those who have health challenges and addiction challenges and poverty challenges, but that are having such an effect on everybody who lives in this city. We need to start solving those issues. We have tried to solve those issues for a generation by increasing police budgets and to police our way out of social issues, and it hasn't worked. The motion that is put forward by Councillor Menard works within the framework that the mayor has set out for us, in which we choose within a disciplined tax cap how we're going to spend our resources. And the choice that Councillor Menard is asking us to make is an investment in health over policing as a rejigging of the budget balance that we have. And that is actually a choice that is going to pay long-term dividends. We know that addressing health issues is a better long-term investment than putting money into police. It's going to save the taxpayer money over the long haul. I congratulate Councillors McKenney and Menard for bringing this motion forward and for forcing us to have the kind of prioritization within a disciplined tax cap discussion that the mayor is always challenging us to have. And I know where my choice is going to be. My choice is going to be in the prudent expenditure of taxpayer money in long-term strategies that will save the taxpayer money and that will address the most important issues that are facing all of our residents. I'll be supporting Councillor Menard's motion, and today is a day that you can indicate to the city and to your residents that you understand how we're going to build a more sustainable, healthier city. I hope that you will support Councillor Menard's motion. Thank you, Chair.
That was 5 seconds to spare. Congratulations, Councillor Leeper. Well done. Our next speaker is Councillor Brockington, please.
Thank you, Mayor. I really appreciate the opening comments from Chair Deans about the vision of the OPS, the greater opportunities for engagement of members of council for the OPS budget. And I would invite every member of council to get more engaged in that, because as Chief slowly comes up on his 1-year anniversary, we need to have a better understanding of what the board's vision is and where they're going in light of everything that's happened in the past year. And yes, there is public pressure to look at how the OPS spends their dollars and whether all those dollars are appropriate under that umbrella and whether some of that should be transferred from them to other areas. So that's fair game for a conversation. But I think you need to have that analysis first before you start moving funds from one pot to another. This is about a budget direction. We're trying to give staff some indication to go back and finalize the draft budget. And here are some numbers for the major pots that we're giving you. It doesn't mean it's enshrined in stone. We still have the authority once we get into budget decisions to change those numbers. But this is to give staff some direction, and I support that. It shouldn't be Ottawa Public Health versus the Ottawa Police. It's our job to get into those budget lines and, like I said, understand where are their shortcomings, but also what are the needs. And so I want to hear from Chair Eglai. I want to hear from Chair Eglai today that he's okay with a 2.5% cap, because that's a standard increase that we normally look at in an average year, in a non-pandemic year. And we know that there are outstanding needs for Ottawa Public Health. And yes, he said they haven't tabled their budget yet, but no one has. This is a budget direction. And so we need to know that the direction that we are offering or we're going to approve today is as solid and accurate as it can be. I just want to ask the city manager, there was an amendment moved, I believe, at FEDCO that added Part 3 and 4 to the motion that we're going to be approving today. And Mr. City Manager, Part 3 is something I think you do every year anyway. It talks about staff reviewing operating budgets to identify areas for potential savings resulting from changes in residents' needs due to the pandemic. What does this motion direct you to do that's new, that you don't already do? I've been on your case for a while. I appreciate the memo you sent to council today. You list all the work that your staff have done over many years. I think that's very, very good. But does Part 3 of this motion direct you to do anything new, or do you already do that cyclical type of operational review where you're looking for savings?
Mr. Mayor, as I said in my memo that I sent to Council at Councillor Brockington's request today, in fact, we do that. I mean, the different context this year, of course, is that we're running a shortfall, so the discipline that's required to look at the budgets is looked at through a different lens. The equity lens is another thing that we're looking at very closely to make sure we don't cause more harm. But in fact, from a contextual point of view, this framework and portion item 3 of this motion is effectively what we bring to the budget every year before council even sees it. Because as any organization experiences, and we all know this, there are budget pressures that arise, and for us to meet the target that's set by council, we have to deal with those before we get to council. They have to be addressed and fit within the financial context, and that means we take some risks, we make some decisions across multiple departments, we move people around, we don't staff positions, we do a whole bunch of things to get back under that. And that's the discipline that I've said before. You've heard me before, Mr. Mayor, and I know I've had this conversation with Councillor Brockington. The 3% actually forces a discipline in the bureaucracy to do the things they need to do to get within 3. Otherwise, I'd be presenting a budget that's probably 4 and asking council to make the decision to get you back to where you want to get back to. We're doing that in advance.
And I appreciate that. Thank you, Mr. City Manager. Part 4 of the motion talks about the identification of projects that may be postponed from the 2021 budget year. During that process of identifying projects, can you also identify the risks of not proceeding with those projects in 2021 and what the elevated costs would be to the taxpayer if we choose to defer projects for 2, 3, 4, 5 years into the future? I assume you're going to do that risk analysis, but can you just comment on that as well?
Yeah, and I'll ask Wendy to jump in after I give my initial comments, but the practice we've used on this is to try to identify projects that might not have started anyway. So the first kind of triage is what things can we postpone that most likely wouldn't have started anyways. And then a risk is applied by infrastructure and the other departments that have these capital projects in terms of what would happen if we actually don't do them and we did them a year later. And that is part of the discussion, and that's why the list that's being produced that you'll see are ones that we are relatively very confident that we can push off and not create additional risk to the city because there is a comprehensive asset management policy that's applied, particularly to our capital projects. So Wendy, maybe you want to talk a little bit about some of the mechanics that the team has used with the departments. I think that'd be helpful to councillor.
Yeah, thanks very much. And I think just to add to what the city manager is saying, we definitely look at the risk. We look at, whether the projects are integrated or not. And if there's an integration with that project, then obviously the risk is increased. So we're going to put many lenses on these to determine whether it's a good candidate for deferral or not a good candidate for deferral. And I would suggest that Mr. Willis, works very closely with the departments and then has those conversations with the councillors in terms of what's happening. So a very thorough and risk-centric process in terms of what we're going to be looking at if we have to look at that.
I appreciate both of your answers. Thank you. I'll just close, Mayor, by saying that I will be supporting the budget direction recommendation in full today. It is a direction. Council has the ability, as we get into the meat of the various budgets, to make further changes. But I will say this. I am very concerned about a 2.5% levy for Ottawa Public Health. I need to have a much better understanding of what their needs are in 2021, and I'm certainly very open to making changes during this budget process, but we don't have that information today, and I just want to put that on record that during a pandemic, we should be resourcing Ottawa Public Health to the best of our ability. So thank you, Mayor.
Thanks, Councillor. Councillor Shirelli.
Thank you, Your Worship. I will not be supporting the motion.
Sorry, Councillor, we can't hear you. You want to repeat that? It just cut out.
thank you, Your Worship. I will not be supporting the motion. In looking at police over the last number of years, we see that we have a serious guns and gangs problem in the city. And in my ward, I know of 2 significant shootings where we had public meetings and extremely well-attended meetings where the message from people was clear. We do not have the number of people you would normally have working in guns and gangs at Ottawa Police, and we need to make sure we will. And I know in dealing with the former chief, it was understood that this was the medium-term to longer-term goal, and that we would get on a program where we would hire more officers till we get to the point that's a reasonable number versus the population and the crime involved. And so that was introduced last year. We're in the middle of it now, and there's a projection that police will hire and fill out that number this year or next year. And I don't see how we ask the police to meet the needs of the guns and gangs problem and then turn around and pass a motion like this. It's just inconsistent. We can't say both things at the same time. So in my ward, I don't believe anybody is out there supporting defund the police movement, and they certainly see the need for more officers to deal with a problem that, if it gets further out of control, will be a problem for the city just in terms of its identity. So I won't be supporting the motion, although I am happy that there's a recognition today that the budget is a question of setting priorities between different well-meaning and well-needing operations. Thank you.
Thank you, Councillor. Councillor Aglai, please.
Thank you, Mr. Mayor, and thank you, my colleagues. This is a really tough one for me. It's like I'm wearing 2 hats. It's like I'm wearing the ward councillor hat, and like I'm also wearing the chair's hat. To answer the question that's been posed, I think, by Councillor Brockington and also to a certain extent by Councillor Hubly, do I think 2.5% is going to let public health do the job that it should be doing in terms of responding to COVID and also providing core services? No. The answer to that is no. Where I have difficulty is what the solution is to get there. As everyone knows, some of our funding comes from the province. Most of our funding comes from the province, and I'm working on a motion in that regard to address that in part with the assistance of Councillor King, which hopefully we'll be able to introduce at the end of this meeting for consideration next meeting. In a perfect world, the budget recommendation would read, that public health also gets the benefit of 3% and not 2.5%. The public health be treated the same as the police services. I agree with Councillor Deans. The police services is going through significant change at this point in time, attempting to respond to issues around them, cultural issues within their service, and issues within the city. But I equally don't think you will ever find a more challenging time for public health. I hope to God we never find a more challenging time for public health in our city than dealing with a global pandemic and its impacts on our community. In a perfect world, as I say, this recommendation would be amended to say today, so we're not going back in effect stealing it from Peter to pay Paul, but we would know the rules going in. In a perfect world, that would say 3%. And I don't know if that change can be made today with the good graces of my colleagues in council, but that would put everybody on equal footing, I think, in terms of dealing with the budget going forward. And we're not going to be dealing with it after the fact to, again, take from Peter to pay Paul. Because, again, I'm not going to lie to you, and Dr. Etches didn't lie to you. 2.5%, I don't think is going to do it. We're not dealing with supporting our young parents. We're not dealing with dental services for the elderly. And what's on the table now in terms of support from the city is very much appreciated, and Mr. Kanalakis, very much so, both in terms of dollars and people. But the issue becomes, that takes care of COVID, maybe. But again, does it get it back to where we want to be foundationally in terms of providing the core services the community expects us to provide? So I guess my question is to the clerk at this point. Can we amend? What would it take to amend? And I think Councillor Deans is messaging me that she'd be prepared to second this. What can we do today to amend from 2.5% for public health to 3%? What would that take in terms of process, Mr. Clerk?
Right, can I just clarify, Councillor? Public health also gets 1.5% assessment growth, so they're getting a 4% increase, not a 2.5% increase. I think that's important to remind members of the public who are watching.
I understand that, Mr. Mayor, but as I understand it, the police also get the benefit of that assessment growth as well.
That's right.
And their base is 3%. So I'm just trying to level it out, and I'm waiting to hear from the clerk as to what process-wise would have to happen.
Mr. Mayor, reading the report, it would be an amendment, I suggest, to a recommendation 2A1 in the Roman numeral 1 from 2.5 to 3. And again, I would suggest that's subject to the treasurer's correcting me.
If I can ask a quick follow-up, Mr. Clerk, should that amending motion be brought today, and should it fail, does that restrict in any way public health when we get into the actual budget deliberations to, in effect, go down the Peter steals from Paul to pay? To pay? Like, can we put things on the table at that point that would take money away from another department or agency's budget and put it into public health? That's something I'd like to avoid if we can, but I'd like to know if the amending motion fails today. Do we still have that right and option?
Mr. Mayor, if the amending motion failed today, you would still have that option at the Ottawa Public Health Board.
So I'd like to move that amendment, and I believe Councillor Deans has messaged me saying she would be prepared to second that amendment.
All right, what's the amendment, Councillor? Can you read it out?
Sure. So it would be in accordance with what the clerk just suggested, and he can correct me if I have this wrong, it would be amending paragraph 2 sub A sub 1 so that the citywide tax levy, which includes funding for library and public health, be increased by no more than 3% for 2021 for the purposes of public health or something. I'll look to the clerk for the exact wording, but it's to give public health the 3% plus growth that OPS is asking for or is being provided in the direction.
And how are you funding that? Because that would obviously bring us above 3% tax increase. Councillor?
No, I hear you, Mr. Mayor. And as I understand it, and again, I look to the clerk, at this point, we're doing directions. We're not doing line by line. So we're setting the parameters. We're not doing line by line. So I'm not being asked at this point, as I understand it, to say, well, don't pay for that road work or don't pay for that splash pad, but instead pay for this program. What I'm asking is to set the overall structure for funding for the overall budget.
So let me get this straight. You have not submitted a proposal, a budget proposal. The board hasn't dealt with this. The Chief Medical Officer of Health did not ask for it while she was with us for the last 2 hours. And now you're coming forward with an amendment to a motion which will increase the tax rate for every citizen. That's the bottom line.
Well, Mr.
So
Mayor,
I'm quite prepared to take this discussion and meet with you and with the Chief Medical Officer of Health, the City Treasurer, and the Chief Administrator, the City Manager, to come up with ways on how we can deal with the budget. Because part of my discussion that I was going to talk about is that I do not want to let the province off the hook. As you pointed out, they provide 70 to 75% of the funding of all OPH programs. And for us to simply go and move into what really is a provincial responsibility, puts us in this position where the province will say, great, you've already increased the budget of Ottawa Public Health. You don't have to come to the province. I want to work with the province. They just announced just a few moments ago 150 contract tracers are coming to Ottawa to help us out. So they're in a giving mood because they recognize that they have responsibility for public health. For us to go and simply change on the floor of council and increase the amount of money without finding a funding source, it lets the province off the hook. I'm not interested in doing that. I think we have a good relationship with the province, and I think we can work closely with them, as every public health board is going to, because we had some success, if you recall, Councillor, when the province in their first budget cut their the funding significantly to public health units across Ontario, and there was real pushback. The mayors and boards of health worked on that. So I think it's far too premature at this point to bring forward that change until we have a chance to sit down and get a lay of the land with respect to Ottawa Public Health and what its needs are in 2021, and your board has a chance to comment on that.
If I can ask quickly, Mr. Mayor, I want to understand what commitment you're making here today in terms of this motion for amendment not proceeding.
So my understanding is, Mr. Kanellakis, the increase from the 2.5, I guess, to 3 would result in what? Is it $116,000? Is that correct?
That's correct, Mr. Mayor.
So I'm suggesting to you, leave that with us, and we will find a way to deal with your issue, but we will find a way to pay for it. So you get the best of both worlds. So we're dealing with $116,000.
I want to know what's, Mr. Kanellakis, your calculation there, please. Sorry.
The increase in the public health budget by that amount effectively amounts to $116,000 additional tax room that's required to fund our portion of public health budget.
And that's part of the solution. That's part of the solution, just so we're clear, but it's not all of the solution, Mr. Mayor. Work has to be done with the province.
Correct.
And it may well be. You're right. We have not had this discussion in front of board, but the way our process works, we're here before we're in front of board. So I guess what I'm saying is, I appreciate the offer from yourself, Mr. Kanellakis. I want to make it clear, though, 116, while it would put us on an equal footing with police services in terms of the percentage, is not going to solve the problem. So that doesn't mean that I will not be standing in front of you if I accept this compromise when it comes budget and saying we need to shift some projects around, we need to shift some pockets around in order to get back to some of the core services that people also expect us to deliver. Does that make sense?
I fully agree with you and support you on that, but I think the problem was that I think most people were caught off guard by the surprise that what you're asking for is a $116,000 increase, which is not going to do a lot, as you know, at OPH. So our job over the course of the next couple of months is to ensure that the province lives up to its responsibility, which has primary responsibility for health under our Constitution, and fund between 70 and 75% of all our operating costs. Just one other point of clarification. One of the reasons why the police budget is higher is because they have full responsibility for their capital budget. As you know, the city provides the funding for the capital budget for Ottawa Public Health. So they have a major project on the books in the south end of the city and Councillor Meehan's ward for the South End Police Station. So that's why there's that differential between the 2.5 and the 3%. Is that a fair assessment, Mr. Kanellakis?
Correct, Mr. Mayor.
Okay.
So if I can wrap up quickly, Mr. Mayor, I would ask for a little bit of discretion here because we've had some back and forth, but I'm prepared to table my motion with Councillor King with regard to my role and your role and the province's role at the end of this meeting to be dealt with at the next meeting. I'm also prepared to take up your offer to sit down with Mr. Kanellakis to look at this, as long as, again, everybody understands that 116 isn't going to solve the problem. My indication, my intent there was to say we should be at least at an equal playing field in terms of how the money's divvied up as police services is. But you're both quite right. This is not going to solve the problem. We may have to look elsewhere for other pockets of money, and there may be some of that stealing from Peter or taking from Peter to pay Paul in order to allow public health to both deal with COVID and also to deal with the ongoing need for its core services to be out there to deal with many of the issues the councillors have brought up. So if we're all clear on that, we're all accepting of that, this isn't the end of this discussion, it's the beginning of this discussion, and that we may well be coming back here asking for significant shifts of money, but I'm happy to work. I'm happy to work with you. I'm happy to work with Mr. Kanowakis and with the treasurer to find those pockets of money to be able to deliver core services to our residents.
And
I'll leave it at that.
And just one final point, it also gives us all an opportunity, as we did on the one-on-one council meetings that I had with the city manager, to identify cost savings that are not priorities this year in the midst of a pandemic that can be taken from one budget, put to the other, and still respect the tax cap for taxpayers. So happy to engage in that discussion and dialogue over the course of the next several weeks. Along with the province, we'll have to get our provincial MPPs involved as well.
As I said, my motion will speak to it. My motion and Councillor King's motion will speak to that, and I'll introduce that at the end of the meeting.
Okay, if you could share that with my office as well, I appreciate it. Okay, thank you. Next is Councillor El Shantiri, please. Questions and comments on the motion.
I think Sarah's got the one that didn't have.
Councillor El Shantiri?
Yeah, but your mic is cutting out.
Go ahead.
Okay, thank you, Mr. Mayor, and I almost forget what we were talking about because we got sidetracked with something I haven't heard of. Consider I'm on the public health board. I haven't heard the budget direction from the board, but now we're dealing with the motion from Councillor Menard, which is to reduce the police budget and increase public health budget. So I find it ironically, and I don't want to repeat what some of my colleagues said, but for all the changes and all the extra training and all the extra community engagement in policing, for all the recommendation to diversify the police service, how do you think you're going to diversify if you don't hire a new from the marginalized community? You know, with the union structure, the seniority will stay there and we just don't hire and we stay where we are. So I hope we'll give it some little bit more thought about this. If OPH need help and support, we need to work together with the OPH to find that support for them and the budget. But at the same time, let's talk to the police budget on the budget itself. In a pandemic like this, if you have an outbreak, have you ever thought if you have an outbreak in policing, what would that happen to our city? And this summer alone, even with the pandemic, we had all of us more call for policing than we ever did before. Policing to the beach, policing to the waterway. We have more speeder on our road. We have more impaired on our road. The last check, we had 16 in the month of October. By 10 of October, we had 16 impaired charges, which is in the past we have 1 or 2. So, folks, let's not kid ourselves and to rob one budget to give the other. I don't think that's the way to go. I think each budget should be reviewed on its own. And for all the things we're asking police to reform, I don't think this will help reducing their budget. Thank you, Mr. Mayor.
Thank you, Councillor.
Of course, I will not be supporting the motion.
Okay, thank you. Councillor DeRose, please.
Thank you, Mr. Mayor. I will be very brief. I just want to offer a few comments. The chief has been really doing a great job, and what we heard today, that his anniversary is coming up. Our chair board deems that she just came back from her recovery. We need to give them a chance to work together collectively, and we need to listen to her direction. She represents the council at the board, and she's the chair of the board. We heard her loud and clear, what she'd like to do. We're here to support her. We're here to support the chief. In the last few months, all what we've been getting call about speeding and policing in our communities. So I would recommend this is not the way that how we deliberate the budget. We gave budget direction, and let's, like Councillor Chantier said, let's deal with each budget on its own. Thank you, Mr. Mayor. This is my comment.
Thank you, Councillor. Councillor King, please, on the motion.
Thank you, Your Worship. And while I understand the sentiments of my colleagues and support the collective push towards police modernization and reformation, I unfortunately will not be supporting this motion, as the police service is currently undertaking a restructuring exercise. The reforms which the police service announced this summer are designed to address the goals of rooting out systemic racism, which was declared just this summer as a key public health issue by Ottawa Public Health, along with increasing diversity in the workforce and improving the relationship between officers and the communities that they serve. It is important that we support the crucial reform that Chief Slowly has just begun to undertake. The Chief has acknowledged the need to redesign long-standing structures and systems that exist within the police service to ensure that they are more equitable and inclusive. In order to achieve these overarching and realistic changes, the police service will require the appropriate financial resources to undertake this reform. Removing resources at this time would undercut and undermine efforts at reforming one of the root causes confronting the OPS, which is systemic racism, which I was addressing when I was inaugural co-chair of the Community Equity Council at the police service before I was elected. Community members in Ottawa have long recommended that the OPS acknowledge and address issues of systemic racism that exists within the police service. They had previously called on the OPS to hire and promote racialized officers, address officer discipline for racist behavior, extend race-based data collection to on-foot street checks, and monitor performance on key equity measures. Members of the Black and racialized communities have also called for the Ottawa Police Service Board to hold the Chief of Police and OPS accountable for equitable policing. In order to address these concerns, the Chief introduced the creation of the Respect, Values, and Inclusion Directorate, which is designed to incorporate a whole-of-service approach concerning issues of workplace harassment, discrimination, human rights issues, as well as ethics, equity, diversity, and inclusion principles. During the 2020 budget process, I asked the new chief whether OPS had adequate resources for the equity, diversity, and inclusion initiatives, and we both concurred at that meeting last year that more resources are required. I believe that both the chief and the board are committed to meaningful cultural change at OPS, but that the changes needed must be much more rapid, and especially concerning equity, diversity, and inclusion in order to build public trust. Consequently, in June, I supported the OPS in establishing a partnership with the City of Ottawa's new Anti-Racism Secretariat to ensure that the police service considers leading practices to address systemic racism. I also noted that our police service should work more closely with city services, including mental health services, and expand the kind of organizations that police collaborate with to tackle social problems. There needs to be a clear commitment to investing in community organizations long term. This is why over the summer I called for the federal government to put $15 million into community services in our city over the rest of this council term so that we could expand community and public health investments and reduce the expansion and the reliance on the criminal justice system in Ottawa. As the city engages in reimagining the role of the police, it must include a sustained commitment to equity, inclusion, and diversity, and that can only be achieved if the police service is providing the necessary resources to make these important changes. While I won't be supporting this specific motion, I will not, however, support the underlying direction, as I agree with several councillors today that we need to adjust our approach to budget directions and timelines to address the challenges confronted by the COVID-19 pandemic. Thank you, Mr. Mayor.
Thank you very much, Councillor King. Councillor Harder, please.
Thank you, Mr. Mayor, and I'm proud to say that I've served on both the Ottawa Police Service and the Ottawa Public Health Boards. In the inaugural Ottawa Public Health Board, in fact. And while how we're set up today looks like Hollywood Squares, but it isn't. Let's make a deal, or a shell game. And we haven't even started our budget deliberations. I know that Councillor Eglai and myself and Councillor Meehan have one coming up. I think it's the 27th. So I don't know about the rest of you, but I haven't talked to my community about it. I let them know that we're going to have this conversation and encourage them to be involved. So here we are today, out of the blue, total surprise. Let's make a deal, because that's what we're talking about. I mean, you know, you can try to figure out where we're going to take money from to, as Councillor Luloff said, to rob Peter to pay Vera, and Vera is going to need a lot of help. We don't know what that looks like. We do not know how much money we're going to need. We don't know how much support financially we're going to get from the province and the feds. And we need that information, because we could be totally wrong with what our requirements are. And we're also going to have a very tough conversation about what we're going to spend the taxpayers' money on. And yes, you're right, Mr. Mayor, we're going to have to decide to defer some of the things that were planned for next year. It's just a fact, but we don't know that today. And all we're being asked today, okay, is to vote on the proposed 2021 budget directions, timeline, and consultation process. That's it, okay? It's not how are we going to manage to give Councillor Deans and her police services more money, because you know what? As you said, Councillor King, so much work has to go into the police services with regard to changes that I don't know a police officer, for example, who wouldn't welcome taking the mental health part of their jobs out of Ottawa Police Services. But are we ready to talk about that today? No. And again, do we know what Ottawa Public Health is going to need? Because here's the thing about Ottawa Public Health. Yes, they're playing a critical role. Yes, they're in a leadership position. But they're backed up by a number of departments and staffs here at the city as well. And we can't start stealing from them, because economic development recovery is going to be crucial to the success of our city. And when I met with the mayor and Mr. Kanellakis, they will tell you that's what I talked about. We need to be making sure that our investments there are going to sustain this city, grow this city, be first out of the gate in many cases for prosperity, because that's how we're going to pay for many of the things that we've talked about today and many of the needs that we don't know we have. So I encourage you to vote down I don't know whether we have two amendments anymore, whether we just have one, but regardless, let's stick with what we're supposed to be doing with what the public is expecting us to do today, those that are even paying attention. And that is just like saying, okay, here's when we're going to talk about it. Here's what the timelines look like. And this is how we're going to connect with all of you folks. That's it for me, Mr. Mayor.
Great. Thank you, Councillor Harder. Last speaker before we go to wrap up with Councillor Menard is Councillor Kavanagh, please.
Thank you very much. And I thank my colleague, Councillor Menard, for moving this motion in terms of getting us to talk about this and getting us to think about this pretty heavy-duty subject. One of my concerns as a member of the board for Ottawa Public Health, right from the very beginning, and this is to do with the previous provincial government, is how chronically underfunded Ottawa Public Health is. Its budget was frozen for years and years and years. And then, now we're in a crisis and it's being diverted to something that's absolutely crucial. And my first thought is, I don't want to let them off the hook. The province needs to pay more into Ottawa Public Health. That is what bothers me the most. I don't want to bail them out on that, because that is crucial. That is important. This is health after all, and we do a lot more than anybody else. I mean, let's be reminded that one of their plans was to get rid of us altogether and merge it with many others. So I think that we have to to look to the province to do the right thing and fund it thoroughly. The concept of the different budgets is complicated. There's no doubt about it. And I want to give my total respect for Councillor King and Councillor Dean's remarks in terms of the move in the right direction that the police are taking. I have some confidence in our new chief, and I want to make sure that it goes in the right direction. I'm really concerned about a lot of things, and I don't think they can be solved by police. I'll be honest that not everything's going to be solved by police by a long shot, and we need to look at that budget very carefully, and we have to make sure that it's spent on the right things. I appreciate that they're working more with the neighborhoods. That's a positive thing, and I appreciate that they're looking at the mental health issue and the sexual assault issues. These are crucial. It doesn't mean it's free reign by any means, and I trust our chair to make sure of that, because this is important. Nobody wants to see the budget being misused. It's got to be used directly for what it's for. We've seen a direction in other places where things have not gone very well, and I'm quite concerned that, well, let's face it, the defund movement is about very bad judgment in the past, really bad judgment on how police budgets were spent and the direction they went. But I think we're going to make a difference. I think we're going to have good leadership on this, and I think that we have to do the right thing. We have a lot to accomplish, and we have to get on it. So I think this is important, and I'll certainly raise it in the discussions that we're going to have, because we are going to have discussions with the public. I've got meetings set up, and I want to hear from them as well. So I want to thank colleagues for raising this, but at this point, I think we have to look at it in a different way. Thank you.
Thank you, Councillor. Does anyone wish to speak before Councillor Menard wraps up on his motion? Anyone who hasn't spoken? Okay, Councillor Menard, wrap up, please.
Thank you. I'm hearing people concerned about the process, but this is the process set up for us that you voted for at the start of this term. I didn't vote for it, but it was voted through at the start of the term. I want to clarify, the province has said they will cover part of the COVID-19 response. It's the other services that are not funded of OPH that are suffering, and which is exactly what Dr. Etch is referring to today. Those are not being funded. We've closed dental clinics, 6 nurses available for the entire city for other services. They're strained, and our core services are suffering. $100,000, that's not going to cut it. $4 million certainly would help. And so to the comments of some of my colleagues, we've been involved. Delegations to the police board have been there. We've contributed to the community safety well-being plan, spoken to the chief, listened to the hundreds of people that are emailing us on this. And, I'll have notice of motion later on at this meeting reflecting other pieces of that involvement. But other cities in Canada are ahead of Ottawa. Edmonton City Council, they approved 20 different actions towards police reform, including an $11 million budget cut or reallocation. We're talking about $4 million here. Other cities are reviewing models for non-police-led intervention. We haven't started that. In Ottawa, we've been subjected to a barrage of inappropriate and criminal behaviors and incidents, and we shouldn't just ignore those. These are not my words. This is what the reports read in the last few months alone. Young man dies after falling 12 stories during Ottawa police raid. Ottawa police officers charged in tow truck corruption investigation. Ottawa police filmed and mocked 9 women. Ottawa police threatening to feed a tenant to the fish. Deputy police chief facing more charges of sexual harassment. Ottawa police officer in kickback scheme charged with planning ATM heists. Again, these are articles. Chalk artists say they were questioned by police over critical messages. Ottawa police plan to buy almost $700,000 worth of replacement guns, new tasers. Local groups call for removal of Ottawa police union boss over alleged sexist comment. 14 women reporting sexual assault and harassment by other officers in the last few years. Accusations of racial profiling after a traffic stop for supposedly ineligible license plate stickers. Ottawa police detectives suspended over racist meme. reports of Ottawa police stealing cash during a raid. And, you know, this is just the last few months that we're seeing these headlines. Something has to change. And over the last while, we've seen a tripling of the police budget. This is while we have only seen the needs of people grow. So while we starve the services that actually prevent these human needs from recurring in the first place, we drastically enhance the criminalization and policing of those who could use public health, drug prevention, harm reduction, wraparound supports, and culturally sensitive services. You don't get that with policing. You get that with public health, and we need to change. Let this be the start of it. Regardless of how this motion is voted on, let this be the start of a bigger change in Ottawa than we've been seeing. And I'll come to the police board and speak there, absolutely. But we're doing a lot more than that, and this would be the start of this type of intervention. So I urge you to vote in favor of this motion, and let's work on this together to really change the culture that we've seen in policing in this city.
Thank you, Councillor. I'll offer a couple of comments. Thank you to all members who offered their opinions. Certainly appreciate Councillor Dean's, as chair of the Police Services Board, her opposition to this motion, and Councillor King, who, with the will of Council, will be a new member of the Police Services Board at the end of this meeting. I just want to just clarify a couple of things. First of all, this very much is part of the defund the police movement, plain and simple. No one uses that language very often around this council table because it has I think, negative connotations, because the vast majority of people that I speak to, and I get to speak to a lot of people in community groups, are very supportive of the police, but they recognize they're far from perfect. And by passing this motion, we completely undermine our new police chief, who has made it his effort to reform and restructure the OPS. And the way to do that is not to simply, at the floor of council, say we're going to cut your budget by several $1 million, because you know who gets hurt above and beyond the public who won't see as many community police officers? It's all of the new diverse police officers who have been hired in the last round, because of course under the collective agreement, the older you are in the system, the more you're protected. And those people who have just been recently hired are the ones that are more women, more visible minorities, more members of the LGBTQ community. Those would be the first ones to get cut or wouldn't be hired because the funding is not there in place for them. This notion that, you know, COVID has really clamped down on the number of calls, well, it's back to pre-COVID levels, according to Chief Slowly, who told me the 5-year average, they're back at that right now. We've seen a 17% increase during COVID of domestic violence calls. That's 438 extra calls as a result of COVID-19, as a result of disgusting and illegal behavior by men towards women. We also recognize that public health is facing a challenge when it comes to its budget. But as I said in my comments earlier, this is not the time to simply show our hand to the province to say we're going to make up for all of the shortfall. We need the provincial government, we need the federal government to continue to support this vital agency in its time of need because of the calls that they're dealing with and the fact that they can't do all of the business they normally would do. But I'm not interested in defunding the police or slashing them by $4 million. Particularly when we have a new, progressive, thoughtful chief who is tackling these issues head-on and doing it in a very thoughtful, methodical, and respectful fashion. So I would urge members, please do not support this motion that would cut the police budget by millions of dollars, that would not allow the chief to carry out his important reform work with the Ottawa Police Service. And let's not kid ourselves with respect to the funding for public health. I think it was thrown in this motion. It sounded good, I suppose, that, look, we're giving the money to a great organization, Ottawa Public Health, in their need. We will work with Ottawa Public Health, as I made a commitment to ensure that they have the necessary resources to do the vital work that they're entitled to. Alors pour moi, c'est important d'appuyer les services de police et certainement.
So right now, I think this is the time to support our new chief of the police services. Make sure that they have the finance the funds needed to put forward modification. It is also important for our council to support Mr. Slowly and all the members of the Ottawa Police.
Chief, who is celebrating, as I mentioned, his one-year anniversary, I believe, in just a week's time. And I'll call yeas and nays and urge members to vote against this motion. Madam Deputy Clerk.
Councillor Harder?
No.
Councillor Cloutier?
No.
Councillor Luloff?
No.
Councillor Eglai?
No.
Councillor Leeper?
Yes.
Councillor Hubely?
No.
Councillor Giroux?
No.
Councillor Moffat?
Councillor Moffat?
No.
Councillor King?
No.
Councillor Tierney?
No.
Councillor Dudas?
No.
Councillor Suds?
No.
Conseil Fleury?
Oui.
Councillor Gower?
No.
Councillor El-Shantiri?
No.
Councillor McKenney?
Yes.
Councillor Meehan?
No.
No.
Councillor Menard?
Yes.
Councillor Kavanagh?
No.
Councillor Shirelli?
No.
Councillor Kitts?
No.
Councillor Brockington?
No.
Councillor Deans?
No.
Mayor Watson?
No.
4 yeas, 20 nays.
Okay, so that loses on the report as presented. Carried? Yeas and nays. Should we put the same yeas and nays? Agreed? Same yeas and nays?
No, Mr. Mayor, I'll be voting no.
Okay,
Yeas and nays, please.
So we'll do yeas and nays on the FEDCO report.
Councillor Harder?
Yes.
Conseil Cloutier?
Oui.
Councillor Luloff?
Yes.
Councillor Eglai?
Yes.
Councillor Leeper?
No.
Councillor Hubely?
Yes.
Councillor Giroux?
Yes.
Councillor Moffat?
Yes.
Councillor King?
No.
Councillor Tierney?
Yes.
Councillor Dudas?
Yes.
Councillor Suds?
Yes.
Conseil Fleury?
No.
Councillor Gower?
Yes.
Councillor El-Shantiri?
Yes.
Councillor McKenney?
No.
Councillor Meehan?
Councillor Meehan?
Sorry. Yes.
Councillor Menard?
No.
Councillor Kavanagh?
No.
Councillor Shirelli?
Yes.
Councillor Kitts?
Oui.
Councillor Brockington?
Yes.
Councillor Deans?
Yes.
Mayor Watson?
Yes.
18 yeas, 6 nays.
Okay, our next item that was held by Councillor King is cycling safety review of high-volume intersections. Councillor King, questions and comments?
Thank you, Your Worship. While the federal budget will not be determined for some time, we know that the economic situation will require some sort of stimulus. We anticipate that there will be money available for active transportation, and staff has already taken time and costed 15 locations that should be identified for potential inclusion in future projects, and a further 15 that require review. The Class D estimates for all projects listed in Document 3 would amount to $32 million, as outlined in the report. Of course, with all additional considerations, such as utility or hydro costs, the true amount required to implement this will be much greater, and thus priority must be applied. My understanding is that staff is already beginning to look at other cycling infrastructure projects that were beyond the scope of this report. In the event that federal infrastructure money does become available, my direction is that staff should prioritize the list of intersections in Document 3 of the report by which intersections had the most cycling collisions and the most amount of vehicular and cycling volume combined. The most high priority of these intersections should feed into the overall active transportation list of projects that would be developed to be included for implementation. Thank you, Mr. Mayor.
And I believe the staff, Mr. Manconi, you're supportive of this direction?
Yes, we are, Mr. Mayor.
Okay, thank you. Thank you. Anyone else on the report received? Received? Okay, disposition of items approved by committees under delegated authority. The council received the list of items approved by its committees under delegated authority. Received? Motion to adopt reports. Motion portant adoption de rapport. Councillor Eglai, please, seconded by Councillor Deans.
Thank you, Mr. Mayor. Internal Affairs Committee Report 16. The Committee Report 17, Planning Committee Reports 30 and 31, Transportation Committee Report 11, and the report from the clerk entitled Summary of Oral and Written Public Submissions for Items Subject to the Planning Act Explanation Requirements at the City Council meeting of September 23rd, 2020, be received and adopted as amended.
On the motion, carried. Motions of which notice have been previously given. We have two. First one by myself, seconded by Councillor Deans. We'll put that up on the screen, and I'll offer some comments and then ask Councillor Deans to offer her comments and then open it up to anyone else who'd like to speak to it. Councillor Deans and I brought forward this motion because the Ontario Police Services Act currently does not provide for the authority for the Chief of Police or the Ottawa Police Services Board to suspend a police officer without pay when that officer is charged with or convicted of a serious offence under the laws of Canada. This is not acceptable, and frankly, it's eroding the public's trust. Ce n'est pas acceptable, et franchement, ça mine la confiance du public. We are all disturbed by the media reports of police officers continuing to receive their full pay even while facing charges and serious and even criminal misconduct. Locally, the media have reported several local cases of officers that have been convicted of serious crimes that remain on the public police payroll. Earlier this year, an Ottawa police officer was convicted of assault causing bodily harm by a Quebec judge after he was found to have assaulted his girlfriend. He has been on paid suspension since being charged in 2017. Even more recently, an officer who pleaded guilty to threatening to kill his tenant remained on a paid suspension from the time he was charged in February 2016 until the time he pleaded guilty to the Police Services Act disciplinary charge this summer. There's no doubt that these public reports are diminishing the public respect for and confidence in the integrity of police services across the province. Il n'y a aucun doute que ces rapports publics
There are no doubt that these reports will reduce the respect and the trust among the police services.
All the women and men who serve with integrity and with a commitment to public service as paramount. That being said, I want to reinforce that these officers are the exception to what is otherwise an exemplary police service. During every police board meeting, we are presented with dozens of letters of commendation. I'll provide just two examples of the type of positive feedback that OPS members receive on a daily basis, and I quote, I'm writing you in advance of the 14th anniversary of the suicide of my 18-year-old daughter. I should have written to you a long time ago, but I wanted to tell you that I will never forget how the members of your force handled the situation that day. They were all very professional, but more importantly, were sensitive and kind to me as I screamed and cried while they and other emergency personnel worked to try to save my daughter's life. Other people were present, the coroner, firefighters, and paramedics, but it's the police officers that I remember. I will always be grateful for what those officers did that day, and if it is possible, after all of this time, I ask you to pass along my thanks to them, end quote. And another example from the last few weeks, quote, I was moving my belongings from my old home following an abusive relationship. 2 officers were present during this time and exhibited professionalism, situational awareness, dispute management expertise, sensitivity, and objectivity. They made me feel protected during this ordeal. Officers like this are a benefit to Ottawa, end quote. After years of lobbying, including by my colleague Eli El-Shantiri, in 2018, the Ontario government introduced the Safer Ontario Act to modernize policing in the province, including provisions for the suspension without pay of police officers who were charged with serious offences in order to address these concerns. Since then, the Ontario Chiefs of Police Association have also passed a resolution calling on the government to make the necessary changes to the Police Services Act. This legislative change is a tool that is available everywhere in Canada except Ontario. We need the Government of Ontario to bring their legislation up to date. Nous avons besoin du gouvernement de l'Ontario pour mettre
We need the Ontario government to update its legislation.
Police boards also passed a resolution supporting a suspension without pay for officers charged with a serious criminal, federal, or police service act offense or charged under judicial interim release order. Just for clarity, the motion only calls on the province to put into effect something that the current government passed last year and is delayed putting into force. Officers convicted of corruption, charges of violence, threats to tenants, or death threats simply have forfeited their right to collect a public salary. That being said, I think it's also important to note that the grounds on which a chief would be able to suspend an officer would be fairly limited. These conditions are limited to only after a conviction where there is a sentence of imprisonment or whether the officer is in custody after having been charged or has been released with conditions that prevent the officer from performing his or her duties as a police officer. This is not intended to be unfair. Le but n'est pas d'être.
This is not intended to be unfair.
Will provide the protection to officers resulting from allegations or unsubstantiated accusations, but it will provide some additional authority when a conviction has been formalized through the courts. For example, where the officer has been charged with a serious offense for something that is unrelated to the duties of a police officer, i.e. off-duty conduct, the following conditions must be in place. The chief has at least started the process to terminate the officer in relation to the conduct. The chief would likely be successful in terminating the officer, and where the failure to suspend the officer without pay would bring discredit to the reputation of the police service. As you can see, there are safeguards in place, and suspending a police officer without pay is not something that could be done where there has just been an allegation or an accusation by someone. Je tiens à remercier le chef Slowly.
I would like to thank the chief for his collaboration on this topic, as he wants to promote changes within the police services of Ottawa.
Collaboration on this issue, and for his dedication in bringing forward a culture of change to the Ottawa Police Service. I also want to thank Councillor Deans, the chair of the Police Services Board, for seconding this motion, and I ask you to consider supporting the motion to help bring Ontario legislation in line with all other jurisdictions in Canada. Councillor Deans, please.
Well, thank you very much, Mr. Mayor, for moving this motion. It's my pleasure to second the motion. The Police Services Board at our last meeting passed a very similar motion to this one as well. This year alone, 10 members of the Ottawa Police Service have been suspended, 4 charged with crimes, 4 charged with misconduct under the Police Services Act, and 2 not yet charged. That's just this year alone. And several other members have been suspended with their full pay for several years. This really leads to public mistrust in the system. Now, I can tell you I receive letters frequently from members of the public saying, why haven't you suspended these people with without pay, or why haven't you just terminated them? And the short answer is because we can't. It's frustrating for me as the chair of the Police Services Board to not be able to do that. It's very hard to message to the public why these people are still on the payroll. And, you know, I know that there are those who believe in the principle, as I do, of, innocent until proven guilty. But certainly if we were to get this legislation and be able to suspend people with egregious charges against them, if they were found to be innocent, they would then receive their retroactive pay. But it is very difficult to just continue to pay them, sometimes for years on end, while they've been suspended for really egregious acts while wearing a police uniform. And that's what's frustrating. And I also think for all of those great officers out there, the men and women that wear the uniform with pride and work to keep this community safe, it's frustrating for them as well because it undermines the entire service. And I think if we were to get this legislation and be able to suspend without pay or terminate those who have committed or are charged with committing egregious acts, it's a ripple effect. It sends a message through the entire organization that this kind of behavior, which may have in some way been tolerated in the past, is no longer going to be tolerated in the future. And that we are demanding better from every single member of the service. We've talked a lot today about change, about the absolute necessity of change inside police. As the chair of that board, I absolutely recognize the public is demanding change. And this is one way we can send a loud and clear message of change, that change is coming to the OPS and that we are serious about it. And so for all of those reasons, I ask all of my colleagues to support this motion. Thank you.
Great. Thank you, Councillor. Councillor El-Shantiri, please.
Let me begin, Mr. Mayor, by applauding you and my colleague for bringing up this motion. We had 206 meetings or conference call, 3.5 years, working with Justice Tulloch, and he made 29 recommendations. One of them, or the top one of them, is suspended without pay. Today, that report has been on the shelf. It's been shelved since the new government took over. There is a process, and just because a police officer found guilty of something doesn't mean you're going to suspend them without pay, but there is a process. But some of them will drag the process for 6-7 years, knowingly they're not coming back to the job, but yet they can still receive their payment. Ontario is the only province in Canada, Mr. Mayor, the chief doesn't have the authority to suspend someone without pay. So I applaud you for the effort, and I hope you will accept a friendly amendment. I would like to recommend you send your motion to the big city mayors, which is you are a member of. As you know, the big city mayor, or the big 12, as we call them in policing, they represent the majority of the police in the province. And I think it's very important for, I can assure you, they supported this effort before, and they would be more than happy to support it today. And also, copy can be going to the Ontario Association of Police Boards, who used to lead this modification to the Police Service Act. As a friendly amendment, I believe it should go to the large city mayors with your motion, Mr. Mayor. Thank you.
I think you're referring to the mayors in Ontario, correct, Councillor?
Yes.
Yeah,
sorry,
okay,
yes.
that's a friendly amendment. Councillor Deans, you okay with that? And to the police board, so if the clerk could make note of that amendment, which is friendly. Thank you, Councillor El-Shantiri. Councillor Shirelli, please.
Yes, Your Worship. What is the current process to arrive at the same thing?
Sorry, I don't quite understand your question. Right now, there isn't a process because the chief has no authority to suspend without pay.
He does have the authority.
Well, Councillor Deans, I think disagrees with you. I'll ask the chair of the board to comment. Councillor Deans.
The chief has the authority to suspend, but he does not have the authority to suspend without pay until there has been a conviction with a jail term. So no one has that authority at the moment without a change in legislation.
That's correct. Anything else,
so
Councillor?
This motion then would only allow the suspension without pay after a conviction?
No, it also references other examples. For instance, if someone has done something off duty that is brought into this dispute, the reputation of the police service. I gave one example, for instance, when the officer off duty was trying to threaten and bully and scare a tenant. Nothing to do with his duties as a police officer, but he was kept on the payroll with pay for a significant number of months, and the chief couldn't do anything about it.
Was he charged under the Police Services Act?
Sorry, I didn't hear that.
Was he charged under the Police Services Act?
Maybe Councillor Deans knows. He pleaded guilty. I know that, and his only punishment was he was demoted, I believe, for 12 months from one rank to another. That was the extent of the punishment.
Okay, well, that's obviously Police Services Act. So we're going to have somebody else impose their version of what the outcome should be over the process.
No, it's going to be up to the chief.
Yeah, well, it'll be the chief's idea of what the outcome should be over the Police Services Act process.
We're giving the power to the chief, and if you don't support that, then that's fine. We'll count you as nay. But I think the chief deserves, being the only jurisdiction in all of Canada that doesn't give some authority to the chief to deal with some individuals who have acted illegally or improperly to diminish and tarnish the reputation of all the other police officers in Ottawa.
It may not give it to the chief, but it does exist under the Police Services Act. So there is a process, and this motion really is to allow the chief to punish somebody before the process has occurred.
Well, I don't agree with your interpretation, but if you're obviously not satisfied with the motion, you can amend it or vote against it.
Okay. Thank you.
Councillor King, please.
Thank you, Your Worship. Over the past several months, we have heard loud and clear that our residents expect concrete steps towards the reformation and modernization of our police service. Residents want accountability. Police accountability involves holding both individual police officers as well as law enforcement agencies responsible for effectively maintaining public safety while treating individuals fairly and within the bounds of the law. Like any public organization, our police service needs a strong, healthy work culture to operate effectively. A culture of accountability in law enforcement is of particular importance. Our police service needs to create a system of internal checks and balances to make sure officers carry out their duties properly and act with integrity. Police accountability ensures that officers can work together effectively, that they can trust their commanders to make ethical decisions. They know that their fellow officers will make the needs of the police service and the public ahead of their personal interests. A culture of accountability in law enforcement also builds trust between the police and the community. The public expects the police to have the highest standards. When police violate the rules, they break public trust and lose credibility. In 2008, the Ontario Ombudsman stated in a report that the province's system of police oversight failed to live up to its promise due to a complacent culture and a lack of rigor in ensuring police follow the rules. This ultimately makes policing more difficult, as people are unlikely to cooperate with police if they do not trust them. When the police see that mechanisms are in place to enforce police accountability, or when the public sees that, they are more likely to deem police functions and actions as legitimate. One such mechanism would be the ability for Ottawa's chief of police to suspend officers without pay when police officers engage in wrongdoing. The Ontario Association of Chiefs of Police have been asking for this power since 2014, when they passed a resolution calling for the Government of Ontario to make necessary changes to the Police Services Act to provide chiefs of police with the ability to suspend without pay, since Ontario is currently the only province in Canada that requires suspension with pay, except when an officer is sentenced to jail time. The standard practice of giving charged police officers paid leave must end if police are to be held accountable for their actions and to limit the erosion of public trust. This type of reform requires provincial action. That's why I'm happy to support this motion brought forward by the Mayor and Chair Deans. We need to ensure that we examine methods of increasing accountability and explore removing legal barriers that prevent future disciplinary action for police misconduct. Thank you, Mr. Mayor.
Great, thank you very much, Councillor. Anyone else on the motion? On the motion, yeas and nays, please.
Councillor Harder.
Yes.
Conseil Cloutier.
Oui.
Councillor Luloff.
Oui.
Councillor Eglai.
Yes, thank you for your efforts.
Councillor Leeper.
Oui.
Councillor Hubely.
Yes.
Councillor DeRose.
Yes.
Councillor Moffat.
Yes.
Councillor King.
Yes.
Councillor Tierney.
Yes.
Councillor Dudas.
Yes.
Councillor Suds.
Yes.
Conseil Fleury.
Oui.
Councillor Gower.
Yes.
Councillor El Shantiri.
Yes.
Councillor McKenney.
Yes.
Councillor Meehan.
Councillor Meehan.
Oh, absolutely.
Councillor Menard.
Yes.
Councillor Kavanagh.
Yes.
Councillor Shirelli.
No.
Councillor Kitts.
Yes.
Councillor Brockington.
Yes.
Councillor Deans.
Yes.
Mayor Watson.
Yes.
23 yeas, 1 nay.
Thank you. Next is a motion deferred from the council meeting of September 23rd. Councillor Menard, seconded by Councillor Gower, and this is a replacement motion. So, Councillor, if you could introduce the motion that you want us to debate and put it up on the screen, please, and tell us the difference between the two.
Yes, thanks, Mayor. I'm not going to read all the whereas clauses because we've already had a very, very long meeting, but I will read the therefore be it resolved that clause, and that is that Council direct Mayor Watson to write a letter to Ontario Premier Doug Ford and Minister McNaughton requesting that the provincial government establish job-protected sick leave. Excuse me, I just want to make sure I've got the right one here. Write a letter to Ontario Premier and Minister McNaughton requesting that the provincial government work with the federal government to establish seamless job-protected sick leave that allows workers access of up to 10 days leave related to COVID-19. And the reason why it's a substitute is that there has been some federal action since our last discussion, which is good to see starting, but still gaps remaining within the provincial framework that governs workplace relations. It also takes out the portion of permanency in the second. The legislation is permanent as it is, which was raised by councillors as a concern last time around, and starts the process, in providing workers with seamless access to adequate sick leave. So, the benefit in terms of sick leave can be accessed with, right now by folks very rarely if they're sick more than 50% in a week. And the fact that there's, virtually very difficult to receive the benefit that provides less than full wage recovery for days missed, meaning workers can only apply for the benefit a week after they were sick. And so there's still several gaps in the federal legislation that's necessary to look at provincially here. The other piece I wanted to address is around small businesses and other businesses. There's no financial effect to those businesses. This is a government initiative and would be worked on collaboratively between the federal government and provincial government. So I just want to make sure folks are aware of that as well. And just, finally, there is some Provincial Employment Standards Act. That is not a paid sick leave. It's job protection for those who miss work without any pay. And we're talking about paid sick leave here. It's important that we put this in place because we're requesting folks to stay home when they're ill, but if they don't have the supports financially to do that as a result of COVID-19, many will continue to go to work. And so we can't be saying, look, stay home if you're sick, but not have any benefits to do so when there's already so many people living paycheck to paycheck in Ottawa. And so this would be a real important piece for us to get behind and ask the province to work collaboratively with the federal government for a seamless program. Thanks, and I'll turn it back to you, Mayor.
Okay, thank you. I have a number of people who want to speak on this. Councillor Hubley, please.
Thank you, Mr. Mayor. My curiosity with this motion is I worry that it's going to be a disincentive for hiring, but the councillor is saying there'll be no cost to business owners, and I'm just wondering how that works. If an employee is on someone's payroll, who's going to pay them for this leave that the councillor wants created? And is he suggesting the government set up a payroll for every Canadian that's working? The other question I have is, how does this impact employees that already have sick leave? Do they get an additional 10 days? What's going to be the threshold to qualify for the sick leave? What's going to stop someone from just saying, okay, I'll take the next 2 weeks off because I've got this new leave? I'm just wondering where all these checks and balances would be built in here so that it doesn't negatively impact the people that are creating jobs for everybody. Does the council want to answer that? Or?
Yes, absolutely. I wasn't sure if you're asking me or somebody else. What we were requesting would not burden employers financially in any way. The federal program is set up in a way that is paid out federally. It's not for people that already have job-protected sick leave. It's for those that don't. There are still numerous gaps that exist, and within Ontario, those gaps are wide. And as the revised motion states, the province will be working collaboratively directly with the federal government based on the program they've implemented to ensure that all workers have access to this. There are several ways that either the federal, provincial governments can provide this benefit, and there's other options for employers if there is a future program where employers are mandated to do this with supplemental benefits from the provincial and federal government. So the way the federal program is set up, it is a program direct to residents they apply for federally, not through their employer.
So no municipal involvement other than it would have to be somehow worked into our employment systems. Is that correct? You're just looking for a letter to be sent so that we get involved in another level of government's business. Because it's not ours, employment standards.
I wouldn't say that. It's just backing up our medical officer of health who is asking people to stay home if they're sick. And it's very difficult for people on low incomes or paycheck to paycheck to do that if they don't have that option financially.
Okay, and last question was, did I hear you say you removed the clause that called for this to be a permanent program?
The second clause that you had mentioned last time, Councillor Hubley, has been removed.
Great. Okay. Thank you, Councillor Menard. Thank you, Mr. Mayor.
Okay. Next, we have Councillor Dudas, please.
Thank you, Mr. Mayor. Councillor Menard, Councillor Gower, I really appreciate that you've taken some of the feedback that has been given and adapted it to this revised motion. But I still question, and playing into what Councillor Hubley said, why are we playing in other jurisdictions? I mean, I know we do it often enough in other cases, but oftentimes it's related to us. But employment standards, the province has a very robust Employment Standards Act, and in fact, infectious disease emergency leave speaks to emergency leave that is far beyond sick leave. It speaks to anybody in any case in respect to keeping your kid out of school, awaiting COVID results for your family, if you're working 2 jobs, if you're prohibited from working the other job, preventative measures. So, I mean, there's a lot of aspects in there, and I get what you're trying to go for, and I respect that. I'm just wondering, when does it come to the point that we stop trying to trample on other jurisdictions in terms of the province? Like, this is their bailiwick. So I'm kind of confused as to what our intent here as a municipality when we're trying to tell them how to run the employment standards when there is protections in place for emergency leave.
Yeah, I mean, this certainly is asking other orders of government to assist. It's COVID related to your direct, which is, we've been sending several letters COVID related to the other orders of government. To your direct point, though, around the Employment Standards Act and infectious disease emergency leave, as you know, it's not paid sick leave. It's protection if somebody does take that leave, but not paid. And so very few people access that are paycheck to paycheck. We're talking about a formal mechanism for paid sick leave to prevent people from going to work if they are sick. That's what this benefit would allow, and we're just adding our voice to others who are also requesting this.
Councillor Dudas, anything else?
No, thank you, Mr. Mayor.
I just want to clarify one point, Councillor Menard. You indicated to Councillor Hubley that you'd remove the on a permanent basis, but I still see it in the motion on the third to last paragraph. It says at least. Sorry?
It should be there, Mayor. That was removed, and be it resolved that clause.
No, it's it says here, whereas the report recommended that all provincial, territorial, and federal jurisdictions update their employment standards to require employers to provide at least 7 days of paid emergency leave on a permanent basis. Is that no longer part of your motion?
No, it's not. The be further resolved to it, and the federal legislation as it stands is a permanent piece of legislation. Your way is pointed out in our city, so I just appreciate it.
So I'm just asking the clerk, what, Madam Deputy Clerk, I have it listed as still on the third to last paragraph. Is that part of the motion still?
Mr. Mayor, I believe that the whereas or the recital refers to the report that has been referenced by the councillor in his motion. It is not part of the resolution or the portion of the motion that would be approved, Mr. Mayor.
So I'm just wondering, Councillor Menard, it says leave on a permanent basis. The intent, my understanding, was just during COVID. Do you want it permanently or just during COVID?
Mr. Mayor, the therefore be it resolved clauses speak to the motion's direction. That is the intent. So as you see in the resolve, that's the intent, and we've removed that second clause Councillor Hubley was speaking to.
I guess I'm still confused because I still see it here as it's not in the therefore be it resolved, it's one of the whereases. The only therefore be it resolved that I have is that Council Director Mayor Watson to write a letter to the Ontario Premier and Minister McNaughton requesting that the provincial government work with the federal government to establish seamless job protected sick leave allows workers up to 10 days leave related to COVID-19. Is that the current therefore be it resolved that I have?
Yes, that's correct. The other one you were referring to was the whereas clause, and it was only related to a report that had previously been reproduced on this. It's still accurate in the whereas, and the therefore be it resolved is also accurate now that you have gotten in front of me.
Councillor Dudas, did you have anything else you'd like to raise?
I don't believe I have any further questions. I just, once again, it's about the fact that we have MPPs elected across our city that can bring these issues forward in the legislature. You know, as a municipality, we would most certainly need to work with our businesses and our employees and our residents and protect them in every way possible. But I'm just not sure how this addresses that. Once again, I appreciate the work you've put into this, both to the mover and the seconder. And I know what you're trying to do, and it is COVID related. But there's federal legislation that applies to this, and there is existing provincial. It might not be perfect, but we have mechanisms to work through this. Our city has enough to chew on. We don't need to bite anymore. So I don't have any further questions. I can't support this, but I do appreciate the intent you were trying to go for.
Okay, thank you. Councillor Gower, the seconder of the motion.
Thank you, Mr. Mayor, and thank you, Councillor Menard, for raising this. You know, when this came up 3 weeks ago to Council, there was concern about the impact this would have on small businesses. Obviously, COVID-19 has had a significant impact on every business, every sector in terms of economic health. One of the best ways that we can get Ottawa back to full health economically, social, mental health, physical health, is to reduce the spread of COVID-19, the transmission of COVID-19 in our community. We heard today again from Dr. Etches. We've been hearing for the past 7 months from Ottawa Public Health about where there are issues and gaps in our ability to stop transmission. And I noted in a response to one of Councillor King's questions today, Dr. Etches said it's important that people feel supported to stay home when they are sick. We also know that there are current gaps in the legislation and the funding and the availability of sick leave for residents. And we know that is a barrier to people taking the time off that they need to look after their children or to look after themselves and keep COVID-19 out of their workplaces. I think it's entirely appropriate for our council to ask the mayor to write a letter to emphasize our support for full maximum sick leave coverage so people are free to take time off work so they are not feeling any temptation to go to work while they have symptoms of COVID-19. And I think this would help support the efforts of our Ottawa Public Health officials in eliminating transmission from our community. And I would encourage my colleagues to support this and raise it any time that they can to their MPPs and MPs as well. It's important to our community. Thank you, Mr. Mayor.
Thank you, Councillor Gower. Councillor Harder, please.
Thank you, Mr. Mayor. I'm not going to be supporting this. I've thought about it a lot, and I've looked at it many ways, and the assurance that it's not going to cost our small businesses, well, I share the thoughts that Councillor Dudas so aptly put forward. You know, I don't know how many of you, and I'm not being rude here, but there's very few around the table, I think, that at some point in their life, you know, their career has not been in business. You know, there's a reason that Eli is the liaison to the Ecobia. That's been a big part of his life. I spent still, even at my age, and long have I've been doing this, more than half my life in business. And I can tell you, because clearly a lot of you aren't understanding, that it is incredibly difficult for the same businesses that have just had their doors shut as of 12:01 Saturday morning are the ones that are having a heck of a time getting any staff because of CERB. Now, CERB has come back with $500 a week, I think it's going to be. So in addition to that, where it's already difficult to get anybody to come in and work because they're making more money by staying home, is wrong. And it's easy for us, I think, when we are leaders of such a large organization to lose sight of the fact that many aren't. And it's hard in this city when we have so many people employed through at some level of government to understand how frightening these times are. But to think that there's not going to be a burden to the businesses, the small businesses in our city, is foolish in the extreme. So I don't know if we have any other speakers. We do, but I'm hoping for yeas and nays, and I will not be supporting it. Thank you.
Okay, thank you. Councillor DeRuse.
Thank you, Mr. Mayor. I just want to, Councillor Harder took lots of my comment, and I just want to support. I agree with Councillor Harder and Councillor Duda summed it up very well. I cannot support that motion. And we've been giving you enough task and you send letters to all level of government, and this is another letter that we are interfering with labor fraud. So we cannot support that. Thank you so much.
Okay, thank you, Councillor Drews. Councillor Brockington, please.
Thank you, Mayor. Have our staff been able to dissect the intent of this motion? The reason I deferred it from our last council meeting was to give us an opportunity to better understand the impact, particularly on business. I understand the health arguments that are being made, but is there anyone from our economic development department that can comment?
Mr. Kanalakis or Willis, anyone had a chance to analyze the motion?
Mr. Mayor, the last time I said that staff want to take a look at it, and we looked at it from both the Human Resources and City Solicitor looked at it. David White's on, and I think it'd be appropriate for him to give some comments on the motion. Mr. White.
Mr. Mayor, staff have looked at it. I understand that there was some work done in the economic development side. That said, the motion that's before council today is not a complete reproduction of the one that was produced by the notice. The fact of the matter is the unpaid sick leave, the sick leave that exists for COVID, which, as Councillor Dudas noted, is the infectious disease emergency leave. That's an unpaid leave. That's available for as long as the employee qualifies. So it's not capped in any way. In the intervening time, what the federal government has done has been to introduce what they're calling the Canada Recovery Sickness Benefit, which provides a benefit of, as I understand it, $500 for up to 2 weeks. Now, I would liken that arrangement, for example, to parental and maternity leave that's available to employees. The leave itself is provided by the province, which ensures that an employee that takes maternity or parental leave is not disadvantaged or is not kind of subject to any penalty by an employee, and that they can return to their position at the end of that leave. And it's the federal government that provides the income replacement of whatever it happens to. I think it's 55% of up to about $55,000. So that the system that's in place here would be similar to that. The funding would come from the federal government in terms of the leave, but in terms of the impact, I think it'd be very difficult to quantify the impact on business of the let's say, unavailability of the staff who are on those leaves or in receipt of the benefit. I think that's likely an exercise that's beyond us.
Okay, thank you. Councillor Brockington, the floor is yours.
I just wanted to thank staff for their best attempt to better explain that to us. I understand the argument that Councillor Menard is trying to make about we don't want sick people at work, but also our businesses are overwhelmed right now with costs and shutdowns, and the fear of additional expenses that might be paid by the federal government at some point, I think are very concerning. So appreciate the discussion on this item. Thanks, Mayor.
Thank you, Councillor. So to wrap up, Councillor Menard, please.
Thanks, Mayor. I don't think there's much required, but just to alleviate the concerns around small businesses, what we're requesting would not burden those employers financially in any way, given the new federal program and our requests at the provincial government level. The government credits sick leave pay through various means, and the program is delivered through governments. As our revised motion states, the province would be collaborating with the federal government. And you got to think about a COVID-19 workplace outbreak, likely much more of a financial liability for employers than simply ensuring workers have access to seamless sickness safeguards. And in this case, it's government oriented. So during this time, it makes sense to make this request. I thank my colleagues for the debate.
Thank you, Councillor. I guess This has proven to be somewhat confusing for a lot of us around this table because there have been two different versions. There was clearly no public consultation. I think Councillor El-Shantiri will confirm this matter has never come up before the Council of BIAs. And I don't really support the notion that it's no cost to small business. It is a cost because if you have an employee who wants to take the leave for 2 weeks, 3 weeks, 10 days, that employer has to find someone to replace that employee. And that employee then has to be paid. So you're having to pay another employee, perhaps someone who doesn't have the skill set, so you have to ramp them up in terms of their ability. So there is a cost to business, there's a disruption to business. The motion that's before us doesn't even talk about paid leave. So if you look at it, it says job protected sick leave. So the word paid leave is not even part of the direction. And unlike the Ontario legislation, where there is no cap in terms of the number of days, there's a cap here of 10 days. So, we've confirmed by Mr. White that Ontario has legislation that protects these individuals, and that the federal government in their speech from the throne indicated that they were going to bring forward a new Canada Recovery Services benefit, which provides $500 a week. And as Councillor Dudas and a number of other councillors mentioned, this is really outside our wheelhouse. The easiest thing for us to do to look good to a certain group of constituents is to vote for a motion asking someone else to pay for the motion's contents. And my general rule of thumb is unless it has something directly responsible to us, I try my very best not to get into these motions where we're, asking another level of government to pay for something. So I would urge members of council not to support this. It's outside of our jurisdiction. How would you like MPs and MPPs to constantly be meddling in our business here at the City of Ottawa? I don't think we'd stand for it for very long. There's been no consultation with the small business community that will have an impact. No analysis done. I still don't know what the difference between the two motions are. It is outside our jurisdiction, and it's not clear if we're asking for paid leave or not, because, quite frankly, it says just sick leave with no reference to pay. So I'd encourage members to not vote for something that we clearly have absolutely no jurisdiction over. And I think we have enough issues we're dealing with the other two orders of government that we're depending on them to provide us direct funding for some of our important priorities, like public health. And I know Councillor Eglai has a motion to that effect. And we passed a motion dealing with the police. That is within our wheelhouse. We have that responsibility, the police, and we need the help of the provincial government. But this kind of advocacy where we don't put any money down on our own but simply ask another order of government to pay for it, where there's absolutely no consultation. If you recall, this was a motion that originally wanted, the mover wanted suspension of the rules of procedure, where there would be absolutely zero public consultation. So I don't know if the BIAs in Ottawa have been contacted or consulted on an individual basis. My understanding is collectively at the Council of BIAs, this has never come up, and it will have an impact on small businesses who, quite frankly, some of them are hanging on by their fingernails. You know them all in your own ward. You know, going down Main Street or Bank Street or Elgin Street or Montreal Road, some of these businesses are having a really, really tough time. So I'd encourage members to, I remember the late Royal Gallipo used to have a great expression. He said, stick to your own knitting. So I'd ask members not to support this, and we'll call yeas and nays on the Menard motion. Thank you.
Councillor Harder.
No.
Councillor Cloutier?
No.
Councillor Luloff?
Councillor Luloff?
No.
Councillor Eglai?
Yes.
Councillor Leeper?
Yes.
Councillor Hubely?
No.
Councillor DeRose?
No.
Councillor Moffat?
No.
Councillor King?
Yes.
Councillor Tierney?
No.
Councillor Dudas?
No.
Councillor Studs?
No.
Councillor Fleury?
Oui.
Councillor Gower?
Yes.
Councillor El Shantiri?
No.
Councillor McKenney?
Yes.
Councillor Meehan?
No.
Councillor Menard?
Yes.
Councillor Kavanagh?
Yes.
Councillor Shirelli?
No.
Councillor Kitts?
No.
Councillor Brockington?
No.
Councillor Deans?
Yes.
Mayor Watson?
No.
9 yeas, 15 nays.
Okay, next is motions requiring suspension of the rules of procedure. Motion exigeant la suspension des règles de procédure. Councillor Sudds has a motion seconded by Councillor Dudas with respect to committee assignments for Councillor Kitts. On suspension? Carried. Councillor Sudds, would you like to introduce the motion, please?
Off mute. Thank you, Mr. Mayor. So I have a motion in front of us, as the Mayor mentioned. I'll read it out for everyone's benefit. Whereas on December 12, 2018, Ottawa City Council approved the following committee and board appointments for former Ward 19 Councillor Stephen Blais, as recommended by the nominating committee. Number 1, Community and Protective Services Committee. Number 2, Transportation Committee. Number 3, Planning Committee. Number 4, Finance and Economic Development Committee. Number 5, Hydro Ottawa Holding Board Member. And number 6, South Nation Conservation Authority Board Member. Whereas on February 20th, Councillor Stephen Blais stepped down from key posts as a result of his candidacy in the February 28th, 2020 Orleans provincial by-election and associated unpaid leave of absence from City Hall. And whereas pending the outcome of February 28, 2020 Orleans provincial by-election, Council approved the following appointments arising directly or indirectly from the need to fill these key vacancies. On February 12, 2020, Council appointed Councillor Turney as Chair of Transportation Committee and myself, Councillor Jenna Sudds, as member of the Hydro Ottawa Board.
I think, Councillor, I may have the will of Council to suggest you go to therefore be it resolved. This is a good history lesson, but I think we can go to the therefore be it resolved. Thank you.
Happily go to the therefore be it resolved that Council approve the appointment of Councillor Catherine Kitts as a member of the following committee and boards for the balance of the 2018-2022 term of Council. Number 1, Agriculture and Rural Affairs Committee. Number 2, Community and Protective Services Committee. Number 3, Planning Committee. Number 4, Transportation Committee. And number 5, South Nation Conservation Board of Directors, replacing Councillor Luloff.
Okay, thank you for that. On the Councillor Moffat has a question. Councillor?
Sorry, thanks. Just a quick question on what's the rationale behind not being the Court of Revision? The way it works is generally the members of AIRAC form the Court of Revision. We deal, it's for the purpose of the Drainage Act to deal with municipal drains. There's a number of municipal drains in Cumberland Ward, so it's not entirely a bad thing for the Council for Cumberland Ward to be on the Court of Revision at such time that we need it.
So, Mr. Clerk, Mr. Mark, I'm sorry.
Yes, thank you. Mr. Mayor, the Court of Revision is limited to 5 members. And so with this, there are 6 on AIRAC, and one of them would not be able to, by statute, be able on the Court of Revision.
I'd be shocked if the 2 urban members were hard pressed to not be on the Court of Revision, but I'll leave it up to them.
You can review that at mid-governance. I'm sure it's a fight to get on the Court of Revision. I'm glad I'm not on it. So on the motion, carried. Thank you. The next motion is requiring suspension of the rules is Councillor Harder, seconded by Councillor Eglai. This is an interim control bylaw with respect to Woodruff LRT. So on suspension, carried. Councillor Harder, if you could introduce the motion? You don't have to read
Yes,
the whole
Mr.
thing,
Mayor.
but maybe give a sense of the purpose.
I'm going to defer to Councillor Eglai as this part of it is in his ward. Councillor Eglai?
Hey, Councillor Eglai.
Thank you. Thank you, Mr. Mayor. So the motion has to deal with the fact that this is part of the proposal for stage 3 of LRT. So this is an area that the city is looking at for the purposes of determining what sort of opportunities there are there for transit-oriented development, what sort of opportunities there might be for Ottawa community housing. So the purpose of it is in discussions with the planning department and with Steve Willis. The suggestion was to put this in place to allow planning to have a good solid look at this without worrying about any applications that may come down the road in the next year or so, and focus on how we can best make use of this opportunity for residents in terms of what kind of housing could go along there, what kind of buildings, what kind of uses. So it's a good news story, I think, for the purposes of the extension, which will run from my ward into Councillor Harder's ward, and that's why she was kind enough to partner up on this motion. And again, it will allow staff to undertake a study pursuant to the Planning Act in respect to the land use policies and regulations for this strip of land, which will change significantly in terms of its uses once the train goes through. So I'd ask everybody to please support it as a city building.
Okay, thank you, Councillor Eglai. Just looking to see if anyone has their hand up. So on the motion, carried.
Carried.
The next motion is by Councillor Harder, seconded by Councillor Meehan, with respect to a typographical error in bylaw 2020-279. On suspension, carried. Councillor Harder, seconded by Councillor Meehan. If you can just explain the typographical error, please.
I don't have it before me, Mr. Mayor. So perhaps you have it?
Sure, yeah. Let's see, I'll read the be it resolves.
Just the end.
Yeah. Be it resolved that the following changes be made to the staff report. 1, that item 2, the details of recommended zoning of document 3 be amended by replacing the text R4Z with the text R3Z wherever it appears. And be it further resolved that bylaw be placed on the agenda of the present meeting of council, which shall repeal bylaw 2020-279 and replace it with the correct details of the zoning as described in the amended report. And be it further resolved that no further notice pursuant to subsection 34(17) of the Planning Act. What's replacing 4 with 3? Carried? Carried. Adopté. Thank you. Next is a motion by Councillor El-Shantiri, seconded by Councillor Dudas, with respect to temporary road closures and further support. And I just wanted to, before I ask Councillor, we'll have to suspend the rules first. On suspension, carried. Just want to thank Chair Tim Tierney. I know he worked hard on this, and as did Councillors El-Shantiri and Dudas. But thank you, Councillor Tierney, for your leadership on this issue, and we'll hand it over for introduction by the mover, Councillor El-Shantiri, please.
Thank you very much, Mr. Mayor, and I'd like to echo your thanks for Chair Tierney. The reason myself and Councillor Dudas were moving this motion as we both on Mayor's Task Force on Economic Recovery, and this would deal with that. So I know there's a lot of whereases. If you like, I can read them, or I can just go for be it resolved. And this is basically to give delegate authority to the general manager. So let me read therefore be it resolved that council approve the following. Extend the delegation of authority to the General Manager of Planning, Infrastructure and Economic Development in consultation with the Director of Traffic Services to extend the current road closure to November 30th, 2020 as part of the City of Ottawa economic recovery effort. That any road closure past October 31st, 2020 be subject to an approved snow clearance and removal strategy between patio operators and the city, with all costs of the road closure are borne by the applicant, save for any city operational costs that are already part of the existing departmental budget. That winter row, patio, and a sidewalk be permitted throughout the winter, subject to an approval snow clearing and removal strategy between the patio operator and the city in consultation with the ward councillor. That winter row, patio on the roadbed beside the spot be permitted until November 15, 2020, unless a large winter storm event occurs, at which time they must be removed. And the city staff continue to work with the patio operators to encourage cafe seating options as alternative option to sidewalk patio and street side spots in consultation with the ward councillor. And the City Council encouraged the Province of Ontario to review the appropriateness of extending existing special provision related to the selling of alcohol, e.g. curbside pickup, delivery of alcohol, and celebration of permit approval, acceleration of permit approval timeless. And that right-of-way heritage and urban design service and roads are parking services present to Transportation Committee at their November meeting, a winter patio strategy after further consultation with Ottawa Coalition on BIA and best practice review of the effort of other winter cities. So, Mr. Mayor, the reason this motion came through without going to the committee because of the timing. So we need to give delegate authority to the general manager. I believe we have Court Curry from the right-of-way will answer any of question. I see some of my colleagues might have some question about this. But Mr. Mayor, this is one of the things your task force been working together with the business and Ottawa Coalition on BIA to help out, especially now with inside the restaurants is not permitted. I'm hoping my colleague will support this motion and we can just give an extra tool in the toolbox to our staff and also more than one place, Mr. Mayor, they need to have a consultation with the ward council, and I want to thank Councillor Lieber for bringing that up to this motion. So with that, I'll leave it for you, sir.
Point of order, Mayor.
Sorry, who was that?
Councillor Lieber, sorry.
Yeah, you're next on the list anyways.
Okay, I'm just wondering
hold on just a second.
As a point of order? Thanks. As a point of order, I'm just wondering if this is the most recent version.
Yeah, the clerk just told me that they're not sure if it is. They're looking for that right now. So if you just give us a moment. Do you want to ask any questions now while we search that out, Councillor Leeper?
No, I had my hand up to raise a point of order. Thank you.
So we'll come back to you once we find the final version. Councillor Fleury, the floor is yours.
Good day, Mr. Mayor. I'll be speaking on what I believe to be the revised version of this, assuming that is what is presented. I want to raise two elements of this. So I'm supportive. In theory, we have to do what we can to support our business community that's going through a really rough time. At the same time, I think it's important to set clear expectations. We might adhere to winter patios and support our businesses, but if in 2 weeks from now, our medical officer of health adds restriction to those, that investment can be soured. So, you know, we got into kind of a perfect storm over the last week with the provincial changes on what were business expectations. And I want to be clear that I will be supporting the motion, but it can't just be, it's supporting the motion and the reopening with the context we have today. As per my questions to Dr. Etches earlier in our meeting, she might add measures to those. So, you know, we have to respect that as a council. And furthermore, I just want to clarify that many of the business partners, many of the small business community in my area who have liquor license have greatly benefited from being able to do sale of liquor during the orders, and that's been greatly appreciated. So the intent here from that segment is really to make sure that some of those benefits that were created by the AGCO through this period remain. So I'm supportive of that element as well, which allows for diversification of revenue sources for the business community during this tough period.
I think my understanding, Councillor, is from my discussions with AGCO is that they have extended that option for licensed establishments, because that was a bit of a lifesaver for a number of businesses, the off-site alcohol sales. So that's going to continue. So we're just looking now for the final motion. The Deputy Clerk's just trying to track it down. So in the interim, we'll just go to Catherine. Councillor McKenney, please.
Thank you, Mr. Mayor. I'm very short comments. I'm also speaking to the new version that we will see in front of us. I do support it. I'd like to see what we had extended into for the next month while we come up with a plan. But it's really important that that plan is brought in front of the BIAs. I think that there was an argument just about 20 minutes ago that we don't go out and talk to our BIAs. And this is something that BIAs have got to come in front of us. They've got to be able to talk to us, and they've got to be able to tell us what has and hasn't worked. I can tell you that the Bank Street closure was very popular. The Somerset closure, the Frank, the Flora, it allowed those businesses to stay in business and to do enough so that they will still be alive next year. But it was exceptionally difficult, and getting the 2/3 of businesses on an entire block or entire street or an entire VIA is near impossible, and it actually works against the health of businesses. So I want to just put that on the table that, I ask that be removed from this motion so that, we actually can continue to do what we're doing. But when this comes in front of us again, we have got to have a discussion about that 2/3. If we are serious about helping small businesses, then let's do that. Let's not put up roadblocks to BIAs. Let BIAs decide what is best for them. Today I'll support this, but there will be a lot of conversation coming up, including who should be responsible for snow clearing. I think that I have some concerns that we're passing along some of our costs onto businesses, and for the future, when we discuss this at transportation back at council, I know that I won't be supporting that. Thank you.
Thanks, Councillor. So we have the new motion. I believe it's the section with reference to referring to ward councillors. So Councillor Leeper, you see that on the screen? I think you're up now. You're okay? Okay. Anyone else wish to speak to the item? If we could just let me see whose hand is up, Madam Deputy Clerk, because my screen is blocked now. Okay. Okay, so the motion that we're dealing with is the one that was just on the screen. I believe I got a thumbs up from Councillor Leeper. And yes, Councillor Fleury.
Would it be possible to put it back on the?
Yeah, we'll just put it back up. Which section did you want to see?
It was the AGCO section.
Yeah, so I think I saw that.
Go down.
Let's see here. Yeah, if we can put it onto the section where it's referenced the AGCO, there it is. Whoops, slow down there. Item 6, Roman numeral 6.
Thank you.
Okay, you're okay with that? Okay, Councillor El Shantiri, any wrap-up comments?
Mr. Mayor, I just want to thank I think your mic is on. I just want to say thank you to all my colleagues who contribute to this, and thanks to staff for preparing this motion, and we have the Mayor's Task Force and presented today. So I'm looking forward to everyone's support. Thank you.
Thank you. And we also have our Mayor's Economic Partners Task Force meeting later this week where the BIAs are represented, so I'll bring this forward as an information item. So on the motion as presented, carried. Adopté. The next item that requires suspension of the rules of procedure is with respect to COVID-19 and statistics and data from Councillor El-Shantiri, seconded by Councillor Dudas. Councillor El-Shantiri and Councillor Harder. I apologize. On suspension, carried. Adopté. Carried. Councillor El-Shantiri, you're busy today. It's back to you. Do you want to speak to your motion that's seconded by Councillor Harder?
Okay. Thank you, Mr. Mayor. And yes, Mr. Mayor, the motion moved by myself, seconded by Councillor Harder. Just a little bit of background to my colleague, especially the new one. I've been the mayor's representative on City Council with the Coalition BIA since 2005. Been working closely with the small business, also being the co-chair with the mayor on Economic Recovery Task Force. Like everyone else, on Friday at 3 p.m., we heard the news. So I'm going to read the motion, but then I put it a little bit in context. So whereas the province of Ontario announced on Friday, October 10, a series of measures aimed to blanken the COVID-19 transmission curve in the 3 Ontario regions, namely Ottawa, Peel, and Toronto. Whereas the province of Ontario acted under its emergency power to return certain sectors of the local economy to stage 2 restriction, including the closure of restaurant dining and the closure of gym facility. Whereas on September 30th, Ottawa Public Health provided the province of Ontario with guidance on restaurant and other public venues to inform the province's ongoing decision-making on public health measures required to mitigate the surging COVID-19 numbers. Whereas on October 13, Ottawa Coalition on BIA wrote to the Right Honourable Ford Premier of Ontario, Christine Elliott, Minister of Health, and Vic Fideli, Minister of Economic Development, Job Creation and Trade, to remind the province of its publicly stated commitment to allow for different COVID-19 measures in different regions to reflect potentially different data and local public health recommendations. And whereas the City of Ottawa, the province of Ontario, and the government of Canada recognize and have publicly stated that public confidence in decision made about restriction on residents, businesses, and society can only be succeed if there's a broad and transparency dissemination and sharing of information about data used by government and public health authority in support of such a restriction. Whereas Ottawa Coalition on BIA has asked the province to review and explain the Ottawa specific restrictions announced by the province on October 10. Therefore, be it resolved that Ottawa City Council support the request made by Ottawa Coalition on BIA to the province of Ontario to review the Ottawa specific decisions announced on October 10, based on the most current data and local public health advice, and there be a further resolve that Ottawa City Council ask the province of Ontario to provide the city and Ottawa residents with a better understanding of the data that was used to inform the Ottawa-specific COVID-19 restriction announced by the province of Ontario as a part of the October 10 decision. So, Mr. Mayor, just want to say thank you here to the chair of the Ottawa Coalition on BIA, Mark Koluski. He sent a letter yesterday at noon to the Premier. Today we just heard on you're saying earlier there's 150 supports that come into to Ottawa to help with the data collection. I'm just hoping my colleague will support this motion and will send a strong message to the province. We need that data so we can all stand shoulder to shoulder with the Ottawa Public Health on the Ontario Public Health and Canada Public Health and flatten the curve. So we want to work together, but I find this decision on Friday with the short notice to the businesses who prepared for the long weekend, who had to let their staff go for a month long on a few hour notice. I find it's very hard pill to swallow. I have to admit it. I had a hard time with that, but I stayed committed to public health and safety is override all those business decisions. But let's keep in mind it affects all of us. We have 6,200 businesses in the city of Ottawa. They together they pay over $250 million in property tax. They employ thousands and thousands and 10,000s of people of our residents in our city. So I believe they're not asking for any different than just give us the data. And if the data suggested some of this search come from certain places who's not followed the guidelines, I think Mr. Koloski in his letter, go ahead, shut them down, but don't rampantly close all the business with that decision. Again, I'm hopeful and I'm thankful the province today sent in, as we heard from you, 150 support staff to the Ottawa region to help collect that data and provide us with the evidence-based data why the decision was made, and hopefully I can count on your support, my colleagues. I know it's been a long day, so thank you very much for your patience.
Great, thank you very much, Councillor El-Shantiri. And as colleagues know, Councillor El-Shantiri is our representative chairing the Council of BIAs. So I appreciate the work that Mark has done. Does anyone have any questions or comments on Councillor El-Shantiri and Harder's motion? Carried. Adopted. Thank you. Our next requirement for suspension of the rules, the motion by myself, seconded by Councillor Deans, with respect to appointing Councillor King to the Police Services Board. On suspension, carried. So I'll just read the just a few of the whereases. Whereas on September 8th, Councillor Deans returned for medical leave and resumed her leadership position as chair of the board. And whereas Mayor Watson expressed his intention to cede his seat on the board and recommends to Council the appointment of Councillor Ralston King in his place. And whereas on June 10th, 2020, Council unanimously recommended that Councillor King be appointed as the Council liaison for anti-racism and ethnocultural relations initiatives, and he's prepared to bring the insights from this mandate to the Ottawa Police Services Board. Therefore, be it resolved that City Council approve the appointment of Councillor Ralston King to the Police Services Board. On the motion? Okay. Sorry, Councillor Deans. Councillor Deans, did you? I see your hand up. Go ahead.
Well, Mr. Mayor, I just wanted to say a few words on this topic. First, I just wanted to say thank you to you for sitting on the board for the last year while I was off on medical leave, and when Councillor Eglai permanently left the board. We appreciate you filling in. You've heard me say this many times. I've always thought that it was important for the mayor to serve on the Police Services Board. I think what's become apparent to me, though, is that the job of the mayor is very demanding, and the job of the Police Services Board is also very demanding, and it's hard to give the time to both that is required. And so, especially right now, we've been talking a lot today about the change agenda that the board is embarking on and how ambitious that is, and that takes a lot of time and commitment. And so with that in mind, I want to say thank you to you, Mr. Mayor, for your efforts over the last year, and also that I enthusiastically welcome Councillor King's nomination to the Police Services Board. I know he will bring new ideas and new perspective to the board, and I believe that his experience with the Ottawa Police Community Equity Council and his role as Council's liaison for anti-racism and ethnocultural relations will bring a unique experience to our board and will help us to navigate the path forward. So I look very forward to welcoming Councillor King to the Police Services Board. Thank you.
Great. Thank you very much, Councillor. And Councillor King, did you wish to offer a comment?
I just wanted to say thank you so much to my colleagues. Thank you to Chair Deans. And I look forward to working with the rest of my colleagues, my new colleagues at the Police Services Board on working on a path towards police reform. I think we know that change is necessary at our police service, and I'll endeavor to work hard to make that change with all of our partners in the police service a reality. Thank you.
Thank you very much, Councillor King, and we wish you the very best. Are there any other notices of, on the report? Carried? Carried. Any other motions requiring suspension of the rules of procedure from anyone? No? Okay, we're now on to notice of motion for consideration.
Mayor, Councillor.
Sorry?
Oh, apologies, it is for a notice of motion for consideration at the next meeting. I think you're going there next.
That's right, yeah. So notice of motion for consideration of subsequent meeting avec des motions par examen à réunion subséquente. Councillor Harder and Tierney, notice motion with respect to train whistling cessation. Councillor Harder.
Thank you, Mr. Mayor. This is the second time I've asked the council colleagues to support me. The first time was when we did the massive undertaking of the Green Bank via grade separation for safety in my community. This time it's Strandherd. It's a little over $100 million. It'll be completed in 2003, and we're having an overpass. We're also closing the crossing at McKenna-Casey, and we're putting a detour in between McKenna-Casey and the current Strandherd, which is a very small distance. I mean, to travel. So this, the rules in Canada are that there has to be a decision of a council that goes forward to, in order for VIA to make that decision through the temporary road detour grade crossing at mileage 6.84. And therefore, I'm asking at the next meeting that you will support that happening. Thank you.
Okay, thank you. And we'll see if Councillor Hubley brings his train whistle with them to that meeting. Our next motion, a notice of motion for consideration, our next meeting is by Councillor Tierney, seconded by myself with respect to the FCM conference. And as you know, Councillor Tierney sits on the national board, representing us very well at all FCM matters. Councillor Tierney, please. Just going to make sure his mic's on. Councillor Tierney. I'm not sure where Councillor Tierney is, but I'll certainly, as the seconder, this.
I'd like to know more detail. You heard Dr. Paul. I heard Dr. Paul this morning on TV Morning Live.
Mic is on.
Saying that, yeah.
Councillor Tierney.
Be related to.
Councillor Tierney. Councillor. Councillor Tierney.
I think he's otherwise engaged, Mr. Mayor.
All right. Councillor Tierney, are you there? All right. We'll come back to Councillor Tierney. I heard him. Next is the extension of the temporary mask bylaw. Councillor Suds, please, if you want to introduce that.
Well, thank you, Mr. Mayor. So as Council knows, of course, we did enact the temporary mandatory mask bylaw, which we do need to bring back if we would like to renew it. So the motion that, the notice of motion being put forward today is simply to that effect, so that at the next council meeting we can discuss, debate, and decide whether we will move forward with renewing the bylaw.
Okay, thank you. That's to be dealt with at our next meeting. Next is a motion by Councillor King, seconded by Councillor McKenney, with respect to racism and hate towards the Asian Canadian community. So Councillor King, if you'd like to introduce this, it will be debated at the next meeting.
Thank you, Your Worship. As Council Liaison for Anti-Racism and Ethnocultural Relations Initiatives, I want to strongly denounce the 2 separate hate-motivated incidents that targeted the Asian community in our city last week. Discrimination through prejudice, ignorance, and racial stereotyping has no place in Ottawa, and I'm proud that our council has collectively committed to listening and working with equity-seeking groups and Indigenous people to fight systemic racism together through the establishment of an anti-racism secretariat. In Ottawa, we have responded to requests by Indigenous, Black, Asian, and other racialized and religious communities to establish this anti-racism office that will work towards the elimination of systemic racism in our municipal government operations and services. And while it is important for our government to work towards the elimination of institutional racism, it's equally important for government to absolutely condemn individual acts of racism, which are designed to demean and oppress. As a consequence, I will wish to introduce the following motion, seconded by Councillor McKinney, that condemns these actions of anti-East Asian racism in our city. Whereas across Canada, there has been reports of more than 600 incidents of hate targeting Asians since early February 2020 began, according to Chinese Canadian groups. And whereas 38% of the reported incidents occurred in Ontario, and whereas there has been increasing reports of anti-East Asian racism occurring in Ottawa, including verbal threats, spitting, and intimidation. Whereas anti-East Asian racism, like all other forms of racism, has always existed in Canada and in Ottawa, but have simply been exacerbated by COVID-19. And whereas Ottawa City Council unanimously endorses the establishment of an anti-racism secretariat for the City of Ottawa as a commitment to holding the city to account for addressing systemic racism, therefore, be it resolved that Ottawa City Council unequivocally condemns any form of anti-East Asian racism being leveled against members of our community, and therefore, be it further resolved that the Anti-Racism Secretariat, in conjunction with Public Information and Media Relations team, launch a public awareness campaign on social media, promoting awareness of anti-East Asian racism and calling on the public at large to be an ally.
Okay, thank you very much, Councillor. We'll deal with that at our next council meeting, a very important topic. Councillor Menard has a notice of motion, seconded by Councillor McKinney, with respect to anti-Black racism. Councillor Menard, please.
Thanks very much, Mayor. And I'll just read the therefore be it resolved for next meeting. Therefore be it resolved that City Council encourage the Ottawa Police Services Board to undertake a public consultation and report outlining potential alternative models of community safety response that could A, involve the creation of non-police-led response to calls which do not involve weapons or violence, such as those involving individuals experiencing mental health crisis or drug addiction, and where a police response is not necessary, and B, reflect the city's commitment to reconciliation.
Thank you. We'll deal with that at the next meeting. I'm not sure if Councillor Tierney is back on. If not, I'm the seconder of the motion. I'll get, is Councillor Luloff able to second this motion? Was Councillor Tierney back?
Thank you, Mr. Mayor. Greatest apologies.
I was singing your praises. I was singing your praises as our rep at FCM. If you want to introduce the motion, please.
Great. If I could just get it on the screen.
Just get on the screen there. There we go.
Great. So, of course, we really love having FCM back in town, but with COVID and all the things that have shifted around, I'll just scroll down to the bottom and thank staff for the great work. We really want to showcase our city yet once again. So therefore, be it resolved that Council approve a motion as a measure of the city's support to be the host city for the 2025 FCM Annual Conference and Trade Show.
Yeah, that's a great feather in our cap. Obviously, to get FCM back here, it does wonders for our tourism and hospitality industry, and great to have municipal leaders from across the country in our own backyard. So we'll deal with that at our next meeting. Are there any other notice of motion for consideration of subsequent meetings? Est-ce qu'il y a des autres motions?
Yes, Mr. Mayor, I have one.
Okay, Councillor Egley.
Thank you, Mr. Mayor. This arises out of the discussions we were having earlier this morning, and has to do with funding for public health and our other funding partner than the city, which is the province. I'll just read it quickly. Whereas Ottawa Public Health has been responding to COVID-19 in Ottawa since the spring, whereas Ottawa Public Health has been forced to divert resources and funding from core programs to combat COVID-19, and this has created significant issues in delivering traditional public health services such as support for new mothers and dental care for those who cannot otherwise afford treatment, whereas Ottawa Public Health requires and will require additional funding going forward into 2021 to provide these much-needed services. Therefore, be it resolved that the Mayor, on behalf of Council, work with the Chair of Ottawa Board of Health to advocate to the Province of Ontario for additional funds for 2020 and 2021 to support core public health programs and initiatives negatively impacted by the local COVID-19 response. And I want to thank you, Mr. Mayor, for your offer earlier today to do just this and work with myself and public health. And I want to thank my colleague, Ralston King, for agreeing to second this motion. Thank you.
So if you're willing, Councillor, and the will of Council is there, it gives us a 2-week head start if we suspend and pass this right away. It gives us an extra couple
I am more
weeks
than happy to do that.
So on suspension, carried? On the motion as presented. Carried? Carried, good, thank you. So we'll get to work on that. All right, motion to introduce bylaws. Councillor Eglai, you have the floor once again. Seconded by Councillor Deans.
Yes, thank you, Mr. Mayor. That the bylaws listed on the agenda under motion to introduce bylaws, 3 readings be read and passed, that the following bylaws be read and passed in accordance with the motions approved at today's meeting. A bylaw of the City of Ottawa to repeal and replace bylaw 2020-297 being a bylaw to amend bylaw 2008-250. To change the zoning of the lands known municipally as 737 River Road, parts of 510 and 524 Bridge Avenue, I hope I said that right, part of 218 Hawkswood Drive and part of 351 Rosina Way, and a bylaw of the City of Ottawa to establish interim control for lands affected by the Woodruff Corridor LRT expansion.
Carried. Adopt A. Confirmation bylaw, Councillor Eglai and Deans, please.
Thank you, Mr. Mayor. The following bylaw be read and passed to confirm the proceedings of the Council meeting of October 14th, 2020.
Carried. Adopt A. Carried. Inquiries. Are there any written inquiries, Madam Deputy Clerk? Adjournment. Councillor Eglai, seconded by Councillor Deans, please.
Happily, Mr. Mayor. The proceedings of the City Council meeting of October 14th, 2020 be adjourned.
Carried. Adopt A. Just a reminder, members of the media, the press conference media availability will start at 4:35. That's in about 15 minutes, 4:35 on, I believe, YouTube. And meeting adjourned. Thank you all very much. Merci beaucoup.